Today is our last conference day, and my name is Humphrey. I do want to welcome you for this third day of our 57th Scientific Conference here in Kakamega. Before I continue, I'd just love to have one of us opening for us with a word of prayer, a volunteer. Then we can just go straight into the program. So let's get a word of prayer.
Let us pray. Our Lord, in the name of Jesus Christ, we thank you so much for this beautiful day that you have allowed us to see. As we start our activities for today, we pray that you shall guide us, that we shall be able to learn from them and even be able to grow out of them. Thank you for them that are on their way joining us. We pray that you shall continue to be with them and even to guide them on their way here. We pray this believing and trusting. In Jesus' name we pray. Amen.
Thank you. Thank you. I do hope that we are already online. Are we? So I also want to welcome our members who are following us, who are joining us via Zoom. As always, we are going to have our presentations. Then from there, we'll have a Q&A. So during the presentation, anything that perhaps you'll want to be clarified further, you can always note it. Then during the Q&A, you'll front your question. So to our first presenter, that is Patricia Koech. Patricia Koech, you'll be opening for us with a presentation on bacterial quality assessment of meat from selected butcheries in peri-urban areas. And I'll just politely ask you, we try to keep to the scheduled time because, again, when it comes to time management, that has been our biggest weakness. So if only we can improve on that, we can see that we dispense with the program today so that we finish as early as we had intended to. Thank you, and karibu, Patricia.
Thank you so much, Humphrey. Good morning, everyone. I hope that you slept well and you're doing well. Yes. So as they set up, my name is Patricia Koech, and I am a student at the University of Nairobi, where I'm pursuing my master's studies, and also a graduate fellow at ILRI. So I'll be presenting part of my MSc project work. Okay, so yes, as I had said, I am Patricia Koech, for those who are joining in. And this is part of my MSc work. Yes, so my work was to assess the bacterial quality of beef from selected butcheries in peri-urban areas. Yes, peri-urban areas of Nairobi. So the background to the study, meat and other animal source food are important to food security, to nutrition and income generation. And this is particularly important to the vulnerable groups in the society, like the young children, the pregnant and breastfeeding mothers, the elderly, and the immunosuppressed individuals in the society. And it is very important that animal source food be supplemented into their diets. However, meat, for instance, is prone to contamination by both spoilage and pathogenic bacteria. And I'm sure that most of us, if not all, have heard of food poisoning, and probably you've suffered from the same at one point in your life or know someone who suffered from the same. And this was a report by the World Health Organization, a report that was done in 2010. And the burden of foodborne diseases was described that in every 10 people, one person would fall ill to foodborne disease. so that maybe if you would count 10 people, one would suffer from a foodborne disease. And out of these, in the globe, 33 million adjusted life years would be lost to foodborne diseases. And unfortunately, 420,000 people die to these diseases yearly, a third of it being accounted by young children under the age of 5 years. And I'm sure that in Kenya we've had several cases of food poisoning, especially last December and beginning of the year. From the social events and the family gatherings, there were so many cases of the same in the news. And the Ministry of Health in 2020 in Kenya approximated that 70% of all the diarrhea are attributed to consumption of contaminated water and food. Unfortunately, in our country, there's no surveillance to attribute this diarrhea to specific food, so that you can say vegetables that contribute to this, meat contribute to this. But then from the same World Health Organization report, animal source food was associated to 40% of the global burden of foodborne diseases. And this is the reason why my study is on beef, which is one of the animal source foods. And to bring the study in perspective, this work is part of a big study being done at ILRI. And my work is in the baseline. So that is how it has been planned, so that we'll have the baseline to the study, which will inform the design of the intervention. And then a post-intervention survey will be done. And then evaluation of this intervention will be done to assess whether they are effective and if they can be scaled up to the whole country, because this is just being done in Nairobi. And this is done by the One Health Research Education Center in Africa, hosted at ILRI, in partnership with the VSF Germany, that is Veterinarians Without Borders. So why do we need to do this study? So informal market systems are common in Kenya and have been reported in butcheries, especially the low and middle income enterprise. And the flow chart to your right shows the meat supply chain. And for my case, the beef, where we have the farm to fork. And along the supply chain, it is complex, it's long. There are so many people involved, stakeholders involved. And at all these points, they present risks of contamination of the meat, starting from the animal, from the farmer. Before it gets to the slaughterhouse, there are middlemen. There's mixing of animals from different farms and risk of infection. Then it goes to the slaughterhouse. At the slaughterhouse, there's a lot of handling. There are equipment used. And we understand that in the gastrointestinal tract, there are commensal bacteria. But then if it comes in contact with the meat favors the growth of the same, so it's a risk. And then transportation to the butcheries, cross-contamination, the handlers, the equipments. And finally, at the butchery, which is the end node, this is where the consumer source their meat from. We have also handling, we have equipment, we have the storage conditions, we have the environment, and all these pose a risk of contamination. And then it will go to the consumer. That is another field that needs study and education because of the risk of cross-contamination. Unfortunately, in our country, we have very good policies, food safety policies, but then risk assessments are rarely done. And the enforcement of the existing regulations is weak. That is why when you go to the low and middle income enterprise butcheries, the violation of these policies is very high. And then now we have the high burden of foodborne diseases in our country, and this is coupled with the fragile economy and the poor infrastructure. Therefore, this calls for evidence-based studies to provide intervention that will address these food safety issues in a contextualized manner. So the objectives of my study were to quantify the total coliforms and the E. coli loads in the beef sold in selected butcheries in peri-urban Nairobi, to assess the meat handling practices in the same butcheries in peri-urban Nairobi. I'm sure this picture is familiar to most of us. If we source our meat from the butcheries or in where we stay, I'm sure you've seen how they display their meat as they sell. So the methods, we employed a descriptive cross-sectional study design in the study. Beef samples were purchased from some randomly selected butcheries in the peri-urban areas of Nairobi. And an observational survey was also conducted using a checklist in the ODK. I won't bug you with this, but this is basically the processing of the beef sample in the lab, where once we have the meat, we would process it, homogenize it to have it mixed up, and then we would do the serial dilution, and then the inoculation of the bacteria in the plates, and the confirmation, which we used malitov to get to know the bacteria present. And then in the results, coliforms, we basically did coliforms because these are hygiene indicators. And we did the basics of it because the lack of surveillance means that if we want to do, say, an intervention, we do not know what is the current status. So we looked at the hygiene indicators. These are the acceptable indicators of hygiene in the beef. And they were present in 98% of the samples. And out of this, 84% were above the acceptable regulatory limit. In addition, 76% of the E. coli were also above the acceptable regulatory limit. And the charts below, to the left, shows the percentage. The orange one is the 84%. That is the percentage that is above the acceptable limit of the total coliforms. And a very small percentage falls into the acceptable limit. And then, other than the coliforms and E. coli, several other species were isolated and identified. And these included Klebsiella, Pseudomonas, Serratia, Enterobacter, and several other. And for these several others, we grouped them based on their pathogenicity. And we had a bigger percentage in the chart to your right, the bottom right, a bigger percentage being in the opportunistic pathogens. Then we had a few pathogenic and unpathogenic. All these bacteria are important because first, the big proportion that is the opportunistic pathogens, in our population, we have so many people who are immunocompromised. And these opportunistic pathogens means if your immune system is not okay, it will be pathogenic to you. We have the pathogenic, including Klebsiella pneumonia, and then the others, like the Pseudomonas. We know that Pseudomonas is very, has prevalence of resistance, multi-drug resistance, and the multi-drug resistance would easily transmit to the other pathogenic. They may not be pathogenic, but if they have the genes for resistance, they can transmit to the pathogenic pathogens, bacteria. And then the non-pathogenic group are also important in the meat because all of this cause spoilage. So that will be an economic loss to the butchermen. And then in the observation data, 85% of the butcher attendants did not wash their hands routinely. This means they neither washed their hands before handling the meat nor after handling the meat. And this is a risk because they would handle the meat as they serve one customer, they go out there, they take a snack, they greet people, they come back, they handle the meat again. And you know, the way they would do it, they would go and handle the whole carcass as they cut whatever piece to the customer. And this is a risk of contamination because with the temperature and the continued stay, this bacteria will continue to proliferate. 91% handle money while selling money concurrently, and this is worrying because the money that we take to purchase our meat, for example, is from all over. 58% did not wear aprons. These are the personal protective equipment while selling the meat. Despite having them, they just hung them on the wall. And in the regulations, it is a requirement to have the PPE because of two reasons. One, to protect the meat from being contaminated. It should be clean. And then secondly, to protect the handler from getting infected by whatever pathogens are in the meat. But then for them, they do not do that. They would go with the street clothes, go to the lavatories, come back. And you remember, most of these butcheries, the space is very small, so there's a risk of coming in contact with the meat with the same street clothes, and the pathogens get to the meat. And then interestingly, 43% of these butcheries sold both raw and ready-to-eat meat in different forms. And you would find that most of the attendants who sell the raw meat also sell this ready-to-eat. If they don't just wash their hands, how about the raw meat that they will give you, the motora, the roasted meat, the stewed meat? So it is a risk, and it calls for action. And then in the observation, the first picture shows different meat types that have been stored in a freezer. So this butcher person has tried to have a proper storage for the meat as per the requirements to freeze the meat. But then, because of their inability to have different freezers and lack of knowledge, they have chicken, they have the beef, maybe even the goat meat, the liver, and all the offals, including even the carrier bags and the equipment, all of it there. So there's a risk of cross-contamination and contamination of meat and pathogens from one meat type to the other. So when they get it out of the freezer and come and display, these pathogens start proliferating. And that is the meat that the consumers come to buy. So there's a risk. And then in the second picture, this is the location of one of the butcheries in the study sites. And adjacent to it, if you can see, that is a drainage with untreated sewage. And this is barely 100 meters away from the butchery. So there are the flies, and it's just a risk of the pathogen in this sewage getting to the meat, because that is the door and the window of the butchery. And then another interesting finding, because most of us are vets, is that these butcher attendants, they have a lot of trust in the inspecting vet, so that for them, once the meat has been inspected by the vet, it has been stamped approved, they know that the meat is safe, and they seem not to have the idea and the knowledge that meat can get contaminated after inspection because of the handling and the contamination on the road. So for them, once it has been approved that it is safe, they do nothing about hygiene, and that is a big risk, because the consumers go and buy meat from these butcheries. So in the conclusion, the presence of these heavy loads of bacteria are indicators of poor hygiene in the butcheries. And additionally, the poor meat handling practices are observed, and this poses a risk of contamination of the meat sold to the consumers. This is a public health risk. Therefore, I recommend the need for education and training of the stakeholders in the beef supply chain on the appropriate meat handling practices. And the training should, I believe the training should be basic and continuous, because the people in the butchery are very dynamic. A person is in the butchery today, and tomorrow they are somewhere else. So if we have basic trainings, before someone gets to sell, they should be trained, and then continuous, so that if someone else has come in, they get these trainings as well. And then in the acknowledgements, I'd like to thank my supervisors for guiding me through this work. I'd like to thank ILRI for hosting me as I do the project, the university for offering me the opportunity to do the master's, BMZ and ORECA for funding the project, and finally, Nairobi County and VSF Germany for their partnership. Thank you.
Thank you, Patricia. Again, we are reminded that food safety is our core mandate, especially when it comes to food of animal origin. We get our second presenter, that is Victoria. She'll be presenting on meat safety knowledge, attitude and practices of slaughterhouse workers in Kajiado, Kenya. Karibu. And kindly try and keep time.
Please bear with my voice. I've had a cold, but I hope I'll be audible. My name is Victoria Kimindu from Calro Beef Research Institute, and my presentation is titled Meat Safety Knowledge, Attitude and Practices of Slaughterhouse Workers in Kajiado, Kenya. My study is part of my PhD project at the University of Nairobi, and it was funded by the Kenya Climate Smart Agriculture Project. So my co-authors happen to be my academic supervisors, Dr. Daisel Kaindi and Dr. Lucy Njue from the Department of Food Science, Nutrition and Technology, and Professor Samuel Githigia from the Department of Veterinary Pathology, Microbiology and Parasitology. Yeah, so briefly, I will give you an introduction. I'll tell you my objectives, my methodology. My results are rather bulky, but I'll try to summarize. Conclusion and recommendation. So as most of us can appreciate, slaughterhouses are a very important institutions that allow the transformation of living food animals to meat. In Kenya, we have around 4 levels of slaughterhouses, export slaughterhouses. And locally, there are 3 categories, category A, B, and C, that are categorized generally based on capacity of slaughter, but also due to other discrepancies. So there are around 1,500 category B slaughterhouses that kill between 6 to 39 cattle. And after the 2019 population census, we were informed that we were 47 million. In the same year, FAO projected that by 2050, that population would have doubled to around 96 million. And that demand, that growth will also lead to an increase in demand of animal-derived foods. So it is very paramount that for slaughterhouses to release safe and wholesome meat, they have to carry out slaughter hygienically and also handle meat hygienically. So the importance of this study was to look at what slaughterhouses can do in order to handle or deal with the present hazards as the emerging hazards come along. So my objectives were to determine the worker level of knowledge and attitude with regard to slaughter hygiene and meat safety, and also to determine the kind of practices that workers carry in order to decontaminate contaminated carcasses, as well as their medical practice. So my study was carried out in 4 sub-counties of Kajiado, Kajiado Central, East, West, and the North. And my selection criteria was that they had to be category B slaughterhouses along the Namanga, Bisil, Kiserian trade route. So I tested Namanga, Bisil, Kajiado Town, Isinya, and Kiserian slaughterhouse. And in order to meet my sample size, I included Kitengela, which is also close to Isinya, and Ongatorongai, which is slightly off, but at least they collect, they get a large number of their animals from Kiserian livestock market. So this experiment was done basically by a questionnaire. I developed a semi-structured questionnaire, which had 6 parts. Part 1 addressed the socio-economics of the respondents. Part 2 had 24 knowledge statements addressing personal hygiene, carcass contamination, meat-borne illnesses, and intervention by temperature control. Responses were either yes, no, or I don't know. And scoring was based on Bloom's cutoff points, where 100 to 80% was good, 60 to 79.9 was moderate, and anything below 59.9% was low. Part 3 assessed attitude. There were 8 attitude statements based on a 5-point hedonic scale, And the 5 descriptors were: I strongly agree with the statement, strongly disagree, disagree, neither agree nor disagree, I agree, and I strongly agree. Scoring again was based on the Bloom's cutoff. Part 4 assessed 13 practice statements on a 5-point Likert scale, and the descriptors were: I always do this, I often, I sometimes do this, I rarely, or I never do this. Part 5 assessed the medical testing practice of the workers, and 6 assessed carcass decontamination practices. So my data was analyzed by R statistics. My descriptive statistics were frequency and mean, and then differences in mean were tested by Kruskal-Wallis, and then a post hoc by Dunn's test, and any associations were tested by a chi-square. So straight to my results. For social demographics, just like in many other slaughterhouses across the country, it is dominated by middle-aged men, 96%, out of my N, which is 78, I forgot to mention. 78 was my total number of respondents. So 96% were male. The average age was 41. I'm sorry, I did not indicate that here, with the youngest being 24 years, and the oldest being 80 years. Household size, the average household size was 4 persons, but actually around 18% of the elderly, the respondents had had households of between 6 to 10 persons. Roles included cleaners, FSC is flayers, splitters, and eviscerating roles. There were halal killers, workers dealing with selling and transportation, and standing and even offal washing. So with regards to gender roles, the 3 females there, 2 of them carried out offal washing, and 1 was involved in selling and transportation. In training, only 7% of the 78 workers affirmed or proclaimed to have been tested in meat safety. 5% had halal slaughter training. 6% were trained in flaying. And I'd like to say here, when you ask them the outcome of the flaying, they mentioned that one thing they learned is how to reduce the number of defects on the hide, but they were not necessarily taught on the dangers of the hide cross-contaminating the carcasses. And then 80% of them had no other kind of training at all. Again, on training, out of the 15 who were trained in any kind of knowledge, 12 were trained in-house by the meat inspector. MI is meat inspector. 2 were trained by the Kenya Bureau of Halal Certification, and 1 claimed to have been trained by the meat school in Athi River. Again, a majority of the slaughterhouse workers, 62.8%, had basic primary education and did not exceed that. 91% of the workers provided their own PPEs, which included a cape, an apron, those waterproof pants, and gumboots. 9 claimed to have been provided by the management. Again, 88% of the workers were Christians and 11.5% were Muslim. To the knowledge, I mentioned I had 24 knowledge statements. 11 addressed personal hygiene, 8 knowledge on carcass contamination, 4 on meat-borne illnesses, and 3 on intervention by temperature control. As you can see in the column, there was at least 51% of the respondents had high scores in the overall knowledge. Again, in personal hygiene, 93% had high scores with no low score, and this can be attributed to the very extensive campaigns of hand washing following the COVID-19 pandemic in that year. However, scores on knowledge of carcass contamination, meat-borne illnesses, and intervention were between moderate, over 50% were between moderate and low scores. we saw an association between age of workers and knowledge scores, in that middle-aged workers aged 35 to 44 years had significantly higher scores, high scores of 20, compared to the elderly workers, that is 55 years and above, who had a moderate score of 18. Again, in the CACA scores, though all the scores were moderate, again, the middle-aged workers had significantly higher moderate scores than the youthful workers of 24 to 34 and the elderly of 55 and above. To attitude, again, 73% had significantly had positive results, positive scores, while only 24 had neutral, and the mean was 33. 33 falls into the category of good attitude. I mean, positive attitude. And the attitude scores across slaughterhouses differed. As you can see, 5 out of the 7 had good attitude. However, M1B and M1A and M1B had significantly higher scores than the 5. And then M2A and M4 had the neutral attitude scores. In practice, 97% had good practice, while 2% had fair practice. Again, across the slaughterhouses, the general results were positive, but there were differences in the scores. So I was curious, as part of my second objective, I wanted to find out what carcass decontamination practices are carried out in these slaughterhouses. So I separated the meat inspectors and asked them separately from the workers, in the event that a carcass is soiled or contaminated by fecal matter or rumen content, for instance, what would be the next step that they would do? So out of the 7 meat inspectors, 5 said they would just wash the carcass with water by pouring it manually until the filth is not seen anymore. 2 said they would use the water and brush. The responses I got varied because different workers had their own practices, different from the standard operating procedure described by the meat inspector, including using water and a cloth. That was 6.4%. 47% used water only. 14% used water and a brush. 18% used water and a knife just to scrape off. And then 12% said they would cut out a part, and around 4% did not know what to do. This indicated a lack of compliance to the standard operating procedures prescribed by the meat inspector. And they were as low as 31% in M3, where workers used 4 different methods, different from what was described by the meat inspector. Yes, and I also wanted to find out the medical testing practice. It is requirement by law that food handlers, and that is including meat handlers, should test at least twice in a year. So good practice was only seen in 52% of my respondents. As you can see, yeah. Again, for those who were tested in the past 6 months, I wanted to find out if they had been diagnosed with any disease. And the diseases mentioned were skin infection, typhoid, malaria, tetanus, helminths, bacteremia, and tuberculosis. For some slaughterhouses, they did not declare getting any ailments, while for some as high as 33% of the workers and 20% reported to have suffered from these diseases. So in conclusion, we have seen that about half of the workers had moderate knowledge scores. Slaughterhouses had neutral attitude scores. And this calls for urgent training, especially for the new recruits and also the elderly who seem to be forgotten during these training opportunities that they are there. And also with regard to uncorrected or poor practices in terms of carcass decontamination, and sanitation and medical examination. As long as these bad practices continue to prevail, they will continue to pose a risk not only to the slaughterhouse workers, but also to their households, which we see are large, and meat consumers. So the study recommends the training of workers. They should be role-specific. We should see effective communication by meat inspectors and also adequate supervision by the meat inspectors, and also establishment of effective prerequisite programs and provisions of PPEs and sanitation materials. Thank you.
Thank you, Victoria. Again, we can see that there's a big knowledge gap among slaughterhouse workers as far as meat safety is concerned. Now, I want to welcome the third presenter, my classmate and friend, Nicholas, to present to us that is prevalence of antibiotic residues in pork in Kenya and gross pathological lesions as risk-based approach to predict residues in meat.
Good morning, everyone. So as we wait for the presentation, I'd love us to do a quick poll. What do you think is the prevalence of antibiotic residues in pork or meat or any other animal source poultry? Volunteers? How many percent?
10%. 10%.
Okay. Another one? Another guess? 40? Huh? 80? So we have 10, 60. 60. Okay. Another one? 40? 40, okay. They're not right answers or wrong answers. Another one? So we have 10. We have 10, 40. Let me write it down. Yeah, that one. So we said 10, 40. Sly, what did you say? 40. 80. Ruth, 80, right? Okay. 60. Yes, and 60. So that gives us an average of, how many? An average of 140, 180, 96 divided by 4. 140, 180, 190. About 30? 190 divided by 4. So that gives... About 50. Yeah, about 50. All right. So before I even going to introduce myself, I'd love, while you give this presentation, I'd love us to think about 3 questions. 1, what is the problem that you're discussing? We can write it down in three questions so that by the end of the discussion, we have what is the problem? 1. The second question is, so what? Why are we discussing this problem? And then the third question is, now what? What is the problem? So what? Why should we care, especially as vets in the room? Then number 3 is, now what? All right. Good morning, everyone. My name is Nicholas Bor from ILRI, and I'll be presenting on antibiotic residues in pork that are slaughtered in Dumboine. This was part of my work that I did for my MSc in One Health from the University of Edinburgh. And up here, my co-authors, so this work is already published. So in case I miss anything, we can always refer back to the paper. Great. So as a way of introduction, we know that the human population continues to grow. And while this population continues to grow, there is a demand for food. And in this context, for the demand of food, is that we need to provide food for this growing population. And often what happens is that the farmers will respond to this demand by livestock intensification, which often requires us to use a lot of antibiotics. So, and they're using especially these antibiotics especially to prevent diseases and to increase productivity. And what is the situation about the antimicrobial use? We know that a lot of antimicrobials that are being manufactured by the manufacturers, 73% of that goes into food animal production. And given this statistic then, we can ask ourselves, and if they say that antimicrobial use is one of the biggest contributor for resistance, who will they blame? Is it the human health or the animal health? Right? Who will they blame? Yeah, they'll blame the animal health. So, given that we know that these antibiotics are frequently used or even misused, then they often result into residues. And the consequences of this is, I'm getting to the point where we're asking, so why should we care? First of all, we should care because we are likely to carry this blame as vets for this. And also we need to think about the public health consequences. This include maybe development of carcinogenicity, allergens, and potential contributor for antimicrobial resistance. Some of the people say that they may be allergic to, let's say, penicillin. So they've been avoiding penicillin all through when they go for a prescription, only for them to find residues in their pork. So that would be failing people. The WHO and FAO have developed a Codex Alimentarius. This is where they've set standards where if a certain limit is exceeded, meat is considered unsafe and should not be sent into the food value chain. And Denmark have gone ahead to develop a way where they can easily predict for the possibility of antibiotic residues. And the reason why they developed this is because they are required to routinely monitor for residues, which is unlike our situation here, where only meat is condemned if the animal is showing signs of sickness, either at antemortem and postmortem. And now in our study, first of all, our two objectives was that we wanted to find the prevalence of residues and as well to see if we can develop a risk-based approach for monitoring these residues. And the reason why we were trying to develop this approach is that we know that it can be very expensive to start sending every meat sample to the lab and back before it's sent. The time consequence is required. So in terms of our hypothesis development, we were thinking that animals that are likely to present with lesions, this could be, they have a wound, they're limping, so potentially they could have residues, they could have been treated. Also, we also thought that the animals that present with these gross lesions may have originated from farms with poor animal welfare, or even from a bad farmer, would say, who is likely not to respect the withdrawal periods. So those were our research questions, as you can see above. So this is just a causal diagram showing how that went about. We're saying the high food demand is causing intensification. And in our situation, we know that already we have higher disease burden. And given, like from yesterday's presentation, we were talking that we have limited diagnostic capabilities, so we often use antibiotics just to cover. So, and we are likely to end up with residues. We also have another framework that there is poor regulation of antibiotics and the farmers can easily assess. Like yesterday, Dr. Rino was saying that in Samburu, and antibiotics are sold under the tree, so you can see the misuse is going to be high. And in terms of knowledge as well, we know that our farmers, they're just using antibiotics just to cover. So, and the knowledge is not only about the disease, but it could also be their issue about the withdrawal periods. So all these are likely to cause antibiotic residues. And just, this is simply how we went through the study. But like we said, according to our outlines, we are not here to, I'm not here to tell you how we did it, but we are here to discuss together on why this is a problem that should concern us and what we need to do as a profession. So just a brief overview. We see on the top left, the farmer is coming in with their pork. It was done in Dumboine, so we seek consent. Then after that, once they agree, we weigh, we ask about where they've come from, the type of farm that they've originated from. Then we'd send it for stunning. Then after that, we would observe the animals and would observe for any external lesions. And then afterward, once it's eviscerated, we'd look at internal lesions and record. Great, so here was one of the biggest questions that you were asking. We found a prevalence of 41.26%. So this is worrying because you can say that almost 50% of the pork that is slaughtered and consumed in Nairobi and its environment is having antibiotic residues. And now, like we said, this presents a public health concern to our consumers. And looking at the associations between the lesions and the residues, and those are some of the lesions that you are looking at, pleural pneumonia, tail bites, all the way down. And you can see that from the p-values, there was none that was statistically significant. So what does that tell us? That at this stage, we may not be able to use gross pathological lesions as predictors for residues, meaning that there could be another underlying problem. And most of the cases that there could be a misuse of antibiotics. That's why we couldn't find something significant. Great, so just as a recap, the high prevalence is definitely worrying. Somebody will say 10%. I'd wish to know which area is that. That would be amazing. The one who said 80% would be worried. But like we said, the issue of residues definitely cause a public health concern, and we need to really address it as the veterinary professionals. And again, we need to regulate access for antimicrobials, because this is the only way that the farmers are getting access to antimicrobials and ending up with this problem. We also need to raise awareness in terms of the problems that they could be going. Most often, we tend to train animal health practitioners, but we also need to train the farmers, because clearly most of us have not been practicing or rarely practice, but most of the farmers access these antibiotics, and in every food that we eat, we are likely to end up with this situation. And looking at our Meat Control Act, we thought that meat is not condemned for residues, so if this is likely promoting this problem. As a way of recommendation, and like we've always been saying, we need to regulate access for antimicrobials to the farmers. We need to make sure that they're in safe hands and with prescription. And during the structural adjustment programs, we saw that there was extension services were removed, so could it be a time to start reintroducing extension? And these are the things that we want to catch on. We need to show the farmers about the public health consequences of this, and even want to tell them about why they need to manage their animal health, like biosecurity, use of vaccination, so that to reduce over-reliance of antimicrobials. Given that this work, we found a high residues and high prevalence, so we've done another follow-up study just to look at what is going on antimicrobial use at the farm level. And this is still work under under investigation. And the last two slides is where we'd love to ask ourselves, should we change our Meat Control Act? Because our Meat Control Act, only meat that is meant for export and is found to have residues is condemned or not exported. But do we also need to make sure that the meat that we have we consume locally is of good health? Finally, we need to start thinking about insensitizing the good farmers who produce good meat without residues to our consumers. Yeah. So there is our paper, and you can find it from the link there, and hopefully to pick your questions. We'd love to acknowledge our partners for all their contribution here. Thank you very much.
Thank you, Nick. Thank you for managing time. And now we are going to shift the gear, that is from matters meat safety. Then the next two presentations that you're going to have will be on donkey welfare. And the first presenter that I'm going to welcome is Felix. That is to speak to us about an assessment of the welfare status of working donkeys and their economic role in Lamu County. Karibu daktari.
Asante sana, Dr. Gonchi. Good morning. I'm Dr. Felix Rachonyo. I work for the County Government of Lamu. I'm going to give a presentation on an assessment of donkey welfare and the economic importance. The survey was done by the Donkey Sanctuary just to get to inform the intervention and also the nature of work that they'll be undertaking going forward. So it was an assessment of working donkey welfare and the economic role in Lamu County. So in Lamu, we use donkeys as tourist attraction, and we also have this famous man from Lamu. I know there are so many people who come down there to see him, and they also get an opportunity to ride on donkeys when they come to Lamu. That is Omar Lali, our good ambassador. So as an introduction, Kenya's donkey population stands at 1.17 million. That one as per the 2019 census. Then in Lamu County, we have a population of around 1,964 donkeys. Though this figure is disputed, the locals believe that we have a slightly higher number than this. This one indicates that there's been a decline of around 24% from the 2009 census, where the figure was 2,500. Then donkeys are relied upon by nearly everyone in Lamu, where they play an important role in people's livelihood, because if you go there, most of the paths are very narrow, and we don't have motor vehicles in most of the islands, so we rely on donkeys as a means of transport. So this study, therefore, sought to understand the current welfare status, generate evidence-based data on donkey welfare and economic contribution for policy decisions. So the study sites, the study was done in Lamu Island. These were Lamu Island. In Lamu Town, Shela, Matondoni and Kipungani. Then it was also done in Manda Island. We chose these two islands because of the high donkey populations within the two islands, and also the welfare statuses in these islands, almost the same, mirrors what is happening in other islands. So a total of 99 donkey owners and users from Manda Maweni, Amu, Matondoni, and Kipungani were interviewed. These are just villages in Lamu County. Then we also carried out 7 key informant interviews with the Lamu County government staff and also the NGO workers who work in the animal welfare sector. Then we also carried out 5 focused group discussions with donkey owners and users from Manda Maweni, Amu, Matondoni, and Kipungani. Then we also had an opportunity to observe and evaluate 77 donkeys for their welfare statuses at the time of the study. Then we also reviewed secondary data. We were mostly relying on data from the Donkey Sanctuary Hospital in Lamu County, and also looking at the data from the County Government of Lamu Veterinary Services Department. So we sought to know the role of donkeys in Lamu and their uses. Most of the donkeys are used domestically, transportation of household items, transportation of baby building materials. Then 66% are used in transporting of goods. These are goods that are not building materials. Then 51% work in the coral brocks, the coral industry, this one. Then transportation of tourists, a paltry 10% are used in transportation of tourists. And then for racing, there's always a famous donkey race in Lamu, 6%. And then 5% are rented out either for work or for racing. So we also wanted to know where the locals get information about their donkeys. And we realized that about 57% usually get information from friends and family members.
Then another 56% get information from other donkey owners. 48% get information on donkey care from the donkey sanctuary. Then only 10% get information from the government vets. Then 3% from Lamu Animal Welfare Clinic. This is another welfare organization based in Lamu. Then 2% from private vets. 1% from Safari Doctors, another organization based in Lamu. Then others 1%, and then from the internet, 1%. So we also sought to know their training needs. 97% of the respondents want training on donkey health matters. Then 75% want to be trained on how to self-treat their donkeys. Just because maybe this is informed by the fact that there are few veterinarians in Lamu County and also very few organizations that work to improve the welfare of donkeys in Lamu. Then 72% of the respondents have used homemade harnesses. We asked them whether they use harnesses, whether they buy them or they make them at home. So 72% of the respondents have used homemade. Then only 22% purchase the harnesses, and the average price is around 898 shillings. Then 70% believe that the harnesses are expensive, but they all believe that it improves efficiency. It improves efficiency when you're working with the donkeys. So this is a picture of maybe a donkey having a wound. And this is as a result of this donkey maybe carrying a load on the back without adequate padding or adequate harnesses. So on donkey health, population harnessing and treatment, only 12% of survey respondents will agree to the humane euthanasia. They don't allow us maybe to put their donkeys to sleep when they have maybe terminal illnesses or illnesses that are difficult to treat. And this is largely because Lamu is mostly a Muslim community, and they don't agree to humane euthanasia of the animals. So majority of those who will consider euthanasia came from Manda Maweni, and Manda Maweni is predominantly Christian community. So 27% think wounds are mandatory for a new donkey, and then 17% believe a donkey must be beaten to work. So those are the perceptions of the locals there who work with the donkey. So education and vet services. If charged for veterinary services offered to their donkeys, higher percentage, 75%, those who haven't attained any level of education will pay for such services. We asked them whether they are willing to pay for veterinary services should their donkeys maybe become sick. Then 75% agree that they will pay for them. And this is unlike 67% of those who have college education. So you realize that those who have lower level of education are willing to pay for the veterinary services as compared to 67% of those who have college education who are not willing to pay. So these are some of the herbal interventions. We also asked them the herbal interventions that they use to treat their donkeys. So they use siki. Siki is a local Swahili name, coconut wine, for intestinal obstructions. Then mafuta ya mbono, castor oil. This one is used to treat colic and other intestinal obstruction. Mtokoto wa kizuka, it is an indigenous plant, also used to treat intestinal obstruction. Mafuta ya nazi, coconut oil, intestinal obstruction. Maji ya pwani, sea water, to treat colic. Cho ya ng'ombe, for muscle injuries. Kiunopembe, a traditional tree that they use to treat wounds. Asali, honey, that is used in the treatment of wounds. Then sufa, they use to treat intestinal obstruction. So if you look at the type of herbal interventions they use, the main challenge or the main disease that the interventions are used on is colic. And colic is a main problem down there, just because of poor waste management and donkeys having an opportunity to go and forage in those open dumping sites. So uses of donkeys, that one had gone through. So donkey working and living environment. Averagely, donkeys work 6 hours a day for 6 days in a week. 78% do not house their donkeys at night. So it means that they work with them during the day, then at night they are left to go and roam to fend for themselves. Then 59% of the respondents let their donkeys roam freely when not working. and then only 6% house them after work. Then the working donkey highest expenditure is the cost of feed, and then followed by harnesses. Because Lamu, being an island with maybe very few areas to forage on, then they mostly rely on commercial feeds to feed their donkeys. Then 41% of them use hired donkeys for block transport. So 41% of these donkeys that use in the coral industry are hired. So you can see, these are some of the donkeys foraging in an open dumping site. And as a result of this, they end up getting some intestinal obstruction. So in Manda has got the quarry workers. They get sufficient revenue from their work in the quarry. Then cat donkeys are used in Manda Maweni, while in Lamu Island or other islands, they use pack donkeys. And in Manda, they make 3 trips a day, and their income range from 10,000 to 120,000 shillings per month. So donkeys replaced humans. Initially, they used to use humans to transport the coral blocks. But 10 years ago, they decided to start using donkeys instead of humans. So this is the work being done in Manda. You can see the coral blocks and also the cat donkeys that work in the coral industry. So financial analysis, these are the prices. They buy them, like the small blocks, they buy them at 20 shillings and then sell them at 25 shillings. So they get 5 shillings transporting just one block. Then for big blocks, because they come in different sizes, when they buy at 25, then they sell at 35 shillings. Then for ballast, they buy a bag at 8 shillings and then sell at 20 shillings. So they're able to make money while doing the transportation of those building materials in Manda. It's the same. So in conclusion, we realize that donkey is a critical pillar and is an enabler of almost all economic activities in Lamu Island and other adjacent islands. Their welfare actions do not, however, match their status. In order to meet the demand for daily incomes, to sustain their families, donkey users end up mistreating their donkeys. Then donkey users and owners are aware of the practices that can improve their donkey welfare, but there is lackluster attitude, and this underpins the need for policy. So there's need to bring a sense of responsibility to those owners who mistreat their donkeys and thereafter seek for help at the clinic. So recommendations, we recommend that there is need to develop an implementable policy on livestock and donkey care and welfare at the county level. And then, as highlighted before, there is need for training on donkey welfare and freedom. That one should be prioritized. And there's also need to enhance collaboration among donkey welfare stakeholders, government included. Thank you.
Thank you, Felix. As you can see, the burden of beast is one neglected species, but again, the people to change the narrative are here in this hall. The next presentation is closely linked to what just Felix has presented, and from there we'll hear from our sponsors, partners, that is Equity and Donkey Sanctuary. But before we invite our partners, we'll be having a Q&A, which is just going to take a maximum of 15 minutes so that we can recover on the lost time, because we still have some pending presentations that were to be done yesterday, but unfortunately we didn't. So Peter, karibu.
Thank you very much, ladies and gentlemen. I'm Dr. Nielo Peter, working with the Ripple Effect. We are going to share part of assessment that we did in Mount Elgon that informed our intervention and donkey welfare project we are conducting there. So I'm going to invite my colleague, Dr. Wechabe, who works for the county government of Bungoma, to start us off.
Okay, thank you, Doctor. Good morning, everyone. My name is Dr. Wechabe. I work for the county government of Bungoma. I want to take this chance to present to you what we did with Dr. Angelo, who works for the Ripple Effect in our county. So our assessment was on the working donkeys welfare issues and major health problems in Mount Elgon sub-county of Bungoma County. So just in the introduction, Bungoma County is home to 4,094 donkeys, according to the 2019 census survey, and 80% of that population is found in Mount Elgon sub-county. The sub-county has 6 wards, spanning from Kaptama up to Cheptais, which is on the border of Kenya and Uganda. And the underdeveloped road network in that sub-county makes donkeys to be the most preferred animals for work. Usually farm work is the kind of thing that they do. And then donkeys live and work in harsh conditions and suffer from poor health and lack of productivity. This is majorly because most of the development partners have not given priority to the donkey, but they focus more on other livestock species. And among the welfare issues in donkeys, inadequate access to health care services are the most common problems. The main objective of this, Okay, I think that is part of the introduction. Sorry for the writing. Donkeys provide livelihood support to Mount Elgon community. In the transport sector, you find that people who have donkeys can either hire them to others or they can use them directly to do various works, which include carrying farm produce, firewood from the forest, or transporting water from one point to another. However, little information is available regarding the welfare of these animals in the sub-county, and little attention has been given to this animal, and no study so far has been conducted on these animals, apart from what we are doing currently with the Ripple Effect, which forms the intervention that they are working on. And the current study was performed to assess the welfare issues and major health problems of working donkeys in that sub-county. So in the materials and methods, the study area is Mount Elgon sub-county as a whole, but as I mentioned earlier, the sub-county has 6 wards, but the study area, we carried out the study in 3 wards, mainly Kaptama, Chepuk, and Elgon wards. And the study animals included working donkeys kept by different farmer groups. And the study included donkeys of both sex and different age groups, which are mostly used for transporting goods by pack. The study design and sampling technique, this was a cross-sectional study which was conducted in September 2019, and a total of 45 working donkeys were randomly selected from the study area based on their accessibility, ease of logistics, and donkeys population. Various potential risk factors, including sex, age, and body condition scores of the donkeys were recorded. Wounds on different parts of the skin were also assessed based on the location on the body. Data collection method, we use 2 methods. One, observational study, which involves direct welfare assessment of the animals, and there is a tool that is used to do that. In the direct observation, we use a tool called OBI, that is owner-based indicators, whereby you are able to to interview the owners of the animals on the various lesions that are found on the body. And then for the questionnaire survey, this is an indirect assessment where we use the animal-based indicator. It's also a tool developed by the Brook East Africa, and it's used to assess the various lesions that are found on the body of the animal. So I want to welcome Dr. Ngielo to continue with the results.
Thank you, Doc. That's the animal-based indicator tool that we use to collect or to conduct observation or survey. There's identification of the animal and the owner. We recorded work type. The work type includes whether the donkey is carrying goods by pack, cart, whether there are some aspects of tourism. Okay. Yeah, so then we also suspected that there could be people who are using donkeys for agriculture and for breeding. Yeah. We were recording the species because we also suspected that there could be some mules, horses, apart from just having donkeys, the sex. Then the animal behavior was also assessed through observer approach and chin contact. Then lesions, these are body wounds, location, and we were scoring based on the severity, where score 0 is where there is no lesion or it is superficial, or the wound or the lesion is less than 4 square centimeters. Then score 1 is where the lesion is superficial. Score 2 is a lesion of any size, but the subcutaneous layer is broken. And score 3 is when there is deep wounds. So we were assessing all the body parts, that are highlighted there: the neck, the breast, withers, hindquarters, and tail. The hobbling, tethering, those are lesions on the leg. We were also looking at the hoof, and basically we were looking at the shape, the hoof shape. And the scoring was score 0 for when there is no significant abnormality in both hooves, score 1 when there is abnormality in one hoof, and score 2 when there is clear abnormality in both hooves. So that was for both hind and forelegs. The body condition was also scored using a score of 1 to 5. We were also investigating the presence of ectoparasites, and the scores as indicated there. We're also looking at the mutilations and general attitude, and any extra observations were also recorded. For the questionnaire survey, we used the owner behavior monitoring tool that was looking at the owner's competencies. Okay. Yeah, so we were looking at the basic health and husbandry practices, the farmers' adoption of those practices. We were also looking at the interaction between human and the animals. And lastly, we were looking at access to services, the animal welfare and health services. So allow me go back to the results. Yeah, so that is a graphical representation of what we observed. But from here, we realized that this is for observational survey. You find that so here, the percentage of donkeys with hobbling wounds, with hobbling wounds or lesions, score 0, was around 44%. 44%. I remember score 0 is when there is no lesion, or it is a lesion that is less than 4 square centimeters. And then we have the percentage of donkeys with normal hoof shape in all the 4 limbs, and that was around 20%. So those were the significant findings on observational survey. And in terms of owners' knowledge and practices, utilization of healthcare services was the best at around 86 or 85, thereabout, %. So issues of tethering, harnessing, wound management, ectoparasite control, and farriery were not really practiced by farmers. So in the observational results, we observed that hobbling wounds caused by inappropriate tethering techniques were very prevalent, and there were serious issues of abnormal hooves. So this study revealed that hobbling wounds and abnormal hoof shape were the most serious welfare issues that the organization should focus on to improve donkey welfare in Mount Elgon. And these were due to environmental factors and owners' knowledge, attitude, and practices. So when you look at the hobbling, we realized that the type of harnesses used were, mostly they were using synthetic materials that really cause, the synthetic materials really are common, and they cause serious hobbling wounds. Then the feet, the tightness, and that causes predisposing donkeys to hobbling wounds. Then inavailability of farriery services were also linked to hoof issues. Now, in conclusion, we identified the 2 issues for intervention, and in our intervention now, we agreed that if we address the adoption of husbandry practices like tethering and farriery services, then we will be addressing those immediate welfare issues. And therefore, it was recommended to the organization that we do a comprehensive awareness creation through training, and training of donkey owners, users, and handlers on appropriate management practices, And we also train and equip community farriers so that there is access to quality farriery services. Now, I want to acknowledge Brooke, Ripple Effect, and County Government of Bungoma for financial and technical support. Thank you very much.
Clap for him again. Thank you, Peter and Oshabe. Now we go to the Q&A, and I guess for those who are following us online, you have already typed your question in the chat box. Then from Q&A, which is going to only take a maximum of 15 minutes, we are going to have our partners speaking to us. Then from there, you will be guided accordingly. So let's get the presenters here in front to respond to questions from members.
Yes, thank you very much for all presenters for presenting your works very well. I have two questions to two presenters. First is to Patricia, who presented about meat safety. And I just wanted to ask one question to her about the butchery attendants, because the butcher attendants were the people who were causing contamination to the meat. So have you went back for feedback to the butcher attendants? And if not, what are your plans to go to give feedback and education so that to mitigate this problem? That's your question. And the question to Nick is about, he talked about antimicrobial residues. And I just wanted to know what was the common group of antimicrobial residues that was identified to the pork meat, or to the pork, or to the meat. Thank you.
Okay. On your right.
Thank you very much. My name is Lawrence Mongela. My question goes to Nick Ball, Dr. Nick Ball. When he started his presentation, he said that there is maximum residue level, MRL, which is the threshold upon which, if it is exceeded, then we can say that the product is having residue level. Did he actually check whether these residues or the antimicrobials he found, whether they were exceeding the MRL of that particular residue?
Okay.
Thank you. My name is Gedigia. My question, one has already been asked to Dr. Ball about the specific antibiotic residues. The other one is that you talked about some cysts in the river. Which are these cysts? Because you can get either the cyst sarcas or you can also get the hydatids. The other one goes to the ripple effects. You talked about the boats as external parasites. Which are these boats? You also talked about the ticks and the numbers. How did you count these ticks? And then you talked about some farrier surfaces. I think there I must have dosed. I didn't get what you meant. Then to Atieno, you talk about training the elderly. These people have been there for all this time. I think the best would be to recommend that they be sacked from there because they are not likely to change. Thank you.
Okay.
Thank you. Thank you, the presenters, for your good presentations. I have got a question and also comment on the presentation by Victoria and also by Ball. And I think, as I stated yesterday, DVS is in charge of food safety, foods of animal origin in the country, and I'm the one who is in charge of that veterinary public health section. And I've got a lot of interest in meat safety, because for many years we have been known as watu wa nyama, because that is what we have been doing. But now we have extended to other foods of animal origin. So we had all foods of animal origin in the country. We are the national government. There's an issue that study by Victoria in Kajiado. You have stated that your study was focused on category B slaughterhouse. So I don't know what informed you focusing only on category B slaughterhouses, whereas I know in Kajiado we have got category A slaughterhouses, and you also have got the other one category C. The other one is just comment to say that your presentations are very, very timely. Because one of the functions which has been bestowed to the national government by the Constitution of Kenya is capacity building and technical assistance in the counties. So these presentations and these studies, they are very important because they are also going to inform us when we are building capacities into the counties on where also to focus on. And the issue of food safety in the counties, and I know it is wanting because of challenges which we have also identified. So this one will also be very important. We are going to use your studies as we carry out the capacity building in counties. Dr. Ball, you have indicated the issue of that in the Meat Control Act. It is not required that the meat which is for local consumption is not required to be tested for residues, only the one which is being exported. Okay, when you are exporting meat, the procedure is the conditions which you are supposed to meet are dictated by the receiving country. So whenever we are exporting meat, there is a procedure, and we have to check what do they require. And anyway, most of them, they also require you do residue testing. But that does not mean that whatever we eat in the country should not be tested. That is, I know people have always been asking, why are we concentrating so much on the market, export market? What about us locally? But that is, our concern is food should be safe, whether it is for local consumption or for export. We need to understand that we also have got standard. In Kenya, we have got standard, and we develop standard at the Kenya Bureau of Standard through the technical committees. And we have got, even the food for local consumption has to meet the standard, which we have made in our technical committee, where DVS and all other agencies which are involved in the food safety, they participate. So whether for local consumption, it has to meet the Kenyan standard.
Thank you, Dr. Thank you. I wish to close it at that and to just get their response.
Thank you so much, Paul, for your question. So regarding the feedback, no, we have not yet given them the feedback, but it's an ongoing study, and you remember it involved four phases, where we have the baseline. So now we are designing their intervention, and we are doing in the same butchery. So we are going back to the same butchery, then we'll have the post-intervention. And then at the end of it, we have the training. Thank you.
Thank you for your attendance and for the questions. So to respond to Professor Githigi about the elderly, it was very interesting to see that they're not working because, that they have nowhere to go. They have large households. Some I spoke to, like those who are 80-year-olds, stay with their grandchildren, and they are the major sources of livelihood for their families. So, and actually, as I've said, out of the 15 the 15 respondents who were trained, 12 had been trained by, they said meat inspectors, but actually they had been trained by the more experienced workers, because when I had interviewed the meat inspectors aside, 5 out of the 7 say they do not do any training. So whatever training these workers were talking about is the kind of induction given by your fellow colleagues once you are recruited into the slaughterhouse. So they have large households, their livelihood, they earn livelihood for their families. Most of their children are unemployed, and I mean, as long as the management allows them, they see that they have a role to play, particularly in guiding the new recruits. Yeah, but again, for productivity and in case of, occupational hazards, maybe they may suffer from things like back pains and, injuries. So for that concern, yeah, there should be a restriction of, the age in slaughterhouse workers. Why I chose category B? So out of 2,000 slaughterhouses, around 1,500 are category B slaughterhouses in Kenya. So I wanted to have a good representation of that from Kajiado County. And again, as I said, this is part of my PhD study, and I wanted slaughterhouses that had a large number that I could work with, of carcasses to work with. So that, and again, I was curious about that livestock route all the way from Namanga, that straight line, yeah, Namanga, Bisil, Sampu, Kajiado, all the way to Kitengela. So that was the purpose of those slaughterhouses that I chose. And then the role of capacity building, yes. After the study, I went back to one slaughterhouse in Kiserian, and I had seen, previously they were washing the floors with buckets, just pouring buckets. But as a result of our training by, I think, SDSD, from Kajiado, 6 months later they had purchased high pressure. I don't know if they had purchased or they had been gifted high pressure piping to help in, better sanitation. Yeah, I think that's it. Thank you.
And I'd love to respond to 3 questions and one of the comments that came in. So the first question was, what were the common antibiotic classes that you found? So for this study, we were using the PREMI test. What we were doing, we were just quantifying the absence or absence or presence of antibiotic residues. So this is a screening test. So we didn't narrow down to the specific classes of antibiotics, which we stored the meat samples. Hopefully when we get some funds, we'll do a confirmatory test. So this was the first screening test. On to the second question by Lawrence. He was asking about the issue of maximum residue limits in terms of the pork that you are talking about. So the PREMI test that we use to test for residues, that is actually the principle of the PREMI test, in that in case the limits, the maximum residue limits are exceeded is when they test positive. So that was the premise of the tests. So clearly anything that was positive meant that it had exceeded the recommended maximum residue limits. And to Professor Githigia, he asked about the issue of liver cysts. And we all know the process of the slaughterhouse. It's a fast process, it's a quick process, and not so organized. So what we were looking for is a real case scenario. For example, if you are the meat inspector, you want to look, is there liver cysts in the carcass? You want, or even the meat inspector won't go down and say, oh, I see that liver cyst, it's this type or this type. No, we want to say that they can see that gross lesion, a liver as a cyst, and say, oh, we need to raise questions. So for those who are coming in, we are trying to see a risk-based approach that can help predict residues in meat. And the other one was more of a comment, right? And I agree with you that even as local consumers, we deserve to have good quality meat. So apart from raising awareness from the farmers, we also need to raise awareness to the consumers as well, that these are the consequences of eating pork with residues. And once even the consumers have the awareness, they can start demanding for good quality meat, or even they can even pay more for good quality meat that assures safety. Thank you.
Okay, I have 2 online questions. The first one is whether SIKI, under the herbal interventions, whether SIKI refers to palm wine residue or coconut wine residue. You know, these translations, like SIKI, in Lamu, they refer to coconut wine residues. But you can go somewhere else where they have palm wine, and they still use the term SIKI. So SIKI can be used to mean different things depending on where you are. Then, on domestic use of donkeys, what I mean by the term domestic use. So domestic use, these are donkeys that are being used to transport household items and maybe transporting people to different areas. So those ones are classified under domestic use. Thank you.
Yeah, so thank you very much, Prof, for your question on ectoparasite. Ticks we were doing physical counting of ticks. We considered any number beyond 5 to be significant, and less than 5 ticks to be insignificant. So, and there was scoring for every count. The question on boats, we were counting boat eggs. So by observing boat egg, we consider that as an external parasite, and that will determine the intervention. In your question on farriery, we picked hoof problems in that study, and this was as a result of, the poor hooves in Mount Elgon, mainly because of the climatic conditions. It's mostly wet, so that predisposes them to overgrowth. And therefore, as the saying goes, no hoof, no horse. The same applies to donkeys. So, and they are working donkeys, transporting goods, mainly farm produce from the mountain to lowlands where they can be accessed. So with overgrown hoofs, donkeys struggle to maneuver the terrain, and therefore we considered training community farriers to manage the hooves so that donkeys can have some comfort transporting the farm produce.
Thank you. Can we appreciate our panel? Thank you. You can have your seats. I understand there are some more questions that are yet to be responded to, but again, you can always interact with the presenters after this. I just got information that there are Zoom questions that haven't been responded to, but again, you'll share the questions with the presenters so that they can respond to them. Now where we are, we shift the gear again, and now we get to hear from our partners. And since we just heard from presenters presenting on donkey welfare, so we'll start by Donkey Sanctuary, and kindly, I'm just giving you 10 minutes max.
So good morning, everyone. My name is Florence Macau. I'm the head of finance and administration at the Donkey Sanctuary Kenya office. I'll start by introducing the Donkey Sanctuary. Donkey Sanctuary is a UK-based charity organization advocating for the welfare of donkeys globally. We have five projects in 5 core regions: East Africa, South Africa, West Africa, South Asia, Latin America, and the Caribbean. So I'll talk about Donkey Sanctuary Kenya, because this is where we are. Kenya has 2 offices, with the main office in Nairobi, Karen. Most of you may not know, but we have had a donkey hospital or clinic in Lamu since 1987. And since I have my colleague here, before I talk about our work, I would like to introduce to you my colleague, who is also going to talk about Lamu, Dr. Obadia.
Good morning, everyone. My name is Dr. Obadia Singoe. I'm the team lead and the veterinarian at the Donkey Sanctuary Clinic in Lamu. Shortly, I'll introduce the clinic and the work we do in Lamu. And that's basically a donkey clinic, I think the only one in the country. And we deal with a lot of issues, as my colleague Dr. Felix pointed out the issues facing donkeys in Lamu. So as a clinic, we receive a lot of cases and we do a lot of advocacy for the donkeys. And Prof. Mande and Prof. Kidikia at the university, we are open to take students who are willing to do internship in donkey issues. And the KVB, we are going to liaise and see if we can also pick interns. Thank you.
So thank you, Daktari. Donkey Sanctuary Lamu Hospital is actually termed as an iconic site for Lamu County. So we have not been in the limelight for some time, and so we've been carrying out both institutional and strategic review of the organization for the last few years. And as our vision states, we do recognize that to create a world where every donkey has a good quality of life, we must use our unique position to work with like-minded people to create a global network of partners and relationships that allow us to act quickly and effectively wherever we can do the best for donkeys. This therefore means that we are taking up a partnership model and commit to longer-term projects that are designed to address underlying donkey welfare challenges with sustainable solutions. It is our hope that this approach will bring in together players from the humanitarian sector, the animal welfare sector, and the environment with a common interest of enhancing the welfare of donkeys. And so to that end, Donkey Sanctuary values and looks forward to a continued collaboration with the veterinary sector as part of our approaches moving forward. As I finish, I would like to introduce to you our online learning and education program, the Donkey Academy, which we launched in January 2022. This online learning is offering a free online platform with high quality education and training resources developed by our professionals, donkey and mule experts. The purpose or the aim for this is for us to improve donkey welfare worldwide through providing comprehensive and up-to-date knowledge on donkey welfare. It is actually designed to teach you a new skill or enhance your existing skill set in all aspects of donkey health and welfare. So there are two aspects of the Donkey Academy. One, it is a course designed for professionals, and secondly, courses open to all. The courses open to all include donkey behavior, donkey care, health and welfare, harnessing, nutrition, health and welfare assessment tools. And the course for professionals is on clinical examination. It's actually recommended for veterinary surgeons, veterinary students who occasionally see donkeys and wish to be more confident in their knowledge and approach. It includes donkey behavior, taking and interpreting blood and fecal samples, dental examination, basic lameness, donkey castration, and so on. It also includes courses on dentistry, hoof trimming, and farriery. How do we register? We have a registration process. I don't know who we need to project. How do we register? And I would urge, if you, at this time, you could try and see whether you can register for this or just get to learn how to register for the course at your own time. And we do have bookmarks which I will ask our colleague to take them around to give you each a piece. You can take more than one if you so wish. I know we love reading. You can take for a friend because the purpose is to spread the word. So that is how this is how to register. The bookmarks also have a QR code that you can actually scan, and it gets easy for you. So that is how to register. You browse the Donkey Academy, fill in your details, click register now, and just follow instructions. For more information, please log on to our website. The Donkey Sanctuary has a wealth of information on donkey welfare, and therefore urge you to take advantage of this Donkey Academy. So in conclusion, to the KVA and the organizers of this conference, as Donkey Sanctuary, we are grateful for all the support that the KVA and the vet fraternity has accorded us over the years, and we look forward to sustaining that collaboration. I think it is good for you to note that as part of our strategic development, the Donkey Sanctuary recently carried out interviews for the position of a country director, and I'm happy to announce that one of your own, who is also your OIE focal point, was appointed as the country director. Yeah, so we believe his appointment so we believe his appointment will boost our push towards a multi-sectoral approach in improving donkey welfare. He was not able to join us this year in this conference because he had traveled, but he did promise that he will attend next year's conference because among other interests, he has a candidate that he would like to push for in the elections. Thank you so much.
Thank you. Let us appreciate Donkey Sanctuary. Thank you. We get to hear from Equity. Then, so there's a request because there's a question. We just give Obadiah 2 minutes just to respond to a question here.
Thank you. I've been asked to comment on why Donkey Sanctuary and Brook and other organizations dealing with donkeys are talking about welfare. We are not talking about breeding or dairying donkeys. So as for Donkey Sanctuary, we've not had issues with dairy in donkeys since the places we cover, they don't consume donkey milk, but that's food for thought. As for breeding, the context of Lamu is so interesting in that as one of the welfare issues is wounds from males fighting, but unfortunately the community there don't consent even to castration or even anything to do with planning any breeding. So I don't know other places, but also it's something that can be considered. Thank you.
Okay. There are there's a concern from the online participants, which I think I should just read out. Not for anybody to comment, but I think for us to discuss during tea. An anonymous participant is asking why offer free veterinary services to communities that can cater for treatment of the animals. These free services have shown increased sense of entitlement among donkey owners. As a result, donkey owners fail to spend on medical care of the animals, or veterinary services and would rather wait for free services, adding to further donkey welfare issues and discourages veterinarians from offering their services to the community that only accepts free service. What can be done? This question was directed to Felix, but I think it's also relevant for all of us as participants in this conference, so yeah, we can keep that discussion alive during the tea break. The other, which I think I will handle with Florence, is you mentioned about the academy, and there are very nice courses that you're offering, like one in my mind is donkey castration, farriery. I would like to know who is it meant for? Who can take that course? Can a farmer come and do the course on donkey castration? You will answer after. Okay? So welcome, sir.
Thank you. Good morning, everyone. I'm Joseph Wanyingi from Equity Bank. I work in the Food and Agriculture Department as the dairy specialist. And with me, I also have my colleague who is the specialist for non-dairy livestock. He's sitting among us. And also our other colleague, Dr. Ivy Cheriot, who is a member of KVA. So I think this is the second conference that we are attending as Equity and supporting, and it's because of Equity wanting to be in the space of food and agriculture. So Equity Bank at a glance is we have 16 million customers. We are currently in 6 countries with a balance sheet size or an asset base size of 1.4 trillion. This is, we are going to celebrate our 35th year next year. So it's growing as a bank. So our branch network in Kenya, what would be making more reference, we have 190 branches covering most of the country. Livestock is big in the ASAL areas, and we are well represented there with quite a number of branches in the key towns in those areas. So wherever you are, you know that we are there and we are able to support your activities. Despite the branch network, we also have other channels of communication and support to our customers, different channels through the Equity agents, through the mobile digitization. There's a lot of work going to digitize banking so that banking becomes something you do, not a place you go. So now digitizing even credit such that you're able to apply for facilities wherever you are and you get them. So Equity has a Marshall Plan, which we are calling the Africa Resilience and Recovery Plan. This plan we discussed last time when I had come for the event, and it is a plan that is supposed to transform Africa. It is the social and economic transformation of Africa. And this plan was advised mainly by the experiences of COVID and recently the Ukraine war, where we discovered as Africa, we are not feeding ourselves, we can't feed ourselves. And we also discovered that food and agriculture is the base of the economy. When Corona struck, we all closed down, but nobody stopped eating. So meaning food and agriculture is the base of the economy. And towards that, the strategy has 6 pillars, and which will be operationalized through collaboration, deliberate and ecosystem-centric. That's why we are here, because we need to collaborate with the veterinary fraternity to support the livestock business and production. So the first pillar of this Marshall Plan is food and agriculture. And this is where the bank believes it will transform Africa. Now, the other pillars, they nearly mirror the first pillar, because in the second pillar of manufacturing, The competitive manufacturing that Africa will do is agro-processing, because we are a bit behind in terms of other forms of manufacture. So through food and agriculture is when we'll develop manufacturing and the innovation around it, because we will solve our own agro-processing issues based on how we want to serve our food, how we want to process it and preserve it. And around that, we'll create an industry and a manufacturing industry out of it. Africa is not trading with itself. Products will leave Africa, go to Europe so that they come back to Africa. So trade and investment is another pillar which the bank is also looking at, so that we are able to use our economies of scale. For those countries that have excess, they can trade with each other. How do we open Africa to trade with itself? And when we are trading, the distribution will be done by MSMEs. Most of you are also MSMEs. Farmers are MSMEs. So this is what will power the distribution and the last mile, and also production. So, and digitization is key, because farmers don't come to the bank. So we have to know how to support them wherever they are at the farms. Vets are people who are on the move all the time. They don't want to come to the bank. How do we digitize banking so that we can democratize it? And also, obviously, we have to be concerned about the environment and sustainability. So this is the Marshall Plan, and this is the rallying call that the Equity Bank is bringing to KVA to work with us so that we can be able to transform Africa through food and agriculture. So Equity is a twin engine bank. So we say we are a twin engine bank. The business model is twin engine, where we have the commercial and the social. The commercial is the bank where the loans and the financial solutions are provided. And in the social is where we do capacity building. The social is supposed to capacity build, and especially here in Kenya and in Africa, and you know, for agriculture. And for the few sessions that I've listened here, there's a lot of capacity building and training that is needed, because the guy who is doing production has no knowledge, has no capacity, he doesn't know much. So that's why now, working with KVA, we would want to help farmers to capacity build. We want to use your expertise to go there. We cannot talk about livestock production without the vet. So most of you know Equity, the social side, through the Wings to Fly program, where it is an education and leadership pillar. But there are 6 pillars in the social engine. And the food and agriculture is one of them. Here is where we do capacity building, training. Mainly for us as a bank, what we do is to just convert the mindset of the farmers from sustenance to commercial, so that they can think as a business, because most of them are doing agriculture for sustenance, and because they have know-how. And that's now where, when we move it there, then they need expert advice. They need to be supported. I heard somebody talk about extension services. I think, for me, I don't think the role of government for extension will work. It worked before, but it can't work going forward, because extension services are specific to the need of the producer, and the government cannot. It should be mainly private sector driven, so that if you're a dairy company and you need milk, there's extension specific to your farmers. Otherwise, the government can only do more of research, supervision, juju, but not in-depth. It is the private sector that is going to, because you have to outgrow your produce. You cannot be a dairy farmer and you are not supporting your farmers. Because right now we know, like, there's no milk. Dairy companies are collapsing. They can't get milk because they were waiting for the farmer to do their thing. They come and offer money. So there's a lot of capacity building, and that's where I think we can work together. The social pillar relies on the equities infrastructure. For us, when we do social programs, it is not, we do not try to start new programs, new things, open new offices. We use our branches, we use our staff, so it's easy to reach many people. And you saw we have 190 branches. So for us, we don't need to set up. Either you come and train us in a curricula, train our people. Within our branches, we have 390 agriculture officers who are out there. Here in Kakamega, we have 4. If you go to Kisumu, we have many. So they are the ones who we use. We have the Equity Group Foundation Agriculture Pillar specialists on the ground who are with the farmers every day. So this is the investment we've done. Obviously, it started through the education pillar and leadership pillar. And this has birthed the Equity Afia model, because the Equity Afia that you're seeing, these are clinics that are being operated by the alumni of the Equity Wings to Fly, those who went and became doctors. We are designing one depending on the volume. As I said, right now we have Dr. Ivy, maybe you can stand. She's actually an alumni of the Equity Wings to Fly, and she's working with the bank. So we are discussing with them to see what they can do in the veterinary space where we can replicate such a thing. So mainly, as I said, it is to increase productivity through training of farmers. What we've learned is by just training farmers to think about their activity as a business, we even see 50% increase in production. When you just tell the farmer, can you do your math? Are you making money or not? Do you keep records? Just that. We are not experts. So working with KVA now, you could bring the technical expertise. But right now, we are working now with people like Dr. Ivy. I think we are going to get another vet also within the bank so that we can work together with them. So on the commercial engine, this is where we know the bank is. So basically, what we've seen because have you seen agriculture, the target for agriculture for equity? It is not because it's good. It is strategic. We are focused on it, and we've seen it is the only way that will transform Africa. So it is a very strategic focus. So right now, we are not talking about agriculture is risky or not. We have to de-risk it. So there's no choice of financing agriculture. If I forgot to tell you, in the Marshall Plan, we want to match the bank balance sheet with the GDP contribution for agriculture. Meaning by 2025, 30% of the balance sheet of the bank will be in agriculture. Right now, you saw we have seen you are 1.4 trillion. We project to be at about 2.4 trillion by 2025, meaning 700 billion of the balance sheet will be in agriculture. So it is a deliberate attempt. The bank is pledging money. Right now, a branch manager cannot say they've hit their target if 30% of their loans are not in agriculture. So, and the thing is, where do we take the money? So we are using the ecosystem approach, looking at the value chain. Because if one part of the value chain of agriculture fails, everything collapses. So the farmer can do everything right, but there's no vet. The animals become sick, they die, everything collapses. The farmer, the vet do the correct thing, but there's no market, everything collapses. There's no post-harvest management, everything collapses. So we have to look at it across the value chain. So when we are financing, we are looking at the holistic approach. So meaning right now, when we are talking to any livestock producer, we must know where is the vet, who is supporting you, because we have done financing in the bank where, diseases come, and especially like in poultry or in pig farming, where the disease can just wipe out quickly. Right now we hear, anthrax, I don't know, in Embu and stuff. So we cannot do it alone, and that's why we need the vets to work with you. So we are looking at ecosystem. Most of you also own agrovets. Where is the input coming from? Is it quality input? When we are financing the farmer now, we are not going to give them money to buy inputs, to pay for veterinary services. We need to work with you. We whitelist you in our system, such that the only thing the farmer can do when we allocate that money is to buy your products or services. They cannot go, because needs are many. The farmer will come and tell you, I want to buy animal feeds. On his way, the children will call them and tell them, tumefukuzwa shule. They will divide the money. So if we are financing agricultural inputs, right now we want them to give them an e-wallet, which they go to the vet. He can only pay a vet, he can only buy a specific item. So this is the way we are looking at it. The focus of the bank is in many agricultural areas, as you see, But for me and why we are here, and with my colleague, I think he can also stand so that you can see him. We are the ones who are championing livestock. He's called George Moiga. George Moiga is an animal production specialist. So he's our non-dairy livestock specialist. I am dairy. So both of us, we are livestock. So basically, we are covering everything. So what is in the support we can give to KVA as the commercial engine? So we've tried to pick up, just trying to understand you. But we would want you to help us to understand you better. So this is in our own thinking, what we think the vets can get and where we can give them financing. But we want to work with KVA so that we get it right for you. We want to see you, to be with you on the ground, we work together. Because when we are with you on the ground, we know things will work. We will support the farmers in market and access in production, because as I said, it's an attempt. But on the technical aspect, we need to work with KVA so that we can do. So there is nothing that you want that we can't do. There's no product that we say it is a strategic and deliberate. It is not a chance. There is nothing that you do that is too risky for us, because if you can't do it, then we will not transform Africa through food and agriculture. So let's work together. We don't know everything. You're the ones on the ground. Talk to us so that we can understand you and design products that support you, and so that you can take the position that you are supposed to take in this transformation journey of Africa. So some of the partners that we have and working with in the agriculture space and the programs that we are involved in, we are a member of the Kenya Livestock Transformation Steerco. So we are not the group chief executive officer for strategy sits in this Steerco. And it is, we were invited by the government through the Ministry of ASAL, and it is supported by Bill and Melinda, and it is private sector led. So we are the bank that is sitting there. So we are making decisions for you. So you need to collaborate with us. I have not seen KVA in that Steerco. So then there's something you should be doing. I saw vaccines there, but I'm not seeing any KVA in the thing. So I think within your own way, try and find out why you're not in this Steerco, which is supposed to be working on the transformation. So we've also worked with different, right now we are working with the DRIVE project for the World Bank for the de-risking of the pastoralists, and many more projects, and the many more partnerships that we work. If you see, we take ourselves as partners. We have been in discussion to join you as members. We want to be members of KVA so that we are not outsiders. Are we welcomed? Yeah. Yes. So I think I will end it there. We have our tent down there. Ukikuja unaweza sign na upate pesa. That is a disclaimer. Yeah, but let's keep talking. We are an intermediator of your thinking. Bring us your wild thought. If you see the Marshall Plan is a crazy idea that the bank has and believes it will work. So there's nothing you can tell us that we cannot take. Thank you so much.
Let us appreciate him more. Thank you, and thank you for reminding us on the need of commercializing livestock production, because that is the only way that now the livestock industry can be sustained. For our sponsors, our partners, on behalf of KVA, the vet fraternity, we love to say thank you, and we as KVA, we look forward to continued partnership so that we can better the veterinary profession in the country. So we move forward. If you have access to our program, you'll see that we are supposed to be breaking for our tea. That is at around 11:10. But before then, we are going to have a few presentations that is on gender matters. The first presenter on gender. The first presenter on gender is Tabi Karanja on gendered impact of the mode of Newcastle disease vaccine administration on poultry productivity in Machakos County.
Good morning. My name is Tabi Karanja Lumumba. I work at the Kenya Agricultural and Livestock Research Organization, KALRO, based at the Veterinary Science Research Institute. I am an agricultural economist. I am going to make a presentation on the gendered impact of the mode of Newcastle disease vaccine administration on poultry income in Machakos County. As a way of introduction, I would like to mention that small-scale poultry production plays a significant role in contributing towards food nutrition and income security. And what we know about small-scale poultry production is that it is mainly perceived to be in the domain of women. And as a result of that, research and development agencies have looked at commercialization of small-scale poultry production as an avenue for empowering women. But one of the major issues or constraints that are limiting fast-paced development of the poultry subsector, even as the research and development agencies are trying to commercialize indigenous poultry production, is Newcastle disease. So this study was conducted in Machakos County, and in this county, promotion of indigenous poultry production and commercialization has been promoted since I think 2012, and so for about 10 years that has been ongoing. So one of the components that most of the research and development agencies are having in their promotion programs is integrating a Newcastle disease vaccination component. And so adoption of the vaccine has been quite encouraging. However, one of the aspects that had also been unforeseen, is that there has now been, there are changing patterns on ownership and control of the indigenous poultry enterprises, where we find that women are now losing ownership and control of the indigenous poultry enterprises, and men are taking over. So the common modes of administering the Newcastle disease vaccine are as an eye drop, mixing the vaccine with drinking water, and also as nasal drops. So what we found out in Machakos County, where this component of Newcastle disease control has been integrated, is that what the farmers are doing on the ground is, although the eye drop had been mainly recommended for the thermotolerant vaccine, sometimes they are not able to find it in the shops. It is unavailable. And so what they are doing is that they are using it interchangeably with the ordinary vaccine. And so you find that the farmers are using either of the vaccines, the thermotolerant one and the other one, is either as an eye drop or even mixing it with water. A few of them are using it as nasal drops. So what we realized is that because we have the component of men taking over the enterprise, that then it would be important for us to conduct a gendered impact, so that we look at these modes of vaccine administration and what the outcomes on these enterprises are. So we wanted to find out whether there are any gender differences that exist. And these were the objectives. We wanted to determine if there are gender differences in the mode of administration of the vaccine, and also to evaluate the gendered impact of the mode of vaccine, and specifically we looked at the income generated from the poultry enterprise. So this study was conducted in Machakos County between January and March 2022. We used a multi-sampling procedure to select the county. And this county, according to the statistics, had been ranked as the 6th county with the highest population of indigenous poultry. And then we selected sub-counties where the thermotolerant vaccine had been promoted. And we've selected villages where at the time of this study, use of the vaccine was ongoing. And so we clustered the poultry keepers at the village level, where we got sampling frames that were developed by the village managers. So the sampling frames had grouped poultry keepers into female and male poultry producers. And then we randomly sampled the study participants. And so we sampled, so it was a bigger study that sampled adopters and non-adopters of Newcastle disease vaccines. But for purposes of what I'm presenting here, we took a subsample of only adopters of the vaccine. So in total, we had 286 female-owned and 221 male-owned indigenous poultry enterprises. So we had face-to-face interviews, which were conducted by enumerators who had been trained, and we had a semi-structured questionnaire which had been programmed in EpiCollect data collection and web and mobile application. So we collected data on ownership of the poultry enterprise, the socioeconomic, demographic, and poultry enterprise characteristics, production and marketing of poultry products, and Newcastle disease occurrence and control. We did the data cleaning and the descriptive statistics using SPSS, and we conducted the econometric linear regression endogenous treatment model using STATA. So as we see from that pie chart is that we almost had 50-50 representation of female and male-owned poultry enterprise keepers. What I have highlighted in red is what was significantly higher. And so what we see is that the characteristics of the male poultry keepers, they were at an advantage as compared to the female poultry keepers. So we find that the male poultry keepers were slightly older, significantly older than their female counterparts. They were also more advanced in education as compared to their female counterparts. And they had the only point where the female poultry keepers had surpassed the male poultry keepers was in terms of the household size, because they had significantly higher household sizes. In terms of the land size, the men were leading, and also in terms of the number of birds kept, the men had more than their female counterparts. And so we looked at the mode of vaccine administration that they were using. In this case, we disregarded what vaccine they were using because they were using them interchangeably. And we found that I think because of the promotion of the thermotolerant Newcastle disease vaccine, then most of them had adopted use of the eye drops mode of vaccination, and also mixing it with drinking water. So for the nasal drops, there were very few that were using it, and so the number of poultry keepers that were using that were administering it as nasal drops was not sufficient for us to carry out a regression analysis on it. So we dropped it at this point, and we only proceeded on with the two modes of vaccine administration, that is the eye drops and mixing with drinking water. So those are pictures of the two modes of administration that we moved ahead with. So the first picture on the left is administration as an eye drop. And then the second picture, you can see the watering equipment there, and that was where the vaccine had been put. So what we found out is that in terms of the income generated from the poultry enterprise, we computed it as the annual per adult equivalent amount. And what we found is that there was no significant difference among the female-owned poultry enterprises, regardless of which, in terms of the income, whether they administered it as an eye drop or mixing it with drinking water. But when it came to the male-owned poultry enterprises, we found that there was a significant difference, with those administering it as an eye drop generating more income as compared to those who are mixing it with drinking water. So these were the means and the standard deviations of the variables that we used to run the regression. And what I have highlighted in red is what was significantly higher. And what we noticed, just like I had pointed out previously, is that the men who are now keeping poultry seem to be at an advantage as compared to the females. The only advantage with the females is actually not an advantage, because the first one is that their household sizes are bigger than the men. And then credit, they are obtaining credit for using the poultry enterprise more than the men. And these were the models, statistics for the regression model that we conducted. And as you can see from the p-values is that our models were statistically significant. And for the likelihood ratio, the significance tells us that the treatment and the outcome equations are dependent, and so our estimates are not biased. Those are a lot of numbers. What I have highlighted is what was significant in influencing the impact on the income generated from the poultry enterprise. And I will go to the discussion where I'm discussing these results. And so what we found out is that age had a negative and significant coefficient only in the male-owned poultry enterprises. And the implication of this is that the younger male poultry keepers who are using either of the two modes of the vaccine administration had a positive impact on income. And then we had the household size. It was negative and significant in the male-owned enterprises. And the implication of this is that the male-owned poultry enterprises that had fewer household members were more likely to achieve a positive income impact on income generated from the enterprise. So we also found that the land size also was negative and significant, which implies that the male poultry keepers are probably putting in a lot of effort in terms of poultry production, because then they know that with their small land sizes, they have limited options to generate more income from agricultural enterprises generally. Then for the flock size, we found that it had a positive and significant coefficient. That's for both the female-owned and the male-owned. And so this tells us that we need to keep encouraging these farmers to keep larger flock sizes if they are to achieve a positive impact on the income. What we found out also is that the male-owned enterprises, where they had improved breeds, there was also a positive and significant coefficient. For the credit, it was positive and significant in the female-owned enterprises. And then for the off-farm income, it was likely to influence the impact of income generated from male-owned enterprises negatively, and we attributed this to complacency in relying on the poultry enterprise by the male poultry keepers, because they knew that they had another source of income, which was the off-farm income. And now on our main treatment variable, which was the mode of administration, we found that in the male-owned enterprises, both modes of vaccine administration had a positive impact on income generated. But we found out that using the vaccine as an eye drop had a higher impact, which resulted in 164% increase in income compared to the 152% increase that's attributed to administering the vaccine by mixing with drinking water. However, in the female-owned enterprises, we found that vaccine administration as an eye drop resulted in a lower percentage of increase as compared to the male-owned enterprises. But it was a positive at 134%. However, when it came to the mode of administration as mixing with drinking water, we found that in the female-owned enterprises, it gave a negative impact at negative 114%. And so our conclusion is that there are gender differences in the impact and factors influencing the impact of the mode of administration of Newcastle disease vaccine on income. But we take note that in the female-owned enterprises, it is lower than in male-owned enterprises. And what we can also conclude is that the structure of poultry production is changing, and if these changes are not well managed, women could fail to benefit from this enterprise that's perceived to be in their domain, because men are positioning themselves to take advantage of the new opportunities in this enterprise. And so our recommendation is that in terms of administration of the Newcastle disease vaccine, that in the female-owned enterprises, it should be highly recommended that they use the eye drop as the main mode of administration. And we also recommend that research and development agencies that are designing interventions that are targeting women should make sure that they integrate gender-specific aspects so that women are able to realize the benefits that arise from these interventions. My acknowledgement goes to CALRO for the logistical support, and also to the Kenya Climate Smart Agricultural Project for providing the financial support to conduct this study. Thank you.
Let's appreciate her. Thank you, Tabi. We can have the presentation by Willie Mwangi. Then I guess the recording will be played after Willie. Karibu Willie.
Okay, so good morning. Good morning once again. So you're in Turkana, or you're in even Nairobi. You're handling a case of, say, a fracture in a dog. And the last time you probably handled such a case was maybe when you're in campus, and at that point, maybe you're just assisting the clinician on duty. So, and you know, the only solution to this patient is a surgical intervention. So the question is, what do you do? So that's why I'm here to talk about the newly established college of consultant veterinary surgeons. And I'm just here, this is not scientific, it's just a sensitization so that we know what we have and we know where we can get help when we need it as such. So just a couple of background. In fact, this slide is not important. Just, you know, the usual, the VP Act is the one that, you know, establishes the KVB. KVB is the one that regulates the industry. And the reason why I did that slide first is because it ties to this next slide. In that, the Veterinary Surgeon and Veterinary Paraprofessional Act, there is also a provision for establishment of specialized colleges, okay? And in line with, the surgical discipline, there are already some internationally renowned colleges, which will probably at one point in your practice have either read one of their article or a guideline. And importantly is the American College of Veterinary Surgeons, the European College of Veterinary Surgeons, the American College of Veterinary Anesthesiologists, and the other allied disciplines like emergency and critical care, ophthalmology, and also things related to imaging. So what these colleges do, they actually give guidelines in terms of how do you train a professional or a specialized personnel who can handle a certain case at the highest level. And then how do you, accredit that person and accredit their practices. I'm sure you've seen probably when you're doing your reading or you're doing some research online, you've seen maybe, a hospital written something specialty in emergency care or specialty in ophthalmology. So that's the discussion now we want to promote even at our local level so that we have accredited specialists and we have accredited practices that you could refer your cases to. So in line with that also, so the Veterinary Board has established guidelines in terms of establishment of these colleges. And I think that guideline, if I'm not wrong, came to effect in February of 2016. And that's what now gives the power, to establish the different colleges, like the College of Veterinary Surgeons. So in terms of the pathway of forming such a college, it will be important, first of all, to understand who are we talking about when we talk about a consultant or a specialist. In a nutshell, this is just somebody who, number one, must be a veterinarian. So they must be, they must have undertaken a Bachelor of Veterinary degree as such. And then they can either have some postgraduate training, either at master's level or at doctoral level. And they can also, show that competence through either scientific research and publications. And importantly also, experience. In fact, for us, experience will probably be the key thing because our discipline is more of doing rather than your paper qualification. So experience becomes very, very key as well. So in a nutshell, if you're to form a college, and basically this is the procedure that we undertook to form the College of Veterinary Surgeon, you at least need 5 founder members, and these 5 founder members need to have the kind of the highest level of qualification and experience because they will be setting the guidelines, setting the grounds where the other people now can come and link up and become accredited. So then, of course, the 5 will get their dossier together, which includes their qualification and their experience. They send that document to the board. The board reviews those documents, and once they are satisfied, the board will request them to pay a certain fee. Then after that, then the board inaugurates the college as such, and it becomes effect. Then the board will also give the college a certificate of registration so that it is legally known that there exists a certain college of specialists, and then also gives certificates to the specialists or the consultants so that also they are well known that this is a specialist in a certain field. And then from there, the founder members will now, develop the constitution and bylaws that guide that college. and also now start running the affairs of that college, including now recruiting new members and accrediting them, and eventually, of course, also looking for partnership and expanding their responsibilities and their roles. So in terms of the Kenya College of Consultant Veterinary Surgeon, our journey started with the inauguration in December 21st of 2022. But I can tell you the discussion actually started way before that. I think 2017 or thereabout. And it has been up and down because especially, as I said, the 5 founder members and the qualification, it's at the highest level, and so that's actually where the difficult is, because it's quite, you require highest level of education, qualification and also experience. Now, in the current phase that we are in, we are developing our constitution and our bylaws. That should be coming to, we should be concluding that before the end of June. That's our target. And then we are now recruiting new members and also looking for partners so that we can advance our role and responsibility. Now, in future, then we start carrying out our mandate and our responsibility. Now, this slide looks busy, but it's just to demonstrate that within the veterinary surgery, it's a wide discipline, but what we have done is we have broken it down into some subspecialties. Currently, we have registrations in small animal surgery, anesthesiology, large animal orthopedics, and equine surgery, but then we have others that members can link and join into. So this is a very important slide because those are the founding members, and I'm happy that 2 of them are here. Professor John Mande, who is also my boss. Then Professor Eddie Mogoa at the back. They have done an astronomical work to get us to get us inaugurated and registered. I think I just came in when the heavy lifting had been done. However, apart from that, we have our chairman, our current chairman, who is Dr. Vijay Verma. Again, he's been quite instrumental in the foundation of the college. He's an equine consultant. He's an equine consultant. Then we have Professor Mbidhi, who is a consultant in large animal orthopedics. Professor Mande, consultant in small animal surgery. Professor Eddie Mogoa, consultant in anesthesiology. And yours truly, consultant in small animal surgery. So that we know when we are calling for membership, so the question always is, what is my benefit? What will I gain if I become a consultant? Number one, of course, is being accredited at the highest level of qualification and capability of doing what you claim that you can be able to do. And then, of course, our key thing will be to develop guidelines in terms of postgraduate training. And of course, crediting now new consultants and of course their practices. And then developing CPD. This is our, we really want to focus on this so that we keep building the hands-on surgical skills rather than the book skill as such. And then of course, research and publication. We've been talking a lot about AMR, and you know a lot of things, the Donkey Sanctuary mentioned about their clinic, so we can link with this institution and now develop this research and CPD program. And of course, another 2 very important things that are dear to us is the nurturing scholarship in surgical discipline. So we want to raise grants to support our postgraduate students. We want to even offer scholarships for postgraduate students, and importantly also organize exchange either locally or internationally as such, and then of course mentorship. Now I'm about to finish. In terms of a criteria for membership, it's very simple. Number one, you must be registered by the Kenya Veterinary Board, of course, and you must be compliant with the Code of Ethics. Then you can you can join in this 3 track. The first track is where you have 15 years of experience, and then you demonstrate that indeed you have acquired some experience in veterinary surgery discipline, either through research or CPDs or any other things that you can prove that skill. And then the second track is, of course, a master's degree with 10 years of proven experience. And then the last track is either you have a doctor of philosophy, and then you have 5 years of veterinary education. Now, if you are interested, and I know there are a lot of people here who I hope are going to be interested and are going to join the college, the procedure is very simple. We have both a physical and an online form. I think it should be in the KVB website, where you just fill in your detail, submit this to the board, and then we review. And once we are happy that indeed you meet the qualifications, you get accredited and you become a consultant. So in conclusion, what we are saying is the establishment of these colleges, and specifically the College of Veterinary Surgery, is actually timely and aligns to international practices. And then the most important thing is that we are providing a platform where you as an expert in any surgical discipline can come together. Then we utilize our knowledge and our experience to advance this discipline and importantly clinical practice. And also, we, as I said, we are very, very intentional in terms of nurturing the next generation of surgeons. And this we are going to do by, supporting them through scholarship and grants, and importantly, through mentorship. So I hope I have convinced, and I can see many people here who qualify, that you really need to be part of the college. Thank you so much for that.
Thank you, Willie Mwangi. Now we'll get to our last presentation, but before that, the vehicle by registration number KCM 864S. Kindly, the car is wrongly parked. Kindly go and do the needful.
Good morning to all of you. I hope you have settled well in Kakamega. My name is Dr. Marilyn Karani, and I am honored for the opportunity to share the knowledge I have gathered on gender equality. I am the executive director of a consulting firm which we called Gilead One Global Health Consultants, and our vision is our vision is optimum global health. I formed this company having reinvented myself from a career civil servant for 35 years. I have now become a business executive, and I'm happy in that space. Allow me to point out that there is limited information on gender equality in Kenya, particularly our veterinary profession. And it's my hope that going forward, we'll have many people undertaking studies on this area. So without much more wasted time, let us move to the presentation. The title of my presentation is Gender Equality and Professional Well-Being in the Veterinary Profession. So my presentation outline will include introduction. There'll be something on gender equality in STEM, gender equality in the veterinary profession. We'll talk about why we aspire to gender equity. We'll also talk a little about the impact of gender inequality on mental health, the symptoms of mental illness, preventing gender inequality-related mental illness at work, system-wide strategy for gender equity. We'll also address gender equality in STEM and the veterinary profession, And finally, we'll end with the strategies for gender equality at the workplace. So, the objective of this presentation is really to create awareness on the impact of the gender inequality on mental health in the veterinary profession. And so to start us off, I'd like us to remember that the story of veterinary medicine goes back to a gentleman called Ulu Galedina, who lived in 3000 BC in Mesopotamia. He was the expert in healing animals. Vet school didn't take off until 1761 in a place called Lyon in France. And back home here, the first class of vet graduated in 1970, and there was only one female veterinary doctor by the name of Dr. Rachel Masake. So, how do we define gender equality and gender equity? I'd like to say that gender equality is treating everyone the same way, often while assuming that everyone also starts out on an equal footing or with the same opportunities, which we know that doesn't often happen. Gender equity, on the other hand, is working towards fair outcomes for people or groups by treating them in ways that address their unique advantages or barriers. So that is the difference. So you see that equity, gender equity, is the means of getting to gender equality. And we need to note that advantages or barriers are due to systems, biases, and privileges outside of individual control. So, as we'll see a little bit later, some of the biases is our cultural norms, which we think are okay, but they are really biases against one gender. And so a bit of information on what is happening in the workforce. We know that globally, 47% of women participate in the workforce compared to 74% of men. We also know that women global share of leadership is increasing, but we haven't reached the 50%, so that the women in senior roles make 31%, which is a far cry from what it should be. Even with the 31%, the women are overrepresented in the support functions, whereas men are concentrated in operations and other areas which are viewed critical, such as CEOs and board-level positions. So what does this mean? The women are missing at the decision table because the CEO and the boardroom is where policies are made, is where major decisions are made. So if the women are busy sweeping, cleaning, and not being on the decision-making table, it means that their voice is not heard. So in Kenya, an example, the cabinet, the current one of 2023, does not meet the threshold despite the dictates of the Constitution. And this picture ahead of us is what the Constitution looks like. You can see there are how many women? 1, 2, 3, 4, 5 out of 23 positions. So we have not reached that two-thirds gender rule. So what does the gender equality look like in the STEM subjects? And we can see that globally, girls and boys enroll and complete primary school at about the same rates, but gaps persist in specific countries like ours to the disadvantage of girls. You know, sub-Saharan Africa is where Kenya belongs. But if you go to Latin America, the girls are actually doing much better than the boys, and so it's a disadvantage to the boys. We also note that enrollment and completion rates are lower at the secondary level, and there are differences across countries by income level. So the poorer countries have fewer girls, enrolling and completing secondary school. We have seen in the recent past the percentage of young girls getting pregnant, and other social issues, early marriages, which contribute to this scenario. We also want to note that girls often perform as well as the men or the boys, or better than boys in science and mathematics. That's a known fact, and I have referenced Hammond, a paper that was written in 2020, and you can see it at the end of the presentation. Excuse me. So veterinary medicine is actually a STEM subject, and gender equality is yet to be achieved in the veterinary practice. We know that, for example, in Kenya, that the number of females has been increasing in the profession, but we have not reached a stage where we can say we have 50-50%. So we're still lagging behind. So according to a survey in the UK, 34% of respondents had experienced gender discrimination. And this was a study done by Freestone and someone called Remnant and Gamari. And so we know that in the veterinary profession, there's some sort of discrimination going on. It's only that, like in Kenya, we don't know what the percentages are. But we all know that there are rumors that go around of discrimination and other forms of gender issues which promote gender inequality. And 77% of the people that were interviewed said that the discrimination affected their career. In a little while, we'll see how. So what about gender equality in the veterinary profession? We know that for sure there is stereotyping of certain fields. For example, people say large animals practices are for the men, and gender inequality in placements was also reported, so that the women prefer to go to small animal clinics while the men head to the large animal practices. And there are other vices in the profession, such as sexism from their colleagues and clients. So there is outright discrimination. Sometimes when you go to the field, they demand for a male veterinarian, and such practices, such as seeking a second opinion. If I go for a clinic as a lady, and I tell a farmer that maybe your animal is suffering from East Coast fever, they're likely to ask for a second opinion from a male. Discrimination, just stemming from the culture that women are not good enough. So why should we aspire to gender equality? We know that gender equality is a fundamental human right. This is according to the UN, the Article 1. We also know that it's also in our constitution, the Constitution of Kenya 2010, which is under the Bill of Rights. You'll find the details in the references. So the other importance is that the gender equality is essential to achieve peaceful societies with full potential and sustainable development. So without gender equality, we are likely not to get to the sustainable development goals. We also need to know that women who are empowered spur productivity and economic growth. There's a phenomenon in Kenya, the women groups, and I think all of you can witness, perhaps through your mothers or sisters or daughters, just how powerful these groups are in terms of providing for the family. So gender equality is that important. Now, what are some of the impacts of gender inequality? I want to say that gender inequality, has many vices. One of them is gender-based violence. We also have compromised physical and mental health. Inequality causes unequal access to quality education and health, and also to economic resources, and also participation in political life. It also causes unequal opportunities to employment and positions of leadership and decision making at all levels. There are many other vices that, attributed to gender inequality, and that's why it is important that we handle it, so that both gender can enjoy human rights and a fruitful life. So I want to dwell a little on the impact of gender inequality on health. And I would like to say that when we talk about gender, most often we talk about the women, but we know that there are cases where the gender that is suffering is the male, and therefore each gender has to be promoted so that we have equality. So the first thing that happens to someone who has a gender inequality problem either has been violated by physical harm or psychological abuse or sexism or discrimination is the psychological effects. And from this, you get higher levels of stress, anxiety, depression, and post-traumatic stress disorder in the marginalized gender. So whichever gender it is, they're going to suffer this. You will remember from our studies that when you have anxiety, you have cortisol, and with cortisol, a lot of other things come in. So you get a compromised immune system, you get physical illness, and you get social phobia leading to seclusion. So somebody decides, I don't want to be part of this community or social group. I would rather hide in my closet. So you also get mood disorders. You get depression. Of course, you witness lower socioeconomic status, and you also witness poor health indicators. So like these people, because of their stress, they're never going to be, 100% okay. They will have a compromised immune system, so that if there's a bug going around, they'll be the first to catch it, just because they're suffering from gender inequality. So how do we recognize that a colleague is unwell? And I hope we recognize that most of the symptoms we've been describing earlier is really mental health issues. So the first thing that we see from these people is withdrawal from friends, family, and colleagues. These people prefer to be alone. We also see avoiding activities they would normally enjoy. They either sleep too much or too little. They eat too much or too little. And also they feel hopeless. They will have consistently low energy, so people are tired all the time. They may begin to use mood-altering substances such as alcohol or nicotine, just to kind of like hide away from the emotions that they feel. You also see a display of negative emotions. People might, just have outbursts, or they might fight easily, or get into an anger rage very, very easily. They often will be confused, and they also think about causing physical harm to self and others. So that means they could be contemplating suicide. So those symptoms are heavy, and we need to figure out how to address this on an individual and as a community. And I would like to suggest that the first thing we should do is to address workplace harassment through good human resource as well as professional body policies, which encourage reporting and punishing the perpetrators. I haven't looked at our KVA policies so deeply, but we do need to have something on gender equality to encourage mental well-being. The other thing that we need to do is to have gender equality training both in the veterinary curriculum as well as in continuous professional development. So provide we also need to provide a gender-friendly environment, beginning with the infrastructure. I don't know how many hotels I have been to, and you find the washroom that the female gender goes to does not have hooks to hang handbags, is not friendly for what we, for the attributes that are attributed to the female gender. And so we have to start, beginning from the infrastructure. What will it take for both gender to be comfortable? So that we can do as an association, what we've spoken about, but we also have to consider the systems. How do we deal with a wide system to encourage gender equity? So some of the things we may do is to feature female role models, and these role models provide examples of the kind of success that one may achieve. The girls, either the girls or the boys can emulate this role model and see that themselves in this role model. We also need to promote partnerships with the private sector so that the private sector can play a role by bringing financial support to non-profit STEM initiatives, and also by facilitating exposure to female role models and internship opportunities targeting secondary schools or boys, whichever the case might be. So that role modeling is very important. We also need to address gender biases in learning materials, so that if there are female authors, we should have their biographies, so that, or male authors, we should have everyone's biographies included. We also need to engage parents, encouraging them to take their children, to encourage their girls or boys to do STEM subjects, and this way the parents can contribute in reshaping the girls into participating in veterinary medicine. We also need to encourage participation in extracurricular activities, and have visits to veterinary medicine campuses, museums, competitions, extracurricular clubs, robotics, everything that will encourage girls to step into the STEM area. So what about strategies for gender equality at the workplace? I would like to suggest that, first of all, we need to have parental leave policies where both gender, when they have a baby, both of them should go on leave. We should have flexible work, to encourage each gender to be the best version of themselves. We need to have employer-supported childcare, and I think it's high time that this public service began thinking like this, that people are stressed if they have to mind their children away from the workplace, and so we need to figure out how to go about that. We need to have anti-sexual harassment policies visibly displayed, and I know that in the offices these policies were not there. We need to have salary history bans, pay transparency. This may not be very prominent in the civil service because it's an equal opportunity employer, but in some private organizations there is discrimination on the amount of money that everybody takes. We also need to address gender wording on the job. How do we communicate? Do we include both gender? We do need to test the role models and mentors for women and male-dominated sectors of work. So like in veterinary, which is one of them, do we expose our women role models, our male role models, so that the girls can know that something can be done about this? The other thing is to combine mentoring with professional development, and I think KVA has done really well in this area. We do need male advocates. We haven't seen so many of them. advocating for gender equality. And of course, we do need to have increased visibility of female faculty. The other thing we need to do at the workplace is to use gender inclusive communication. Very, very important. How do we communicate? Do we joke around with one gender? So an inclusive gender communication strategy is very, very important. In conclusion, I would like to say that the way to tackle gender inequality is through our organization culture, where accountability, language and communication, organizational values, role modeling, team norms is encouraged for gender equality. We also need to look at our systems in terms of hiring, performance management, promotion, recruitment. We need to look at our policies, things like family leave, flexible work hours, non-discrimination, pay, sexual harassment, all those. And finally, we need to look at our programs. Are they inclusive? Are we mentoring? Are we sponsoring? And with that, I would like to say thank you very much for listening to me. The subsequent slides are the references that we need, and kindly go through them as we learn. I would like to thank you and happy day.
Let's appreciate. Many times when I get to hear about gender, the more I realize that my understanding about the gender concept is still limited, and I still need to learn more so that I can comprehend this concept about gender equity and equality. So that's our last presentation for this session. We'll be having a Q&A after tea break. So at this juncture, I want to release you so that you can go and have our tea. It is already 5 minutes past 11:30. So kindly, I plead with you, let us ensure that we are here exactly at noon so that we can have a second session of the day. Enjoy your tea. So members, welcome. I'm still waiting for the session chair, but as we wait for them, we can be doing something. I will be getting a first presentation for this session. I hope you had, you enjoyed your tea by Jessica Kurere. That is a conservation of lions through domestic dogs and cats in Samburu County, the Community Animal Health Initiative.
All right, thank you. My name is Jessica Kurere, and I'll be presenting today on lions and lion conservation in northern Kenya, but not the approaches that we know. We'll be talking about the One Health approach to wildlife conservation in northern Kenya. As I said, my name is Jessica Kurere, but I'm not working alone. We are a team that is working together of veterinarians and conservationists to be able to do this program that is called the Community Animal Health Initiative. And so I'm presenting on behalf of the director of Ewaso Lions, where we are based, Dr. Shivani Bala and Solomon Denasalia, Dr. Mosin Lokiniwala, who is our vet colleague, and Dr. Stephen Chege, who's also a veterinary colleague. All right, just to tell you a little bit about where I work and where the Community Animal Health Initiative is based. So we are based in Samburu. The nearest town you probably know is Archer's Post, so it's about 2 hours from there in a community conservancy called Westgate Community Conservancy. The partner that we work with is called Ewaso Lions, but they work through the whole of northern Kenya, so their mandate is to conserve lions and other wild carnivores throughout the landscape. And so I'd like to tell you a little bit about the landscape where we work in Samburu. I'm sure all of you would know. As you can see in this picture, this is how our landscape looks like. So we are predominantly pastoralist communities. So we keep sheep and goat and camels, and donkeys are our vehicles. So we have quite a lot of working donkeys in our area. And so this is the livestock are drinking from the Ewaso Nyiro River, which is the permanent source of water in our landscape. For both people, for the donkeys, for the wildlife, for the elephants, I'm pretty sure there are elephants somewhere near here because this is the permanent source of water for our area. So everyone meets there to take water. And so the land is divided into community conservancy, which is a bit different from southern Kenya. So the land is communally owned by the community, and it is structured into conservancies. So for example, where I mainly work is called Westgate Community Conservancy, but we have a lot of conservancies that are in the landscape, and they're managed by the community. So the communities, they don't have fences. They're all Samburus, so they move wherever there's grass. For example, in 2022, there was grass in Westgate Community Conservancy. We had everyone in Samburu, from Somalia, from everywhere they had come to our community conservancy because that is where there's grass. So there's no bounds. As people are moving, wildlife are also moving because there's no boundary. So as I have alluded, there's also wildlife in our conservancies, in our landscape, in the community conservancy. As you know, in Kenya, over 70% of the wildlife population live outside protected areas. So they live within community conservancies like ours, and it looks like this. So we have, like, this is a lion that lives in the park, Samburu National Reserve. We have 3 reserves, Samburu National Reserve. We have Buffalo Spring, which is divided by the river. It's across the river, which is in the Isiolo side. But we also have Shaba National Reserve. So this lion is an example of a lion that lives inside the reserve, but a lot of them actually feel more comfortable living outside the reserves into community land. For example, where we are based in Westgate Community Conservancy, we have about 7 lions that have made community land their home, and that is where they thrive. And so that is how the picture looks like. And to also narrow down to the part of the community that we always forget, we have the Kenya Wildlife Service that is talking about the lions. We have the Samburu County government talking about the sheep, the goat, the livestock, because that is a backbone of the pastoralist community. Then who talks about these people here? Most of them are called champions. So who talks about champion in the areas? So the dogs also play a very, very, very important role in our pastoralist community, especially when you talk about conservation. When we have a lot of interactions between wild carnivores and domestic animals, there's bound to be conflict. When you're talking about drought, there's no food, so they will go for easy prey, so they end up predating on domestic animals. And so they have dogs. Dogs play a very big role in alerting the herders of predators around. So we have a lot of leopards, we have wild dogs, we have a lot of wild carnivores other than lions, and they often come for domestic animals. So dogs play a very big role. So you'd find that if you have a lot of livestock, you tend to have quite a lot of dogs to be able to guard your livestock. So in our community conservancy, we have mentioned I work, Westgate Community Conservancy, we have about 800 dogs, and most of them are owned dogs, so we don't have a lot of free-ranging dogs. So we have an average of maybe 3 to 5 dogs per homestead. So that is where we work. So to move forward, so what are the challenges that lions are facing, and not only lions, but other wild carnivores in our area? We have seen a lot of this. This picture I took in a place called Loijuk. This is in Kalama Conservancy, but it borders Westgate Community Conservancy. As you can see, during the drought that we had talked about, there was little grass in our landscape. And so when there's no grass, how does grass affect the lions? When there's no grass, there's no warthogs, there's no antelopes, there's no food for the lion. Then what happens? More often than not, the lions will come for the livestock, easy prey, and we often have conflict. So one of the biggest challenges is when the warriors who are tasked to take care of the livestock within our community, they come and they kill the lions and other wild carnivores because they have killed their livelihood. And that is understandable. If you had one camel and that is your source of livelihood, and the lion comes and kills it, you would be angry. So we sympathize with them. So this happens. It's funny because last year when we had the drought, we had the highest population in our study area. We had about 50 lions in the drought because the animals were weak, so we had quite a lot of food for the lions. When it's raining now, this is when we're having a bit of a difficult time because all the animals are strong. and the lions are struggling a bit. So this is one of the conflicts that we have and the challenges facing lions. But those are not the only ones. They have evolved with time. There are a lot of challenges that are coming in. As you can see, this is Archer's Post. That is our Nairobi in Samburu. That is where we go and buy clothes and buy our grocery. It's about 2 hours away from our camp. It's quite far. But this town, as I said, we have 3 national reserves in our area. This town sits right at the center between Samburu National Reserve, Buffalo Springs, and Shaba. And before, a while back, this town was not there. So this place was a corridor for the wildlife to cross. They would move from Samburu to Isiolo and cross wherever they would feel safe and where there would be food. But when you have urban development, people are living there, there's no corridor for them to cross. And with development comes roads, infrastructure, and that is one of the biggest problems that we now have. We actually have a program under EWASO Lions that deals specifically with infrastructure, linear infrastructure. As you know, we had the LAPSET project coming in, moving from Lamu all the way to Somalia, and the pipeline that, not the pipeline, the powerway that was constructed was cutting across where the gravy zebras were giving birth, and that was a big problem, and that is why we had a committee coming up to talk to them and the LAPSET team so that we can plan development, linear development well. And this linear development comes with its challenges as well, because a lot of these constructions of roads and pipelines and powerways come with invasive species. And this is one of the challenges that is coming up for lions right now, invasive species. So this here is called Madenge prosopis. I know most of you have seen it. It is coming up in a very high speed in Samburu now. And it's not a good thing. For now, it looks very green, and desertification has been addressed because that was the intention before when it was introduced. But as you can see, it is said that it takes about 36 liters a day just drinking up water, and it is contributing to this desertification. More than that, there is no grass that can grow at the bottom. So there's no grass, it's aiding into desertification. And so when we don't have grass, the lions don't have food, and the conflict becomes a cycle. But for now, in our community conservancies, the Madenge has become the home, a thriving home for our lions. In fact, that is where they give birth, but in the long term, it's not a good thing for the lions. So please think about such challenges. There's a conference that is coming up in September. It's called the African Conference for Linear Infrastructure and Ecology. I would encourage you, EWASO Lions is part of the organizers, but there are no vets who are talking there, and it's quite unfortunate. It would be interesting to have some of you presenting. There was also an effect on One Health. It was said that the Madenge is promoting mosquitoes, a lot of it, and contributing to malaria, and that is a public health concern. So that is something we can explore, and that is a challenge for lions. And we also have clinical cases. Lions get sick, lions get injured when they're trying to attack a zebra. This lion is called Nanai, was kicked. And so when we have clinical interventions, where is the hospital who can treat them? We have an amazing team of Kenya Wildlife Service veterinarian who is based in Samburu, who comes and attends to cases in northern Kenya, and they attend to clinical cases. So this is Nanai. She's looking very much better now. She had undergone a surgery because she had been kicked in the jaw, and she had young ones and were depending on her, so we had to intervene. And the Kenya Wildlife Service veterinarian intervened. So they're doing an amazing job. So we're addressing all these challenges through many programs that are going on. But there's one re-emerging issue that is coming up, and as a veterinarian, it's very concerning. The issue of infectious diseases at the boundary. As I said in the first picture, I'll quickly go back. When we have a lot of close interactions, it's a good thing because the dogs are playing a very important role, but because of the interaction with the drought, there was little water. The jackal is drinking here, the dog is drinking here, the lion is drinking here, maybe a dog with distemper is drinking here, everyone is meeting here, and it's a very good breeding ground for diseases, and that is how it's coming up. Diseases is becoming a big challenge. One of the diseases of interest is rabies. As you know, is endemic in our country. It's actually quite common in Samburu. Most of the communities know dog disease. One of the major diseases is rabies in the domestic dogs. And they even have a name, they call it Nkwang. And they've also seen rabies in wild animals. A hyena was seen not too long ago, a few years back, a rabid hyena in our conservancy. So it's a major concern for conservation, but also a major concern for public health. This is not in Kenya, this is in Tanzania. A rabid dog going to a lion. Unfortunately, if this dog is bitten, there is no treatment for rabies, even in lions. So that is a major concern. Another disease that is coming up, and we had a presenter last year, Dr. Shalini Angwenyi presented on canine distemper, but this is a very, very, very big issue that is coming up now. This is a painted dog, and they're critically endangered. I don't know, how many people have seen a painted dog by raising your hand? Wow, you're very lucky. Very, very few people get to see. I think Dr. Gakuya has seen too many. So this is a painted dog, they're critically endangered. You're pretty lucky to see them. And this was taken in Kalama by one of our staff, Ewaso Lions, in 2019. And this painted dog had canine distemper, unfortunately died, and a few others died of canine distemper. Unfortunately, by the time you're calling the Kenya wildlife veterinarian to come and treat this wild dog, it's often too late. They live in a pack, so the rate of infection is quite high, and almost all of them die of this disease. So canine distemper is not new. It has occurred before in the Serengeti. I think many people have heard of that. We had an outbreak in Serengeti that killed over a third of the population of lions and other wild carnivores. But it's not only, even in seals, it has been documented to occur. And the most recent outbreak was in 2017. As you know, Laikipia had almost the highest population of painted dogs, and we had canine distemper in 2017, and it wiped out the entire pack in Laikipia, and only one female was left, and she was wandering around. Thank God for the population in Samburu, and they have now slowly reproduced, but there are very few and still coming up. And just to tell you a little bit about canine distemper, they come with a variety of symptoms: diarrhea, pneumonia, seizures, coughing, anorexia, and it's almost 99 case fatality, and it's very bad when we get it in wildlife. So what have we been doing about it since then? It started out with a vaccination campaign. I think you've seen in the activity last night, KVA Wildlife Branch have been doing a lot of work on vaccinating in Samburu landscape, led by these two veterinarians, Dr. Mosin, Dr. Stephen Chege, who have been helping facilitate the vaccination efforts. And this is me, I was actually volunteering at that time to help vaccinate the domestic dogs against rabies and canine distemper. Something interesting to note, it has started out with rabies, but then canine distemper disease came and the dogs were dying. So the community was saying, was it your vaccine that was killing our dogs? So we had to incorporate vaccination of canine distemper so that our efforts are not antagonizing each other, so that we just vaccinate for both in case it's an outbreak of canine distemper. So vaccinating was a good thing, but unfortunately we would volunteer, would vaccinate the dogs, and the vets would go away. And we say, canine distemper is there, but who monitors the dogs through the year? So you come back, the community are angry, you have killed our dogs, and you come and say, bring your dogs, we vaccinate. Will they really accept? You don't know what has killed the dogs. Was it canine distemper? Was it the locust during the spraying? Who knows? So there was a big need to have a veterinarian on the ground working every day to see and to do disease surveillance to understand what exactly is happening with the dog population. And so the program was birthed from the vaccination campaign. It's called the Community Animal Health Initiative. It's taking a form of a mobile, domestic animal mobile veterinary unit as well there in Samburu. And it's a partnership. We're based at Ewaso Lions, but it's a partnership between organizations, Vet in Wild, which is directed by Dr. Stephen Chege, who's a veterinarian, Animal Care Center, which is directed by Dr. Mosin, who's also a veterinarian. But we also have the county government of Samburu that we are working very, very closely. We actually have an MOU with them so that we work together to achieve this bigger goal. And of course, Kenya Wildlife Service, because we are working together with them to conserve the wildlife. So as I mentioned, the unit exists as a domestic animal health, domestic animal mobile veterinary unit. Our landscape is vast. We are currently only working within one conservancy, but there's many other conservancies now. Everyone is asking for this service. So we move around because our landscape is vast. Sorry. So you can see we move around with our vehicle that has a table, has water, has everything for us to be able to reach out to them, because we have about 8 locations within the conservancy. Most often than not, they stop me on the road because they have known the car. It's literally the dog car, they call it that. So they stop me along the road. Sometimes it's rural. There are many, many challenges. There are no tarmacs, so sometimes we have to leave our car and I have to go by foot to be able to reach the animals that I need. So one of the biggest challenge work that we are doing is, of course, providing clinical intervention for the domestic animals and, of course, doing disease surveillance. We wanted to do a population control survey to be able to understand the needs of the people. And so we did a survey, and as you can see, the needs of the community, what they had said. Predation was one of the biggest challenges because, of course, the dogs are protecting the livestock, but we also had distemper, we had starvation, and this was during the time of the drought. And we had many other things. As you can see, the female puppies were being killed because there's no one spaying the dogs, so they don't want to have many females reproducing, so they would kill the dogs. Some would say vaccinations. Puppies would be killed because you're moving around, you don't want to have puppies hungry. And so we would vaccinate the dogs. We offer population control services, but we also treat diseases like transmissible venereal tumor, among many other diseases that are in that landscape. In 2021, January, I think barely 4 months after I had come to this unit, we started getting reports of dogs that are coughing, vomiting, diarrhea, and we suspected that we were going into a very dark hole of canine distemper. And true to that, we had an outbreak. We had many people calling us at the same time, and the Samburu County government intervened and helped us to treat. Luckily, there was no wildlife that was affected. We managed to contain the outbreak, and the dogs were okay after that. But we also help the community in terms of giving them services when their domestic animals are attacked by wild carnivores. So we often get a lot of donkeys are attacked by hyenas, but we also have lions that attack camels. So we offer that service to the community, because if the animal is killed, the Kenya Wildlife Service would intervene, but if it's injured, there's no one who'd help them with that. But a lot of the work within community conservancies is about relationships and building trust. So we have a lot of education efforts that are ongoing. We have a poster. The community gave canine distemper Samburu name, which really helped. So we made a poster for them to be able to identify what canine distemper is. And we also have a film in the Samburu language to be able to make them understand the need of vaccinating the dogs, and good animal ownership contributes to having a healthy dog, and that translates to having your animals better protected. And of course, talking to children, because they will be the future leaders of our conservancies and our community land. Thank you very much. I hope you enjoyed the presentation.
So thank you so much, Dr. Jessica, for that amazing work that you're doing in Samburu. Isn't it amazing? Yes, it's quite impactful, and just to see, small contributions, but with a lot of impact that is tangible. Okay, thank you so much for that. So we are moving to Q&A. Okay, so we are going to have a very short session on Q&A for the first the session that we finished right before tea break, and then we'll pick it up from there. So Gonji.
So if you have any questions for these presenters, kindly raise your hand wherever you are. The mic will be passed to you.
Thank you. My question goes to Dr. Willie on the Kenya College of Veterinary Surgeons. I liked the pathway the college has adopted for identifying the consultants. I just have one or two comments. The first one is on the constitution that you are preparing. I think the constitution is important, but in making it, you need to closely involve the board and the veterinarians who are here, so a limited kind of public participation, because as you said, these veterinarians are potential members of the college, and secondly, that constitution would eventually be regulations of the board on the veterinary specialists in that area. Then on your roles, you said you'll be doing accreditation of consultant and specialized practices. I think accreditation should be the role of the board. Yours would be to recommend to the board what you want to accredit, because eventually it's the board that would certify. Then you are also developing guidelines for postgraduate training in veterinary surgery. And these guidelines are going to apply across whether private training or public universities. I think, again, this should be done in consultation with the board because eventually it's the board that has the legal mandate on the colleges, and what you do as specialists, you do on behalf of the board, and therefore the board should be the owner of that. Thank you.
Thank you. There's quite a lot. Anyone else?
Thank you, moderator. My name is Martin Nyamwea. Whoever will see Dr. Karani, tell her as they prepare to make hooks for the ladies in the toilet, they should also prepare to make hooks for us to hang our coats when you go to the toilet. Anyway, that's not the main issue. The main issue I'm asking Dr. Mwangi, I really don't admire you much coming with a paper with gender in between. Your founder members, as you saw, I have a very utmost respect for your group with Professor Mande, Professor Mbidi, yourself, and all the rest. But then when we're still within the gender issues, I didn't see any gender in your group. I don't know if it was intentional or it was by design. Worse still, I wonder how Maria Gutu credited you, because she's very passionate about gender. I don't know how it passed her eye. Thank you.
Thank you. We are the far end. Then we'll get the last one from Dr. Githinji, Professor.
Good morning, everyone. Mine is just a comment, and I'm making this comment hoping that the presenters accept criticism. So the presentation by Tabi, I felt like...
kindly stand up, kindly.
I felt like the research was far-fetched. Linking the usage of vaccine, whether it's eye droplets or mixing with water, with gender was really far-fetched. So maybe for future research, maybe you can link like all the livestocks. Maybe you can check whether the women get more profits than men, as opposed to just looking at Newcastle disease and trying to link it with gender. It's very far-fetched. The research was far-fetched, and as you can see, even from the findings, it was still, the findings were almost negligible between the men and the women.
Thank you.
Thank you.
We get the last one here.
Yeah, thank you. As you said, my name is Gedigia. But I think the research was not far-fetched, because it's good to start from far so that we come nearer. And in that, now allow me now to ask my question. You know, in some of these communities, they are the gender that owns a certain livestock. Because in some communities, chicken are for ladies or for women. In other communities, goats are for women, then cattle are for men. In this particular community where you did your work, is it that they are changing, such that maybe before chicken used to belong to ladies, to women, and now they are changing? And if that's the reason that's happening, could it be because they have found that actually you can make more money with the chicken, especially maybe where you did your work is near Nairobi? And also, of course, most of us, when you get old, you move from the broilers to kienyeji, and men can take a whole chicken around. So that could be a reason. Thank you.
Thank you. Thank you.
Okay, thanks for that first comment. About whether this is a changing, oh, sorry. Okay, if this is a changing trend in the area, yes, it is, because how we identified who owns the poultry enterprise, we had a set of 4 questions that we drew from the property rights literature. And so initially when we get into, yes, we had the village elders who had given us the indication by clustering who owns it. But then the minute we get to the household, our first question, we would ask them, kuku ni za nani? And almost in all the households, they would start by saying kuku ni za mama. So after that is when now we would ask those 4 property rights questions, and then it was based on those responses that we were able to categorize. And so the fact that they would say kuku ni za mama, then it seems even in that area, the perception is that kuku ni za mama. But it seems to be a changing trend. About whether probably they are realizing that they can make more money from poultry, that is an empirical question. We probably need to try and figure that out. But what we also did is, which I didn't present here, we collected data from all the other enterprises, and so we shall be able to compare that and see how much they are getting from the poultry enterprise compared to the other enterprises. Thank you.
Thank you so much. I'll respond to a couple of questions that have been directed to me regarding the college. Daktari, it is true. The role of, accreditation of practitioners and practices and, issues to do with training, it's actually the role of the Kenya Veterinary Board. What the colleges are doing is actually to augment the role of the board in a more specialized group, such that if it is matters surgical, the people who understand how probably or the best way surgery can be taught, or the best way or the best practices in terms of clinical surgery will be probably the people who are practicing it. Or who are in service training that discipline. So the colleges actually work on behalf of the board. And that's why I said from the start, it is the board that actually first of all vets the founding members, and then once they are satisfied, then they accredit those members to start the college. So everything still goes back to the board. And even when it comes to, accrediting new members, the college will just vet their, their documentation and their dossier, but at the end of the day, it is the board that will actually give a certificate to accredit somebody as a consultant in that particular college. So everything is actually done on behalf of the board. And in fact, the convener of the meeting, the launching meeting was actually the CEO, KVB. Then the issue of gender, this is usually a tricky one. And I say it's tricky because we would want to be as inclusive as possible because we understand that when it comes especially to clinical work, really, you know, females would do as good as a male veterinarian will, you know, will do. The problem is when we also limit ourselves so much, it becomes impossible to move. And I'll give you an example. We, when we were, you know, starting and looking at the founding personnel, first of all, you have to be 5. So when you don't have any person who meets that criteria, it becomes very difficult. It's either you stop, you know, the process of forming that college, or you think about, do we start the college, but as we are rolling out our, you know, functions, we try to address the issue of inclusivity based on gender. And that's why we are saying our key focus will also be on mentorship, so that we can start identifying even those potential members right from when they are in their undergraduate studies, then promote them through scholarships and grants, so that eventually they become part of the membership. But as it stands right now, it is not by design that the founders were all of the same gender, but it is just that we didn't find a person who can fit the bill.
Thank you. Let us appreciate our panel. Thank you. You can get seated. We had started our session. That is the second session, which is under the theme of exotic and wild animal health and conservation. The chair of the session, Dr. Willie. Yeah, so I'm handing it over to you. Karibu.
Thank you so much, Dr. Ogonji. So we are going to move on quickly to the next session. We will have a couple of presentations coming through, and we'll start with Dr. Peter Kimeli. He'll be talking to us about factors associated with Japanese encephalitis virus seropositivity in hunted wild animals from Yamaguchi Prefecture in Japan. So Dr. Kimeli, if you're ready, the floor is yours. Thank you.
Okay, thank you very much, Dr. Willie. My name is Peter Kimeli. I work for the University of Nairobi at the Department of Clinical Studies. You will appreciate that the title is a bit different from what you have from the schedule, but perhaps just to put things into context, because I'm sure we are not in Japan, but perhaps see what they are doing there and see 1, 2, 3 things that we can borrow. We're working with a team of people. Perhaps some of you know Elvis, who is a master's student at the Department of Public Health, Pharmacology and Toxicology, and then the other team are from the University of Yamaguchi in Japan. This is an animal or an insect that is very well known to all of us. There are over 3,000, I think 500 species of this animal. They are literally present in every country. Some reports say over a half of the people who have ever lived on planet Earth may have died of a pathogen related to this particular insect. It doesn't live for long, and my friends, actually one friend says, I don't mind giving 1 to 10 microliter of blood to a mosquito just to get enough for the family. You know, it's not a problem. But what happens at the interaction between that mosquito and human being is such a devastating illnesses that has caused literally lives, millions of lives of people. While this insect is very well known here for transmitting malaria, it is responsible also for transmitting viruses elsewhere, and we'll shortly see one of the illnesses. Sorry. So Japanese encephalitis virus is a zoonotic flavivirus. It's mainly transmitted by Culex virus, Culex mosquito, and it causes acute encephalitis in mainly horses and humans. It's really endemic in Southeast Asia and some Western Pacific regions, and infections ranges in thousands, stretching beyond 66,000, 68,000, and mortalities associated with it have been over 20,000. Briefly looking at this, Culex mosquito is the main vector responsible in transmitting this virus. There are other species of mosquitoes in which viruses have been isolated, but the main problem is this. This virus, Japanese encephalitis virus, have been known to multiply highly in pigs, domestic pigs I'm referring here, and birds. And mainly the birds here are the water birds. Those birds are the water bodies. And they don't show clinical signs, but their viremia levels get to good levels where mosquito will just pick and take it to other animals. There have been reports also of the same virus being present in very good levels in blood in wild boars as well as in birds. So birds are also very important species when it comes to disease amplification. So technically, these species are amplifiers. They don't show symptomatic disease, but they become actually plays for multiplication of this virus. These are the species that shows some symptoms associated with the virus. They don't allow virus to multiply to good viremia levels, and so they cannot be picked by a mosquito from this species. Mosquito bites will eventually lead to severe disease in horses and humans. And so in the countries in which this disease is endemic, horses and humans are the main victims. It's not so clear what's the role of other wildlife beyond wild boars and the bats. And so part of this study was to try and establish whether there is evidence of natural infection of this virus in other wildlife. This is just a map to show the distribution of generally the flaviviruses. And if you look, some of these diseases are very well known to us. They are related diseases. They are transmitted by vectors. And one of the diseases that we know very well is yellow fever. And you can see Kenya is yellow. We have dengue. It's now a problem also in our country. We have the West Nile. You can see it's also present. And there is Japanese encephalitis, which if you look, it's more to the Southeast Asia, nothing in Africa, and nothing actually in America. And there is the Zika, again, Kenya is part of it. These are related pathogens. And while undertaking this study, I interacted with one scientist who came from Northern Europe, and he has worked a lot on tick-borne encephalitis. And this is also a flavivirus that's also transmitted by ticks, and it's mainly occur on the northern side of the continent. Again, this is to confirm that mosquito is not just a problem to us, it is a problem to the whole world. In fact, it could be we are just experiencing the milder side of the problem, but also the rest of the world are experiencing it in extreme. But perhaps how they've responded to it is what varies. Just to narrow down to our Japanese encephalitis virus, if you look, this is the region that is severely affected. It's really the endemic area. And if you have a good image closer to you, there's a country here in Africa, Angola, in which isolates have been found of JEV. And given the color, if you look at the genotype, they are related with some of those that occur along the equator. And it tells you there's a potential that this virus could still find its way to our country. And so it's just important to know it, but I think knowing how to detect it and perhaps how to prepare for it would be more important. I'm not an insect expert, but I know there were reports, was it this year, of a mosquito species that's native to South Asia and Middle East that was found in Kenya. And that tells you the spillage of vectors from the neighboring countries, the neighboring continent, can come with pathogens. We've experienced the grasshopper, and so we never know. It could either be present or it is on its way coming. So what would be the likely role of the wildlife in the transmission of this disease? So we went out to just try and establish whether there are antibodies in the blood of the wildlife that were killed by the hunters in the wildlife sector. Sorry. Just before this, I just want to clarify that the difference between Kenya and Japan in terms of how they manage wildlife is that in Kenya, we really have a complete balanced ecosystem. In Japan, they have more herbivores than carnivores. And they don't have carnivores that regulate the numbers of these wild animals. And so government hire people to be the lions in the wild. And so hunters go to the licensed hunters, go to the wild, and they kill to manage the numbers of the animals. And so it's permittable there. And so the poaching is really not a present word, but hunting, legal hunting is part of their regulation of the numbers of the wildlife. So the study happened in Japan, and specifically Yamaguchi, which is to the south of Japan. And if you look at a closer view of it, we focused on Yamaguchi Prefecture and specifically some cities. So cities, these are administrative regions within a prefecture. Prefecture would be an equivalent of our counties. So there had been a study or partnership between the hunters and the lab that I was working with. And for over years, they've been working together. Over weekends, the lab people would go with the hunters, and whenever they kill an animal, we would sample blood from that particular animal. And as of early this year, I think that we had over 5,000 samples from different species of wildlife. And the important wildlife that were being hunted mainly were wild boars, the sika deer, the badger, the nutria, and the macaque. All these samples had been stored at -80, and some of them I know were fresh because we were participating in the sampling, but at the same time running these samples. So just to detect the antibodies as an initial screening for us, we used the indirect ELISA, and I didn't go much into that, but mainly we prepared our own antigen and used it in the coating. But importantly is that we had the JEV infected cells that we isolated our antigen, but we had another one that had a mock, and we were trying to compare the two. So we did this and determined the difference, and the difference is actually the basis of our modeling that we'll see shortly. So this particular presentation will focus on the outputs from the indirect ELISA, but some work is ongoing on the same samples using VNT to try and verify the positive samples because of a shortcoming that I'll share shortly as well. So as part of analysis, we just did descriptives And because our, our variables were mainly categorical, so we mainly focus on proportions. And then we did logistic regression, and as a standard way of modeling, we normally start with simple logistic regression and then pick those with more than, less than p-value of 0.25 and take them to the multivariable logistic regression, and using backwards selection, would drop those that have p-values greater than 0.05 and perhaps remain with the final model. And to me, this is really important, and this, my results really focuses on the multivariable, because in this, we've controlled for confounders, and we've also explored the interactions. And then we'll see some of the residues and how they behave. Our cutoff for this is, after doing the difference between JEV and the mock, our cutoff was 0.5, so anything above 0.5 was considered positive, and this was informed by previous study of one of the co-authors here. So I'll quickly go through the descriptives, just for you to pick what is important. Is that we looked at the samples that had been submitted or picked between 2018 and 2013. And I think the most important for me is that if you look, 2021 might have been the year that gave us most of the samples. Again, we also collected across the year. Samples came in from across the year, and we wanted to see whether season is equally important. And as you can see, much of the samples, I think, came in, the samples that came in versus the positives actually were higher during autumn and followed by summer. And that is important because mosquitoes are a problem during these seasons. Again, we looked at 4 different cities, and you can see most of the samples came from Mine, but again, positivity was higher in Mine, which I think, yes, is clear here. Ignore the p-values because these are simple logistic regression, and significance doesn't mean much at this point. Again, the sexes, we capture the details related to the sexes, and you can tell they were fairly balanced, although males were slightly above 50. And then again, if you look at the body weights, we were measuring body weights of these animals. Again, you can see those that had more weight, but importantly is the species here. And you can see a bigger fraction of the samples were from wild boars, but again, positivity was very high for the wild boars. In brief, this is just a map to show where we had highest positivity, and you can tell this is the city that was affected, as Mine. This is the final model, and this is more important for me. We had 3 variables in the final model, and you can tell as the years went by, the odds were higher or more than 1. More than 1 means was associated with the odds of having that particular disease. And so maybe in the years to come, the likelihood that the positivity would be higher. 2, you can tell Mine being the reference, the rest had less odds. It means Mine was animal in Mine had higher odds of having that particular disease, and we established that Mine produces more rice, actually, and so there are many rice paddies that are breeding grounds for mosquitoes. And if you look at the species, wild boars had 365 times the odds of having the disease compared with other species. In simple, if a sample was picked maybe in 2021 or 2022 and came from Mine and was a wild boar, there was high chances that that sample would be positive for JEV. We briefly looked at the residues. There's a way of generating residues, and it really helps you to pick the outliers. You can see all of them are actually within 2, plus or minus 2. And covariance shows that they are not so bigger. So really, there were no outliers that influence our model. Our model performed very well. 93 is very good, and you can use it in prediction. But this is an ongoing study, and so this is a way to evaluate. Looking at the limitations of this study, one cross-reaction is very common in wildlife. And interpretation of this is something to think about, but VNT is ongoing, and that will really verify our results. Again, unrestricted animal movement, is difficult to tell that the animal was born and raised in Mine, and so that can be a limitation. And also, randomization, which is a common aspect of any study. With this, we can only say hunters didn't know the objective of our study, and so they may not have picked the positive ones and left the negative ones. And that perhaps may have been contained through that. In conclusion, wild boars play an important role in amplification of JEV. Very important. And maybe as we continue investigation into other pathogens, we want to see the role that some wildlife really play. And again, specifically, Sanyo Noda had the lowest odds, and maybe suggestive that there are some protective factors, meaning they were either practicing less rice farming, or there are other interventions that we didn't know that are related with the control of mosquitoes. Thank you so much for listening to my presentation.
Thank you so much, Dr. Kimeli, for that presentation. We'll move on to the next presenter, who is Dr. Francis Gakuya. He'll be talking about changing frequencies of anthrax outbreaks among wildlife in Kenya, control measures that have been instituted, and lessons learned. So, karibu, Daktari.
Thank you. I'm Francis Gakuya. I work for Wildlife Research and Training Institute, and I'll make a presentation on anthrax. We've noted some changing patterns of outbreak, which you look at. So that's the topic of my presentation, changing temporal patterns of anthrax outbreak among wildlife in Kenya and the current control measures instituted to control the outbreaks. And I'm doing the presentation on behalf of my colleagues, Dr. Isaac Rekorol, who did not make it here, and Dr. David Ndere, who is in the audience. So I think you are converted about anthrax. I think it's a disease that is well known, and it's really a bacterial disease of global health importance, especially for health security and public health. And it's primarily a disease of domestic and wild herbivores, and the causative agent is Bacillus anthracis, and it occurs as spores, mostly from soil or vegetation. But most importantly is that it has been known to cause large-scale loss of wildlife, and as we talk today, I think is the major disease threat of wildlife in this country. And it's not only in Kenya, you can see in several other countries. You can see, for example, in Zimbabwe, sometimes back, they lost over 4,000 hippos. That's a huge population. And also elephants and buffaloes. Just in 2004, you also had quite an outbreak in Zimbabwe. Again, loss. You can see 40 to 50, 70% of some of these species, bushbacks, waterbacks, nyara, buffaloes, and lone antelopes. And even chimpanzee, these are critically endangered species, and even loss of a number like 8 is also very, very important. And hippos, again, in Uganda, there is a hotspot in western Uganda, Queen Elizabeth National Park, and there are losses that have occurred. And even in our country, we've had a major outbreak in 2015, where we lost over 800 buffaloes and several other species. But most importantly also, we lost rhinos. So losing close to 10 rhinos from a disease was of a lot of concern. And another thing that we have to note is that we have weak surveillance systems. Definitely, as my colleague Dr. Kurere said, wildlife really live in very vast areas. Some of them are quite difficult to get to, and therefore many cases could be missed. Because as he said, probably the only the particular people who do a lot of this surveillance are from Kenya Wildlife Service. But also there are methods that are preferred in terms of controlling outbreak, which is carcass disposal. I think that one is known for all of us. And we have also, vaccination has also been known to halt some of these, some of the disease. So why did we initiate this study? Really is to look at the temporal patterns of anthrax outbreaks, and also what has been the measures that have been used and the effectiveness of these measures. And some of these photos are what the control measures that have been used. And the methodology really was to review, was just a review that we looked at the records of anthrax cases within the Kenya Wildlife Service Veterinary Department. And we had here, as you are all aware, anthrax is really endemic in this country, and we get isolated cases whereby you get a carcass from, but you don't get any other carcass or any other death, either within the same species or in others, or in sympatric species. So we thought if we give we give a cutoff of about 5 cases within a month, then we can define that as outbreak. Because again, it becomes very hard really to exactly say is an outbreak when you have one isolated cases, as it were, and that is what has been going on. And I think I've talked about that. And also we reviewed the measures that have been used over time. So what did we find? We found that we have had 6 major outbreaks, okay, between 2000 and 2022. So, and this outbreak, actually you can see them. The first one was in 2006. We had a second one in 2006 in 2011, 2015, 2019, and 2022. So you can see there is some pattern that is occurring. And previously we had not heard of any major anthrax or outbreaks before the 2006, probably isolated cases. And we've noted that the frequency is between 3 to 5 years. If you look at it clearly, the year it was 5 years, then it was 3 years, again, no, it was 5, 3, 3, and again 3. So it's a pattern that is coming out that there was always an outbreak. And as late as I think last week or the other week, we had a scare in Nairobi National Park showing again the same pattern, again almost 2 or so years. This actually might again show probably a yearly outbreak. And this, in 2015 is when we had the highest number of deaths. You can see we lost close to 800 animals, while in 2013 we lost about 13 animals. But then the 2 areas are different because this was in Nakuru National Park, where you have very high concentration of wildlife, and this was in Moya National Reserve, where the concentration is not very high. And the other thing that we found is that the outbreaks have occurred in specific areas, in Laikipia, Samburu in 2006, Meru National Park in 2011, Lake Nakuru in 2015 and 2019, Southwest 2019, and now Amboseli was the latest in 2022. And in 2019, there were 2 outbreaks, one in simultaneous outbreaks, which you have not had, one in Nakuru and the other one in Savo. And these are the areas. This is Laikipia Samburu, this is Lake Nakuru, and this is Moya National Reserve, and these 2, this is Savo and this is Amboseli. There's a small circle here in Nakuru, in Nairobi, where the outbreak had less than 5, so we thought we did not classify it as an outbreak because it did not reach the cutoff point. But it is important to note. Another important finding that we found is that the only recurrence that we have found was in Lake Nakuru. All these other areas we have not had recurrence of outbreak. Even Laikipia Samburu from 2005, not from 2006 we have not had recurrence, but in Lake Nakuru 2015 and 2019 we had recurrence. but the intensity was much lower. You can see we lost 146 animals from 2 species only in 2019, whereas in 2015 we lost 765 animals of 8 different species. So the intensity was much lower. The other thing that we found is that it usually affects multiple species, and in Lake Nakuru in 2015, it affected about 8 species, you can see, or even this. And in the second outbreak, it involved 2. But when you look at the proportionate mortality or deaths, the highest again was Nakuru. It took the almost close to half of the number of animals that we have lost to outbreak to anthrax, and then followed by Sub-West, and the rest have about 10% proportion. Again, what we found is that buffaloes are the most affected, the highly susceptible. As we know, is a disease mostly of herbivores, and bovidae are very susceptible, and it also has affected other bovidae, and even rhinos and white rhinos, and all these species have been affected, and you can see them. The biggest proportion is buffaloes again, but other species comes in, including Rothschild giraffe, which is also endangered. Which control measures have we used? Is deep burying and disinfection of the burial sites with the 10% formaldehyde and caustic soda. We also disinfect the carcass sites, where, especially in 2015, when we had a lot of deaths, we could not keep up with the deaths. So what we are doing is that those carcasses that dies, we are covering them with polythene just to control exposure to scavengers and flies. Then burning of carcasses, especially along the lake where the trucks could not move into. Disinfection and closure. We realized that most of the animals were dying in certain water holes. So the only thing we want to do is to close those water holes and disinfect, so that we try to reduce the transmission. But we also vaccinated animals, especially the endangered species, the rhinos, Grevy's zebra, and Rothschild giraffes. We did that. And these are some of the photos of the work that we are doing in most of them. This is a rhino that has been vaccinated, and this is the polythene, and this is the disinfection of the water holes. So in discussion, the study has shown 2 things, a number of things. One is that there's a likelihood of occurrence of anthrax outbreak every 3 to 5 years. This might change, but for now, that is what we have found. And what we have realized is that in other jurisdictions, especially in Southern Africa, Zimbabwe, there is annual outbreak. Every year, there is an outbreak. So for us, we don't have it. So what could have promoted that? And in our own postulation is that quick intervention of control measures most likely lowers the frequency of outbreak. But other than the recurrence in Lake Nakuru, we did not have a recurrence anywhere else. So this postulation really might not be true, because with the lack of recurrence, that means we might not conclude fully that this is what. With the recurrence, we might not conclude that this is what contributes to the patterns that are not annual or frequent. The other thing that we found again is bovidae, especially buffaloes, are the most susceptible, and this is already reported. And also, Lake Nakuru National Park is the only conservation area that we had recurrence, and this confirms what has been reported. There's a study that we did with Muturi and others, and again, it reported that anthrax, Lake Nakuru is an anthrax hotspot, and probably this study confirms the same. And another observation is that deep burying and disinfecting burial sites with the 10% formaldehyde, and also disinfecting the carcass site is the first line of control, which agrees with other studies. So Once you do that, there's a great possibility that you control the transmission. But another thing that we found is that if you combine the barring and the disinfection with other secondary control measures, such as covering the carcasses with polythene, disinfection of water holes, or suspected foci of infection, and vaccination of endangered species, this complements carcass disinfection, so as a primary control measure. Again, vaccination, again, is only practical in endangered species and which occurs in small populations in an affected area, because again, in common species, the logistics and the costs might be too huge. And where it affects non-endangered species, vaccination, you only target sympatric species that are endangered. So even if they are not infected, even if they are not affected, you go in and vaccinate. And this is what happened in 2019. Although no rhino was lost or died, we had to move in and vaccinate all the rhinos in Lake Nakuru National Park. And even in Savo, where we call the IPZ, Intensive Protection Zone, we had to vaccinate all those rhinos there, just to prevent them from getting the infection. So in conclusion, I think the conclusion is deep barring with disinfection remains the primary method of control, with secondary methods is quite preventive, and to an extent, most likely, it's what causes not to have a recurrence. And these emerging patterns are very important because the wildlife management authorities should be alert and vigilant, so that they put contingency measures for prevention and control. So that alertness should be there. You expect that cycle to occur, and especially when there is prolonged drought. Thank you. I think that's the much I had for today.
Thank you so much, Daktari, for the presentation. So we are going to move on to the next presentation, which is a recorded presentation from Dr. Stephen Chege. He'll be talking about Earth Ranger Health, which is a new tool for enhancing wildlife disease surveillance. So IT team, if you're ready. So in the meantime, if you have a question, please note it down. We're going to have a Q&A session right after the presentations. And then CKL, if you're ready, you'll be coming up after this presentation as one of our sponsors. Okay, we are ready?
My name is Dr. Stephen Chege, and I'll take you through our presentation, which is Earth Ranger Health, which is a new tool for enhancing wildlife disease surveillance. So this work I'm presenting on behalf of my colleagues, Charlene, Lekolol, Gakuya, Kahariri, Hassel, and Catherine. So the outline will be simple as follows. Brief on introduction, the methodology, talk briefly about the results, what we have seen so far, and make final concluding remarks. So as an introduction, I think we know very well that disease outbreaks in animals is an increasing threat to biodiversity conservation and public health. We have had diseases in Kenya, outbreaks, for example, which have had issues with biodiversity conservation. If I can talk about, for example, canine distemper virus, which has affected African wild dogs, which are critically endangered. So it's important actually to get to know all this. Diseases of public health importance, things like Ebola or even COVID-19. So we know very well, and we confirm that any outbreak can cause is a big threat to public health and biodiversity. Emerging infectious diseases, they do cause mortality and morbidity in wildlife populations, and that happens before spilling over to human beings. So it's important to monitor and get to know what is happening in wildlife species as a way of preventative measure. So early detection of outbreaks in wildlife is therefore a very crucial component of pandemic prevention strategies. Earth Ranger Health aims to connect people working in remote landscapes and the observations of animal health to decision-making in conservation, veterinary medicine, and public health. And as you can see in this picture here, this is the work of the wildlife rangers. They spend a lot of time out there in the field observing animals, the sightings of the animals, what species are they found in their area, where are they found, what is the body condition, and some of the things that they have not been doing is monitoring animal health. So we think that Earth Ranger, which is a tool that's already adopted in wildlife conservation, we can use it to get data on wildlife health. And the advantage of this, by using this, will be maximizing the efforts while minimizing the cost. We don't have to wait until we get veterinarians or animal health professionals to go out there and observe these diseases. And of course, it's the same as it happens in our livestock. It's actually the owners of the animal keepers who do the observations, and then they call in the veterinarians. So we are using the rangers to help us observe that and notify the veterinarians. So our methodology is a three-step approach, whereby there is the reporting, then there is the epidemiological intelligence, and then the response. And in the reporting, what we have done is we have identified 13 conservancies, and we want to do a pilot of the Earth Ranger Health over a 2-year period. And what we are doing is we are training rangers on how to recognize and report disease symptoms, and real-time transfer of that data to relevant stakeholders. So if one ranger is in a deep area, maybe Marsabit National Park or wherever it is, at least they can observe these any disease symptom and report to the relevant stakeholders, which is actually the veterinarians, and then that can be cascaded. Epidemiological intelligence. So use of the ER, which is the Earth Ranger platform, and artificial intelligence to show the spatial and the temporal distribution of reported cases. Once we get the disease or the cases that have been reported, it's very easy to draw a map. You can have some heat maps, different areas where these cases are reported, and that is can be a cause for concern, and maybe sending investigating teams to find out why do we have particular symptoms in one area and not the others. And that hopefully that can answers the early warning system. Then the other part is actually the response, because so what after doing all this, there must be some response. And the response, what this aims at is developing a participatory model for disease management. And we need to link that data, which will be generated, to veterinary response mechanisms, incorporating the One Health approach. Yes. So this is a map of where the pilot is done. It's across 13 conservancies. Most of them are in both in northern Kenya and southern Kenya. We have private conservancies. We have community conservancies. Yes, and yeah, so that's the area that we are doing the 2-year pilot program. So mentioning about what we are doing is together with different organizations, KWS, WTI, the DVS, other organizations like Erie, Smithsonian, and San Diego Zoo, and 51 Degrees. We are doing training to the rangers, and the aim of this training is to make sure that at least they can be able to recognize those clinical symptoms and know how to do the reporting. Yeah, because there is no need of and we want to make sure that at least whatever they report it in a standardized manner. Yes, and we hope that once all these rangers get trained, we'll have more of reporting, be it sick animals or dead animals. Like, for example, that case, the picture there on the top of a buffalo. If it's an animal is dead, the kind of information that we are training them to collect and record is what species is it, where is the area, is it an adult, is it a young animal, the age, the issue of the gender, male or female. Sometimes it's difficult to identify the age, not the age, yeah, the age or even the sex. Maybe sometimes you find a carcass that has been completely ripped off. So we allow them to write something like unknown. If it's a case of a sick animal like that giraffe with those lesions on the neck, at least they can be able to tell us it's a giraffe, it's a male or female, it's a adult or a young one. So in a very standardized manner. And once that information is, so they put it into their mobile app. And once they put it in the mobile app, it can straight go to the veterinarians through the already established mechanisms within KWS, and then the reporting and the response can be done based on what the case was. So that map there is just showing you the average, how it looks like. And if I can just go maybe to the next one. So once they go to the interface there, or the display of the Earth Ranger, so rangers will be able to get to, the app will have an area where you can talk about the live animal or the dead animal. So if they click the live animal, that is all under veterinary reporting. At least we need to know who is reporting that, the time that is being reported, the event time, that is. They give us more details about the animal, what species it is, whatever it is presenting. So the way we have designed it, we have made it very clear in a way that it will be easier for the rangers. We might not be formally trained as animal health professionals, but they can be able to give us that data. And once it's entered, that can go to a control room. We'll have also alerts to the different veterinarians working in the different regions, so that at least they can do the response. And of course, we very much aware that we have the caps under the DVS, so we didn't want to lose that aspect. So the idea here is once we get that reporting, then the veterinarians or the people, the animal health professionals that have been trained to work with the cubs, they can enter that data. And of course, after verification, because you can get some wrong information. So after verification, they can put it into the CAPS system, and that is for onward transmission to the DBA. So as I conclude, briefly, I can talk about the results. I talked about being a pilot, which we are doing over 2 years. So we have just started like a few months ago. And so far we have done training across 5 conservancies. So we still have 8 or more to go. And so far 82 personnel or rangers have been trained. Not necessarily the rangers. There are people also who are working like the wardens. They have been trained. There are people working as conservation educators, and we have trained them to be able to recognize these symptoms and report. So we have targeted the people who are normally interacting with these animals on a day-to-day basis. And development and piloting of wildlife health syndromic surveillance reporting module that has already been done and completed. We are just awaiting going to the next phase, which will be putting into that data. And during the workshops, we have engaged different people. We have had very good positive feedback, which have helped us actually to make sure that at least we are able to modify and improve on the module or the reporting. In conclusion, we know that wildlife health surveillance is a critical gap in Kenya's zoonotic disease surveillance strategy. And we hope that by bringing in another force that was not really tapped into that is the rangers through the ER or the Earth Ranger platform, we'll be able to enhance the government veterinary services and the ability to rapidly detect and respond to unusual disease preventions in domestic animals and wild animals. So I would love to stop there and thank everybody who has been helpful towards making these a success. They are more than I can report, but more importantly, the DVS, we have worked very close with the DVS, Kenya Wildlife Service, WRTI, which is the Wildlife Research Training Institute, Smithsonian, and San Diego Zoo Wildlife Alliance, who is my employer. And moving forward, we are looking at continuing training other rangers. And hopefully, in the next KVA conference, we'll have some results to present to everybody. So I'd like to stop there, and thank you very much. And in case of contacts, you can either contact myself or Dr. Charlene Angwenji. Many thanks.
Let's appreciate Dr. Chege and the team there, as well as the other presenters who have presented before. So I can see by assessment, the glucose levels must be down, or the whatever you took yesterday during the cocktail could be displaying some symptoms right now. So, and those symptoms probably can only be, neutralized by some lunch and a drink. So I'll not keep you any longer. So is CKL ready? Okay, so we can have a presentation from CKL. We are giving them 10 minutes maximum, and then we have a quick Q&A. Then if you have probably questions or you would want to pick up a discussion with any of the presenters, please do so during lunchtime. But in the meantime, CKL, the floor is yours.
Good afternoon. How are you? I wanted to do a PP, but I won't do a PP because I know it's towards lunchtime. So this is CKL Africa Limited. My name is Benson Landa. I know many people are still asking me, are you not Coopers? and chairman yesterday really. Yeah, so we are CKL Africa Limited. We transformed from Cooper Cape Brands Limited 2 years ago. And therefore today, a very brief one on some of the things the products that you may be meeting very soon. I'll start with one of the products that we have changed. Imizo, I know initially you were used to the Imizo 10 ml, but starting from next week, we'll be introducing the other SKU, Imizo 40 ml. It will be a little bit quite cheaper for the practicing vets, and we are looking forward to giving you the same quality, the same quality of the original Imidocap, but at a larger SKU. That's number one. Number two, we have recently, like a year ago or so, introduced our new kid in the block, CKL Extra Legends. It's a premium as mineral supplement for calves. The beauty about it, apart from giving you the normal minerals that your cow will need and giving it a better foundation at the start of its growth, is also giving you an advantage of other 3 products that we have included in it. Product number 1 is what you call Diamond V. And I know people who have interacted with the Diamond V will be able to give its testimony. Diamond V is a postbiotic, basically to help the calf, to help the animal be able to digest the feed better and utilize it better. One of the key things that we have realized with Diamond V is, especially when it comes to the area of managing AMR, it's coming in handy because one, what it does to the animal, it makes the immune receptors more sensitive and the animal can be able to elicit natural immunity or rather defense mechanism faster and therefore be able to fight off infections quite faster. Animals that have been on Diamond V, consistently, you find that they are less likely to be to be affected by diseases, and this is something we have done over time. Diamond V can be given to all animals at all stages, including the monogastrics and also the ruminants. And therefore, what CKL Extra Legends is doing to you, or rather to the calf, is to make sure that it gives it a better foundation at the start of the growth. Number 2, what has been added to the CKL Extra Legends is what you call Lipido. Lipido is basically a product that helps the animal better absorb the feed that has already been digested. And therefore, it reduces a lot of feed wastage through the feces. And therefore, with that, the calf, because we know early stages of the calf, the GIT hasn't really matured enough to be able to absorb the feed. This helps the calf to be able to absorb the feed faster. But number 2 of the same product, Lipido, it has high energy levels. And therefore, if your animal, because for one reason or another, you're not able to get enough energy from the other energy sources, Lipido comes in handy for you. In fact, the studies, or rather you can replace, for example, the people who are doing feed mixing, you can replace 1 kg, or rather 40 kgs of maize. What 40 kgs of maize will give you 1 kg of Lipido in terms of energy, we'll be able to sort it out. And therefore, when it comes to feed manufacturing and people who are in that field, this is a product that comes in handy for you as a feed manufacturer. And number 3, we have also added, we have fortified it with vitamin A, basically for immunity purposes. So that is CKL Extra Legends. It's a premium mineral supplement for your calf between week 1 or through to week 6. Not week 6, but month 6. Thereafter, you continue with the other supplements. Another product that maybe I've seen quite a number of good responses, or rather good discussions with quite a number of you, is Butalex. Butalex, of course, is the original perfect one. I've had quite a discussion around it, and how you are appreciating the product. One of the things that I always get questions around is about the price. But yesterday, someone was joking around saying that when everything else fails, Vitalex will be your savior. And therefore, we are there for you. The product is available. The product is available throughout our distribution channels, and you don't have to keep on, what do you call it, guess working. It's a product that single dose, if the ECF is detected early enough, single dose of the product should be able to sort it out. But if you find an advanced case of ECF, then you, of course, you need to repeat on the 48th day. But above that, you can also do your multivitamins, your iron injections, and your other, depending on the situation that you are in. If you are suspecting mixed infections, especially for anaplas and babesiosis, we know all those are vector-borne diseases, tick-borne diseases. You can also include imidocap for that, imizol for that matter. Now, the last product I'll talk about today is Bravecto. Bravecto is a product that has taken the market by storm because of its efficacy, what's giving to you as a vet, what's giving to your pet owners. Bravecto is basically an oral tablet for management, for control of ticks, fleas, and mites on dogs. Now, apart from ticks, fleas, and mites, we have also had good success stories with people, or rather with dogs affected by meiosis. What do we call it? Meiosis. I'm always challenged with language in that area. So meiosis, mango worms. And therefore for the people in the coastal area, in the larger eastern area where meiosis has been a big challenge for you, this is a product that you are 100% sure. When you give it to the dog, you don't even to keep on expressing those worms from the dog, and it should be able to dry. The other great success story about Bravecto has been on the area of mage. Mage is a huge problem if you, especially because of the follow-ups, if you have to do other the ivermectin injections. But with Bravecto, one dose of Bravecto should be able to treat the disease within 28 days. This for the modectic mage. But for the other mages, the sarcoptic and the ear mites within 14 days, you should be able to see the issue cleared. Within 21 days for the itch mites, that is the sarcoptic mite, you should be able to see the issue cleared. For the flea, which has been another huge problem, especially to the people in almost everywhere in the country, for the dogs, it has a very high efficacy and within 12 hours. In fact, when you give your dog Bravecto right now, in the next 12 hours, the fleas that were, the adult fleas that were on the dog at the time of administering Bravecto should be dead. It starts working within 2 hours, and a maximum of 12 hours, we should be able to see the fleas that were on the, or rather on the dog at the time of administering Bravecto should be dead. But then the biggest question that I normally get from quite a number of you is that I get Bravecto, but still I can see fleas. This is the thing. We know that generally 5%, what you are seeing on the fleas are only 5%. The other 95% of the fleas are in different stages of their growth. They are in the egg, larva, or pupa stage. And therefore, you will expect them within 7 to 14 days to transform that process, to come back to, or rather to finish up the process and be adults. That's where Bravecto comes in, when they are adults. It doesn't kill larval stage, it doesn't kill pupa stage. But in case a flea takes a blood meal and manages to lay eggs before the 12 hours, before it dies, the beauty about it is that those eggs are not viable. They will never hatch. And therefore, with that, you continually kill, you're breaking the life cycle of that, of the flea. And this is a wonderful product. The beauty about it is that when you do your maths in terms of, because one of the biggest challenges people will say is the price, but I find it's an wholesome product. As a vet, you are sure of what you're doing. You are sure that the problem being presented to you will be sorted. But number two, even to the farmer, what I normally do is break the price in terms of 3 months. Because some people will say, why am I buying a product for 5,000 at a go? But the beauty is, when you break that one in terms of, on a monthly basis, you'll find that the price is more or less equivalent to another product that you'll find out there. So the issue of price comes in, being sorted in that way. But above that, apart from the ticks, fleas, and mice, and also the mango worms, is also sorting out dogs with flea allergy dermatitis, and also tapeworms. How does it prevent the dog from tapeworms? And this is a question I got yesterday. We know tapeworms, the intermediate host for tapeworms is fleas, and the fleas have been sorted out. And therefore, a dog that is on Bravecto is less likely, or rather, to get tapeworms. And therefore, it is not a dewormer per se, but it's only taking care of tapeworms because of the life cycle of a tapeworm, flea being one of the intermediate hosts. And therefore, that becomes a point that at the end of it all, you'll be able to pass the advantage to the farmer. So Bravecto is not a dewormer, because these are something that people, because it's an oral tablet, it's not a dewormer. How it works is very simple. When the dog takes the Bravecto, gets into the system of the dog, gets digested and gets absorbed into the blood system, but it has very high affinity to the blood glycoprotein, very high affinity to the blood glycoprotein, and therefore it remains attached to the blood glycoprotein and in circulation of the dog for the entire 3 months. So whenever a tick, whenever a flea, because what they are coming to the dog is a blood meal, when they take the blood meal with the dog, for the dog that has been given Bravecto, they die within those times we have said. And therefore, it kills them through blocking the glutamate receptors and also causing an excitation of the nervous system. And therefore, those are the comments I'll make for today. We are so grateful to partner with you always. So it's always our pleasure to partner with you. We are always available for you. And in case there is any question around that, We have a stand outside there. We can come and talk more. We have different products coming up, other innovations coming, other products on the pipeline coming up, and immediately we are able to launch them. Of course, you'll be the first of our recipients. So thank you so much.
Thank you so much, CKL, for your continued support. We really appreciate the partnership, and we hope it will continue. So thank you so much. Right this moment, can I request the presenters to please come forward? We want to take not more than 10 minutes so that we go and have our lunch, or is there any change? Okay, great. Thank you. So, any question? I'm only taking probably maximum 4. I see a question from Dr. Mwasia. Can I have somebody take the mic to him? Any second question? Yes, Daktari, I see your hand. Third question, going once. Yes, Prof. Wariro, I see your hand. The last question, I see your hand, Rina. Thank you.
Hello. My first question goes to Dr. Gakuya. How did you successfully manage to do to deal with all the carcasses, since we know many can be dying and sometimes tests may not be done to confirm? So are you disposing all the carcasses well so that you can eliminate the chances of spores? And again, about the disinfection, how are you achieving it so that the environment is safe from the future contamination of probably the formalin or whatever else you are using, so that you do not have issues in the future, especially also contaminating water? And what about the vaccination? How do you achieve to do the vaccination? Is it by darting all of them, and how frequent? Thank you.
Thank you so much for all the presenters. My question is on the Earth Ranger. We know that the DVS has been promoting the use of carbs, and it's quite encouraging to see that Earth Ranger's data feeds into the carbs, which is a One Health disease reporting tool. I don't know who to direct the question to, because it was a recorded presentation. So is it automatic that this Ranger is not burdened with using both the CABS app and the Earth Ranger app? Does the Earth Ranger automatically feed into the CABS Ranger, so that we don't have the user inertia, they don't get tired of having so many apps to report diseases? Thank you. And I would also want to request participants, please, we've put out a call for application for ISAVET mentor training. We hope that all of us here with a master's in epidemiology or public health will apply to become ISAVET mentors for ISAVET program. Thank you.
My name is Aroiru from Vet Pathology, University of Nairobi. I want to make a clarification of what Dr. Kimeli had mentioned of new mosquito species which have been found in Lysamis and Saku in Marsabit. It is actually Anopheles stephensi, and the cause is Asian malaria, and it actually comes from Djibouti through Eritrea and Ethiopia, and it actually can complete its life cycle in our kitchens. Does not require a lot of water for the immature stages to complete their life cycle. So it might be causing malaria very soon. Okay, transmission of plasmodial organisms like vivax, and they are the causative agents of malaria in the country. Thank you.
Good afternoon. My concern is on classifying 5 cases of anthrax in the wild as not being an outbreak, because amongst the domestic animals, even 2 cases in a village is of great concern because of the persistent nature of the anthrax spores.
Okay, thank you. I'll start with the questions on anthrax. I think the first one was about dealing with carcasses. we, as much as possible, ensure that we deal with all the carcasses, either through burying or burning. And burning is only where the carcass is inaccessible by truck. We always prefer to bury. It's quite expensive, it's time consuming, but you have to do it because that's the only way we can be able to prevent transmission, and especially in areas where we have endangered species, either critically endangered, or even threatened. We have to put whatever resources to ensure that the transmission is cut off. In terms of disinfection, I think that is something that we should look into. I think that's another area that now we need to look into, if there could be other effects of using, especially when it comes to disinfecting carcass sites, because when you do it probably and bury, that might not have a lot of, although it can also contaminate water. That is something I think is an area that we'll get into. But so far, we've not seen any effect. But again, it could take time, so we'll have to look into that. Vaccination, we usually drop dart. That is what we use. We dart all those animals. Again, is quite logistically challenging because you have to get each one of them, and you have also to have a way of ensuring that you have marked so that you don't read that and all that. It's quite a challenge, but we have to do it because that's the only way it can be done. The second question was about classifying a case. I know there is a paper that we did, Gashohi and others, where we actually mapped cases of anthrax across the country, and they were everywhere, every isolated one case and all that. But as I said, if we get one case and we don't get another, either of the species or sympatric species, the species that they live together, sometimes it's difficult to say, is it an outbreak? Is it an isolated case? So I know that is one of the limitations of what we did. Because if we talk about outbreak as one case, then I think we'll have every other year. We will definitely, it's very, very rare that you don't get one case in somewhere. But where you put a lot of effort is really where you have some resemblance of mass deaths, because you know this is circulating within that. There's a concern that we have to look to as we work on the data. I had another one on from online. Somebody saying, was there corresponding study or observation in domestic animals or humans? We did not include that because we are just reviewing the reports that we have. So we did not do that. Something that we have to look into. But in Lake Nakuru National Park, there is already a published study, Muturi and others, where there is that comparison between human, domestic animals, and wildlife, and it clearly shows that Nakuru is a hotspot of anthrax, and it affects all the three species, that is human, domestic animals, and wild animals. So that one is done there. About outrage, that's a challenge that we have in that how will we be able to not to use both, so that once you report in outrage to get into cabs, you're looking into that. But essentially, outrage is what has now been approved for use by wildlife conservation. In wildlife conservation, that is the tool that is being used to report virtually everything, from monitoring, from poaching cases, from all that. So all the rangers now, both in the wildlife authorities and even in conservancies, both private and public, are using that. So again, we can also take advantage of that to get data, but how to link it up now would be how to, I think we'll work with that. We'll work with Hariri and his team to look into that. Once we finish the pilot, I think we can also check on that. But CABS is still being used, especially by the trained, those who are trained on it. I think I've answered the questions that were there.
Okay, great. Thank you so much. Our panelists, Dr. Kimeli, Dr. Gakuya, and Dr. Jessica. Thank you so much for taking time to prepare for your presentations and going ahead and presenting the information to us. We highly appreciate your effort. Thank you. So let's clap for them. At this moment, I would want us to break for lunch. And I see Dr. Kipyegon has a microphone, so you can pray for lunch. And then after that, we will have the afternoon session on companion animals. And we hope that will not take a long time so that we can have time to rest for tomorrow. Okay. So, and right before Daktari prays, so we are just being reminded that tomorrow we'll be having the World Veterinary Day Field Day activities. And the plan is to have a procession that will start right here at the hotel. And then we'll move on through the town to Bukungu Stadium. And after that, we will have buses that will pick, participants from the stadium at 7 a.m., 8 a.m., 8 a.m. And then those buses are going to take us to different sites. We'll be having, the main site, which is Lubao, about 20 minutes drive, and then Kayenga, I hope I have pronounced it right, then Shianda, Malava, and then Kakamega town. But we'll keep reminding you so that we prepare accordingly for that. Daktari, okay. Between us and lunch is your prayers. Thank you.
Okay, members, thank you. Let's pray. Thank you, God, for the food we are about to take. We pray, Lord, that you bless the food. May it not lead to dosing of the members. Thank you.
Thank you. Bon appetit.
Members, again, just to remind you, it is exactly 2, so let us just manage our time. Let us be here at exactly 3 p.m.
All right. Welcome back for the afternoon session. So in this afternoon session, we are going to look at companion animals. And we have 3 presentations. The first one will be by Professor Eddie Mogoa. The second one will be by Paris Njoki. And the last one, under my chairmanship, will be by Mary Nyokabi. I'm being reminded that this session will be closed by WAP, giving us a sponsor, giving a small talk. So without taking much time, we have so much to do. I call upon Professor Eddie Mogoa to make his presentation. Thank you.
Good afternoon, all of you. Thank you for being in attendance, and let me appreciate all of you, and also appreciate my seniors. I can see them here, 1 or 2. And also appreciate my 2 classmates who are in attendance, Dr. Mula and Dr. Murekafu, retired officers. I'm still in service. Thank you very much. I want to talk about something that sometimes we ignore, and that is cancer pain. It's not like any other pain. It's got its own characteristics which make it unique, and therefore the need for us to be more attentive to that type of pain, especially if you manage pets. And this is really important for those who manage pets, because it affects their welfare, and that is very critical. This is a presentation between me, Dr. Mwangi Willie, and Dr. Moffat Maina. He is not here. He's
busy with his attending to his research. I think, let me start with the objective of this exercise I undertook. It was to establish the types of cancer that cause pain in cats and dogs, and also establish the current therapies which we employ for the management of that pain. The focus of this presentation will be on the types of cancer that cause pain, specific underlying causes of that cancer pain, available therapies for management of this pain, and also we'll have a look at are there any innovations into the future management of pain, especially cancer pain. I want us to take note of the three terminologies, that is cancer, pain, and nociception. I won't go into any details, but we know that cancer is where the body or some cells go rogue. They assume their own control and multiply uncontrollably, metastasizing into other normal tissues and destroying those tissues. Pain is an unpleasant, either sensory or emotional experience that we experience ourselves, animals experience, or anything considered in terms of that kind of experience. So we are talking about being actual or potential. And actual, that means there is a noxious stimulus. Potential, that there is intended pain. I'm sure you have sometimes, tried to scare a dog off, some dogs or some animal, you raise a stick up. What will happen to the dog? It will run away. Why is it running away? Because it associates that action of yours with pain. And therefore, that is really emotional. It stresses the animal and all that. So still pain can be perceived emotionally. Of course, nociceptors, these are the sensory cells which are at the interface between the tissues and the central nervous system. They pick the signals of pain, send it through the nervous, the nerve tissues, and into the central nervous system and the brain for perception. And this is just an illustration of those nociceptors, and they'll be found in all tissues of the body, from the visceral organs to the skin, the muscles, the bone, the fascia, the joints, everywhere you can think of. And that's where we're able to perceive pain because of those nociceptors. They are important because it is the interaction of these nociceptors and the source of pain that we target when it comes to therapies aimed at managing pain. Now, let's go through a few facts about cancer, especially dogs and cats. I hope it's clear up here or the other screens. Now, one in 4 dogs will at some stage in their life develop neoplasia, and so will 50% of those that are more than 10 years old. There are nearly 100 types of animal cancer, and cancer is the leading cause of death in 47% of dogs, especially those that are of age 10 and above, and 32% of cats. Now, the rate of occurrence of cancer in dogs parallels that in human beings. That's a very important thing for you to note. So most of the cancers that these animals will suffer, the prevalences and all that, very closely parallels that of the humans. And the dogs are affected by more forms of cancer than other companion animals, especially cats. Now, there are some cancers, especially lymphoma, that are more common in cats than they are in dogs. And also purebred dogs tend to have higher incidence rates of cancer, particularly in Yorkshire Terriers and Boxers. Overall, the common anatomical areas that you're going to find these cancers in animals, especially pets, will be the skin, the bones, the breasts, the head and neck, the lymph system, abdomen, and testicles. Just let's look at the characteristics of cancer cells and the incidence of cancer pain. The cancer cells we're talking about have the ability to invade normal tissue, as we have said, and metastasize to distant organs. They have unlimited ability to divide. They have within them resistance to normal mechanisms of cell death. They are able to avoid the body immunologic defenses, and they have the ability to secrete growth factors and hormones to stimulate their own proliferation. They set up their own control such that they don't go by the body, the other body rhythms and systems. So it becomes very difficult to manage them. Now, the occurrence of cancer pain in dogs and cats is that there are many types of cancer in the dogs and cats which bring about pain. And their true preference, of course, is unknown, especially in these two species. We have looked at the literature, and I think there's an opportunity for those who want to work in this area to establish that. The incidence of cancer pain in cats and dogs is thought to be comparable to that in humans, as we have said. And of course, there is the general feeling that the management of cancer pain in this species is not up to scratch. It's undermanaged. Incidentally, even in human beings, 50% of human beings suffering from cancer have their pain undermanaged. It's not properly managed. So we have challenges for both the pets and the humans. And the cancer pain is one of the most common and the most overlooked and undertreated comorbidity in humans, as I've said. So what happens if we undertreat or undermanage cancer pain in our patients? One, there is negative effect on the quality of life of the animal. Negative behavioral changes will show up. And we are going to see how important that one is. This should be not be a problem to the recent graduates, because we have taught them and trained them on how to assess pain in animals. I'm sure Kadenge, Dr. Kadenge will tell you that he never heard of that when he was, because it was, his time things were different in terms of curriculum and all that. But that is what we worry about most, the negative effects on the quality of life, because it affects behavioral aspects of the animal, the negative impact on the physiological function, blood cortisol, blood glucose, catecholamines, everything goes up, and that is stressful. And also, it is therefore important that we manage this pain for the purposes of all, just by being, try to be humane, such that we can be able to save the animal from a lot of distress. Now, why is this cancer pain in these animals undermanaged? One, cancer develops very slowly, and therefore you might not detect it until the damage is already done and it's too late. That's one problem. It may go undetected, which is the same thing, but it's being undetected because we are not keenly examining the animal to establish really what is the cause of that pain. We treat pain, but we must understand what is the cause of that pain, because we want to treat the cause, not the symptom. And then, of course, cancer easily changes from being acute to chronic form, and when it's chronic, it's more difficult to treat. And of course, the lack of ability for our veterinary patients to verbally communicate with us. They cannot tell you, I'm feeling the pain and it's coming from here, like human beings do. So it takes us time for us to determine what is really the problem. Now, we have said that we need to manage pain. Why? First of all, it's an animal welfare issue. So let's deal with it. If we deal with that one, we are on the right path. And if you remember now, the 5 domains of animal welfare, it is within the number 5 mental domain, where thirst, hunger, anxiety, fear, pain, and distress are located. And it leads to animal suffering, anxiety, distress, and all that. In the old 5, we used to have the 5 freedoms. It was to at least, ensure that the animal is free from pain, injury, and disease. It's the same thing, that we need to manage this, basically because it's a welfare concern that we have. Now, what are the examples of cancers which cause pain in these animals? I'll try to be quick on this one. There are many, and they include the melanomas, carcinomas, sarcomas, lymphomas, mast cell tumors. Affecting all these tumors can affect the skeletal and the soft tissues and the body organs. We learned about these cancers in second year. Those who were taught by Mugera, Professor the late Mugera, you can see the hands there. He was good. He was good at that. And the pathologists now, Professor Wandera and the others, went further to make it even clearer. So now we have these cancers, and as we said, can be on the head and neck, oral malignant melanoma, squamous cell carcinomas, the nasal cavity, nasal adenocarcinomas, and the lymphomas. Skin and subcutaneous, we have mast cell tumors, soft tissue sarcomas, and the vaccine-associated sarcomas, and the bone osteosarcoma, the worst in terms of pain and all that, and of course hemangiosarcomas. And then metastatic tumors, hemangiosarcomas, oral malignant melanomas, and osteosarcomas. I wouldn't want to labor on this, but I'll just use the diagram. There are 3 different types of pain that can originate from different tissues. We have nociceptive pain, neuropathic pain, and blended for the two, when the 2 of them are showing up at the same time. Somatic is where the origin of the pain is from somatic tissues, and you're talking about skin, muscles, the bony structures and all that. And then visceral, where you have the pain originating from visceral organs, urogenital organs, and all that. And then I wouldn't want to go into that. Really, that gives you more details about the specific tumors which bring about somatic, visceral pain, and neuropathic. Neuropathic is where you have pain originating from nervous tissue. The nerves have been affected, either inflamed or traumatized or infiltrated with the cancer cells. And I'm sure you have seen cases of spinal canal issues, and that can be very nasty on some dogs. And this probably is the most important slide in this discussion. So, what are the specific underlying causes of cancer? How does cancer originate? And if you understand this, then you'll understand the difficulty in managing this pain. Human beings will tell you, explain to you some very difficult things that you'll hate to get into. But animals go through the same. Now, the underlying causes of cancer, cancer pain are 5. Because of the direct invasion of tumor cells, which infiltrate normal tissue, like nerves, bones, soft tissue, ligaments, and fascia. Thank you. They take space, and that space, pressure, whichever form, and all that, but a lot of other things happen when these cells are there. Now, the other source is distension and compression and obstruction if they occur in the visceral organs. And once they enlarge, they twist, they can cause valvulars, they can cause other complications, and that leads to a lot of pain. Erosion or inflammatory processes. These cancer cells, once they get into these tissues, start an inflammatory process which produces chemical mediators of pain, and these like cytokines, chemokines, and endothelin-1, nerve growth factor, prostaglandins, and these are the ones now which sensitize the nociceptors, and there's continuous stimulation of these nerves. Tissue hypoxia, they show a very rapid growth of these cells, and once they run out of oxygen, some of them die. Death releases toxins and all that toxic substances, which interact again with the nociceptors and stimulate them and cause pain. And of course, we talk of the therapeutic interventions. We treat cancer using radiotherapy, radiation burns can occur, chemotherapy and surgery, which all induce pain. So that's part of the pain cascade. And I wouldn't, no, that is, I think, we have gone through that. Now, these are just examples of patients that have undergone radiation therapy, for example, and there's osteoradionecrosis. You can see the damage done. You can see acute moist dermatitis following radiation therapy. You can see something similar to, remember, perivascular necrosis because of barbiturates, but this is because of chemotherapeutic agents given intravenously, and you miss the vein, and it causes very serious irritation and all that. And of course, mucositis following radiation therapy. So how can we effectively manage pain? We need to recognize it early. That is very important. We need to frequently reassess the patient. And of course, you want to work with the owner of the animal so that you can be able to avoid chronic status. Of course, the collaboration between owners and the vet care givers is important. We need to understand the pathophysiology of cancer pain, which I've tried to explain, and also have appropriate use of pharmacologic treatment of pain while you are treating the underlying problem. The thing is, you can manage the pain, but so long as the cancer cells remain, you have done nothing. So you will have to manage that pain forever if you cannot manage to have the underlying problem or kill the cancer cells. So long as cancer cells are there and multiplying, pain is just treating a symptom. Okay, and then how do we recognize pain? Of course, communicate with the pet owners. They know when their animal is behaving different, and therefore they can tell you more than you can find out sometimes. So they rely on behavioral changes, and we have discussed this for the students who have gone through the university in the last few years. The change in behavior, change in movement, posture, grooming, appetite, focal leaking, drooling, dysphagia, focalization, respiratory rate increase, urination, defecation pattern changes. All these are things that can tell you that the animal is having some distress, and that could be because of some pain. We also use pain scales, either general scales, visual analog, and a numerical rating, or a specific to cancer examination. I'm just winding up. Effective management of cancer pain, there are many impediments. And this range from lack of adequate recognition of the pain, differences in training, that we don't have the experience, or inadequacies, difficulties in assessing pain and response to treatment, limited knowledge regarding the use of analgesics, and many other challenges that we face as professionals. So how do we manage pain? Radiotherapy, cancer pain, we have talked about radiotherapy, we have talked about chemotherapy, we have talked about surgery, debulking, amputation of limbs and all that. We also use potent pharmacologic agents, many drugs, NSAIDs, opioids, NMDA antagonists, and many others, including corticosteroids. We insist that you do complementary support for this treatment, including acupuncture, massage, cold application, heat application, laser therapy, and many others which are coming into the market. And also, there are promising innovations, and there are 3 of them: cathepsin K, endothelin 1, and another growth factor are those substances produced by the cancer cells and inflammatory processes, and the ones which start off the pain chain reaction. We can block those substances, and that's where the future is headed. You block those substances, the nociceptors are not stimulated, and there will be no pain felt or perceived by the animal. But still, if there is cancer, the underlying cancer cells must be terminated. Those are the many drugs that are available, NSAIDs, opioids, and others for oral administration, where you can work with the owner, but they can be able to administer them themselves without you having to make those many trips. As I said, the bone cancer is the worst, and it's because of the internal mechanisms where osteoclasts turn rogue and actually start eating into the bone, making it very weak and malleable, and therefore you need to intervene. It's recommended that in treating cancer patients, we follow the WHO analgesic ladder, starting with the lowest where there is a little pain, and as pain persists and increases, you improve on that and put in opioids at the second level of pain until the third one, and you keep changing the opioids depending on their strength. I can assure Dr. Mwangi here finds it very nice working with fentanyl, and it works for him. But you might not have the problem we normally have is access to some of these drugs. I think I want to finish, ensure that the quality of life of the patient is taken care of. And remember, it is physical, socio-emotional, and cognitive dimensions which make the complete life. Finally, this is my last slide. In terms of discussing this, that there are many types of cancer which are a source of pain to dogs and cats. Of course, we also have a number of therapies that are available for managing this pain. Effective management of this pain requires that we recognize it early, diagnose the problem, and use appropriate management approaches to dealing with it. And we also realize that supportive and complementary care therapies are part of the total package on management of cancer pain. We need to renew our commitment to managing cancer pain better, and also let us all embrace best practices in management of cancer pain in pets through appropriate knowledge acquisition and application. For those who want to read further, there are some 3 recommended references there for you. Thank you very much.
Thank you, Prof, for that beautiful, painful presentation on cancer. Sometimes the vets bear the pain of their patients, and I almost thought we were handling a case. Okay, so we move on. After that good clap, we move on to the next presenter as all of us prepare our questions for the Q&A session. Paris Jockey, the floor is yours.
Good afternoon, everyone. So my name is Paris Njoki. I'm a vet epidemiologist. Okay, so I'll be presenting on dog bite injuries in Kitui County, Kenya. That will be a retrospective study between 2017 to 2021. So a bit of a history of how this study came to be. While I was working at the Public Health Emergency Operations Center in Kitui, we had a lot of, okay, maybe 3 human rabies cases that ended up in mortalities in the Kitui Referral Hospital. So I found there was a gap. There was a gap in the system in terms of rabies. However, the diagnosis of rabies is not frequently done, especially in humans. So I decided to bridge the gap through this study, and it's my thesis actually. As you can see, I'm undertaking a master's in vet epidemiology and public health. Okay, so I would like to also recognize the county government of Kitui. I got support from Dr. Alan Owino, who is the county director of health, and also my supervisor from the Royal Vet College, that's Professor David Broadbelt. So the next slide. So dog bites, as you can, okay, I think you're familiar with this. Hey, Paul. So dog bites cause both physical and psychological injuries. The physical injuries include fractures, osteomyelitis. I won't read them all. Osteomyelitis, infections, and fractures. And then there's psychological injuries such as PTSD, that is post-traumatic stress disorder. Also, the this dog bites, therefore, is a serious public health issue, as it's also associated with the zoonotic disease transmission, especially rabies and tetanus, among other bacteria such as Pasteurellas, but mainly rabies. In Kenya, 500, sorry, rabies is also a serious disease because there's estimated 523 deaths in humans. This is a study carried out by Chuchu. There's also animal bite incidents in Kenya, which is estimated as 298, this study was carried out in the eastern and western part of Kenya, and they found out that animal bites in Kenya, there is an average of 298 bites per 100,000 population. In Kitui specific, it's 271, and you can see it's quite almost near the average. And then we do not find any studies in Kenya. At the time of this study, there were no studies in Kenya estimating the dog bite incidences. Most of the studies were on rabies. So my research questions were, what are the main risk factors associated with dog bites in Kitui County? And the other 3 are my sub-objectives, which included incidents of dog bites in Kitui County, the spatial distribution and characteristics of dog bites in Kitui, and the demographic risk factors of dog bites in Kitui. So, sorry, I'm not used to this, so. I think I'm pressing the wrong button. It's not. Okay. Okay, so there's limited evidence on frequency and risk factors for dog bites in Africa. However, I could find literature in UK and the States. In Africa, it was mostly rabies, which is not confirmed. I don't know how to explain it. The literature is mostly on rabies, on dog bites, but it's written as rabies papers. So I couldn't find any studies. There were limited, more or less, studies on the dog bites in Kenya due to the limited resources in Africa, not Kenya. So I mentioned the study that was conducted in western and eastern parts of Kenya. That's 2011 to 2016, where they found the average. So I won't repeat that. Maybe of significance, Kitui County had an estimated of Kitui County had I already mentioned that, so Kitui County had an estimated 271 animal bites per 100 population annually, and out of this, 91% were from the dog species. This, however, is just a number, it doesn't estimate the incidence. Okay, so there is my study area. I conducted the study in Kitui County, to be specific, Kitui South Sub-County. this area over here. So these sort of faded areas are reserves, wildlife reserves and national parks. We took samples, we took our data from 2 hospitals. This included Ikuda Hospital and Mutomo Mission Hospital. This is mostly due to Ikuda being a referral hospital, and Mutomo was also easier to access, and it was easier to access, and they accepted my, getting data from the hospital. This was, so yeah, let me go to the next one. So the methodology, we used 2 data sets. We used the Kenya Health Information System data from the human health side, where we could get data from 2017 to 2021. This had reported cases from the 56 facilities in the Kitui South Sub-County. So that one estimated the incident rates of dog bites in Kitui South. We also used data from Mutomo and Ikuda, where we did a case control study. We took actually 387 cases and 387 controls. The cases were identified as, incidences of dog bites that were reported to the study sites. That's the Ikuda and Mutomo hospitals. And the controls were non-bite cases that were reported to the same sites during the study period. So for Mutomo, we were able to acquire the 5 years period, that's from 2017 to 2021. We were able to get all the data. They are using a health information system. However, in Ikuda, we were not able to get complete data, mostly owing to the nature of how the hard copy. They're still paper-based. So we took a 1 year data, which was from October to September, 1st of October 2018 to September 2019. These are the findings of my study. As you can see from this picture, there is a dropping incidence rate of the dog bite incident. There's a dropping incidence rate in terms of dog bites from 2019 to 2021. We had the highest at 433, which was in 2018. But then it dropped to how many? 234 in 2021. This most likely was affected by COVID because, it limited movement and hospital visits. So, but however, we could do further studies and see if there were any other factors contributing to that trend. We also calculated the incidence of dog bites in the 2 study hospitals, that's Ikuda and Mutomo. We found that in Ikuda, there were 446 dog bite incidents, while in Mutomo there is 244. This can be attributed to the ease of access. As we know, Mutomo Mission is more of a private hospital, and Ikuda is the referral, so it's more affordable to visit the Ikuda level 4, and they receive quite a large number of inpatients compared to Mutomo. We analyzed the data from the Health Information System, KHIS, and did spatial representation of the incidents. This A, so we have 6 maps in this figure, but the A1 only shows the populations by ward. So we have Ikuda, Mutomo, Athi, Kanziko, Mudha, and Ikanga Kiatune. So those are the wards that are in Kitui South. Then B shows the incidence rate in 2017, 2018, 2019, 2020, and 2021. And we can see there's a sort of a pattern. In Ikanga, Kiatune, and Kanziko always consistently have a high incidence rate. So our conclusion from this observation or descriptive analysis was that you can see slightly higher dog bite incidences in Kanziko ward and Ikanga, Kiatune ward. Yeah. So we also did a descriptive analysis with the data set from the KHIS. We found that there were higher frequencies of dog bites in November and December, this and this. So November we had 399 and December 293. We also had, we did also analysis by age, we did distribution of age by sex for the case controls. So these are divided cases on top, controls in the bottom, and then the female and male. So you can, if you just look at it, you can see there's a higher or skewness to this frequency of this dog bite cases is, if you look below 25, there are higher cases in the males, or there are higher dog bite cases in the males. However, if you just look the cases and control in general, they're sort of a uniform distribution at the controls, but you can see some sort of skewness towards the younger age in the cases. We also did a univariable, not univariate, univariable and descriptive analysis. We were doing our cutoff or screening cutoff at 0.25 and found that sex was significant, age groups was significant, season was significant, and month was significant. So we are just checking the p-value and doing a cutoff. This one was above our cutoff of 0.25, so it was left out when we went to the multivariable logistic regression. So we proceeded and did the regression. We found that age was significant. Age group was, there was a higher odds of getting bitten by a dog if you're below 15, while the ages between 16 and 55 were protective factors. Okay, so and for the season, we found that short rains was a risk factor for dog bite. However, the dry and hot rains served as a protective factor. These others were not really significant since, they're between 0 and 1. And then we retained the hospital because it's our variable of it's our main variable of interest in our study. So in conclusion, let me just go back a bit there. So this means if you're in Kitui South and you're below 15 years of age and it's during the short rain season, and maybe you visit Kikuth and Mutomo, no, anyways. So it means if you're below 15 and it's during the short rains, that's between October and December, you're likely to be bitten. You're at a higher risk of being bitten by a dog. So in conclusion, this information would help to utilize our limited resources for greater impact by targeting the specific high-risk groups. This include the children under 15 years old, and also during the seasons, the rainy season, as we saw the short rains in Kitui County. Also, the findings supports the need for dog bite awareness, education, particularly among school-going children, and potentially directing it towards the wards with the highest burden. So, and also with consideration of seasonality. I think that's the end of my presentation. These are the references, although not all of them. Thank you.
Thank you very much, Paris, for that beautiful presentation. We take the next presentation by Mary Nyokabe.
All protocol observed. Good afternoon. My name is Mary Muthoni. I'm a vet student at University of Nairobi, and I'm currently in my 4th year of study. So today I'll be presenting to you some work I did last year concerning the welfare of dogs kept by nomadic pastoralist community of Amboseli. By show of hands, how many of you have dogs at home? Dr. Gakuya, what is the main reason you keep your dog? Sorry? For security reasons. So most of the people, or from since time immemorial, people have been keeping dogs, and it has been at the top of the list when it comes to animals kept for companionship. So the reasons that why people keep, or the reasons for keeping dogs are security, as he has said. And under security, we have security guarding homes, and then security at transport areas or at the airports, and then security when it comes to wildlife conservation areas. So those are the reasons. So the reason why I chose Amboseli, it's because we have, the people there are predominantly pastoralists. They have animals, and they also have dogs. And we have several communities which I will have done my studies at. We have the Borana, Turkana, the Orma, but I chose Amboseli ecosystem because of proximity, and it was easier for me to do my study there. So my work was supported by Morris Animal Foundation, University of Nairobi, and the Kenya Wildlife Service. So to check the welfare of this dog, I was checking on the welfare of these dogs. So I used 3 of the 5 animal welfare freedoms. If you don't mind, maybe I can hear from you. One of the animal welfare freedoms. Freedom from pain, injury, and disease. Freedom from hunger and thirst. Freedom to express normal behavior. 2 more. Freedom from distress. The last one. Fine. So I did my study using 3 of the 5 animal welfare freedoms. So I used freedom from hunger and thirst, freedom from pain, injury, and disease, and freedom from discomfort. So when it came to freedom from pain, injury, and disease, I asked, I don't know.
I don't know. You can actually continue until you connect for the rest of the slides.
Okay.
Up and down.
Yeah. So how I collected my data was through administration of questionnaires, focus group discussions, and also I collected fecal samples from the dogs in the community. So when it comes to the questionnaires were structured in a way that they had questions concerning the 3 of the 5 animal welfare. So freedom from pain, injury, and disease, I asked the community about, do you take your dog to the vet when sick? How many times have you taken your dog to the vet when it's sick? Have you vaccinated your dog? How many times, or how many diseases have you vaccinated your dog against? And I also asked about, have you dewormed your dogs? And if so, how many times in an year? Then when it comes to freedom from discomfort, I asked the community, or through the questionnaires, I asked questions like, do you house your dog? And then when it comes to freedom from Then when it came to freedom from hunger and thirst, I asked, how many times do you feed your dog? What do you feed your dog on? And do you provide water? So such questions. So the reason I asked why you keep your dog is because predominantly these people keep their dogs for security reasons. So the dogs are used in accompanying the herders to the grazing fields and also protecting the animals at night in the boma. So the dog sleeps around the boma or inside the boma with the animals. And considering this is an area which is a wildlife interface, we have Amboseli National Park, so it's a human-domestic wildlife interface. So the dogs, as they accompany the herders to the grazing fields, they might, their welfare might get compromised in some way, especially when it comes to diseases, injuries, and also getting tired as they walk those long distances every day. So we have said the main role of the dogs. The thing that made me want to study this was that despite the vital role played by the dogs in this community that is accompanying the herders to the grazing field and protecting the animals at night, within these areas of, within this interface, which has a high exposure to disease risk and also injuries and all other, their welfare might get compromised. So that was the reason. So the study assessed the management and welfare of dogs in the pastoralist communities, and that is Amboseli. So here, the dog is central in this study. So as you can see here, the dog accompanies the herders to the grazing field and also they guards the animals at night in the bomas. So to understand the welfare of this dog, I collected my data using questionnaires. So I administered questionnaires to the community. The questionnaires had 3 of the 5 animal welfare freedoms. So this is freedom from pain, injury, and disease, freedom from hunger and thirst, and freedom from discomfort. So, and then further, I did collect fecal samples from the dog for helping analysis at the lab, both qualitative and quantitative. Oh, geez. So then I analyzed the samples in the lab through flotation and McMaster. Flotation to identify the type of eggs and McMaster to identify the EPG, to have the EPG. So the results beat. So when it comes to freedom from hunger and thirst, I found out that 94% of the people did feed their dogs, and only 6% who did not feed their dog. Also realized that 45% of the people feed their dog 3 times a day, 20 twice, and 29% fed their dog once, and only 6% who didn't know whether their dog was fed. So also, women participated more in feeding the dogs, and that the dogs were mainly fed on kitchen remains. And the fact that 45% of the respondents fed their dog 3 times a day, and 70% provided water for their dogs, we can agree that the welfare of these dogs, according to this bracket, is relatively good. So according to freedom from pain, injury, and disease, we found out that 54% did not vaccinate their dogs, and only 46% vaccinated their dogs. And for those who did vaccinate their dogs, they only vaccinated their dogs against rabies. So that means the rest of the diseases the dogs were not vaccinated against. So according to this bracket, the welfare of these dogs is not good, not good. Also on the same, on Helminth analysis, after analyzing the fecal samples, we found several eggs. We found strongyl eggs taking the lead. We found Alaria, Dipylidium, Onceneria, Toxocara canis, and that the highest EPG was 1500, which is relatively high. Ectoparasites, on the same, we found that the animals had a lot of ticks on their bodies, 55%. The ticks were 55%, the fleas 30%, the flies 10%, and the lice 5%. So there was poor control of ectoparasites, which also adds to the, which also lowers the grade of how they did care for their animals. So the welfare of this dog is quite not good. So freedom from discomfort, I asked them a question on housing. Did you house your dog or did you not? So I found out that 95% of the people did not house their dogs, and that only 5% of the people housed their dogs. So 95% did not house their dog, maybe for the reason that these dogs are used to guard the animals at night around the boma, so they did not see any reason to house them as they are used for security. So in conclusion, we conclude that there is a poor approach to the welfare of these dogs, indicated by a high Helminth load, poor ectoparasite control, lack of shelter, and in general, and also lack of vaccination. So generally, the welfare of these dogs needs, something needs to be done. Yeah. So again, I wish to acknowledge Morris Animal Foundation, University of Nairobi, Kenya Wildlife Service, and Amboseli community for having provided the data, and for the three first institutions for making everything possible. Thank you.
Thank you very much, Nyokabe. She deserves another clap for that. It's good that as we preach the replacers animals in our herds, the universities and other training institutions are also getting replacers for us. And very soon, we might be relevant. Thank you very much. The three presenters, please come forth so that we can question you and sharpen each other. Swali nitapeana maswali manne peke yake. 1, 2, 3. Last one, not there. Okay, 4.
To Dr. Mugoa, that was a good presentation. Thank you. I'm just interested to know if there's a regime for cancer therapy in Kenya, and if so, what are the recommended drugs, and are they available in the market? Next question to Mary is, I wanted to know, how did you measure for the presence of flies? Because you know a fly is something that is there 1 minute and can fly off as you are measuring to determine the percentage. Maybe you can elaborate on how you measured for the presence of that. Thank you.
Thank you. My name is Kadenge Darlington. Mine goes to Paris. I realize all your data came from the Ministry of Health, but on the ground, most people who are bitten by dogs come first of all to the veterinary offices. Some of them may go to the hospital after that, some don't.
So I don't know whether you left, some data could have been left out by also not visiting the veterinary authorities to ensure that you fill up the gap that you got from the Ministry of Health. Thank you.
In the meantime, World Animal Protection, get ready.
Thank you for the wonderful presentations. My name is Faith Mokona. My question goes to Dr. Paris. You mentioned that human rabies is usually not diagnosed. Maybe for a further elaboration, you can tell us why. And if it is a question of maybe not having the laboratories to do so, how are we as vets, how can we come in and help the human sector? Thank you.
So mine goes to my student, and I have this opportunity of harassing her outside the classroom. So one, I also happen actually to have done some work in that area, and from your results, you are talking about Dipheridium canis. It should be Dipheridium caninum, but more than that, I'm going now to the issue of the treatment of the dogs, because I don't know whether you also realize that in that area, there's a lot of what is called the Sinurus cerebralis. You notice then it becomes very hard to actually convince these farmers that actually the problem is not the sheep and goats. The problem is for the dogs. So even when they have antiemetics, you tell them to give, even when you give antiemetics, they actually give it to the sheep and the goats, not the dogs. The other thing is, you talked about freedom from hunger, and having been there last year in Roitoki and Aboseri, there was a severe drought. So I don't think even the people had enough to eat, if about having any kitchen left over. So the dogs were actually starving. Thank you.
Thank you very much. I think we respond to those, and the rest we shall get to the presenters later.
Okay, thank you, Dr. Darlington. So for your question, I did take data from the Ministry of Agriculture and the vet offices. However, they were more aggregate. You could not get enough variables for my study objectives. So that's why I left it out. I even did a descriptive analysis, but it was too scarce. It was incomplete, didn't have species, didn't have a lot of variables to work with. Then to Dr. Mukuna, for human rabies diagnosis, getting consent was a difficult. There's one particular case we almost got consent, like, how will I explain it? It's hard to get consent from the parents, from the loved one, because it would involve, yes, exactly. Not chopping off, taking samples from the brain, because that's the negri bodies, that's how you confirm. So there would be some sort of disfigurement, and that is not very, people don't really like it, yeah. And as far as I know, I think the samples are sent to VIL. Maybe someone can assist with the lab. The question about the lab confirmation for rabies, human rabies. So, yeah.
Okay, I hope we are answered. The next presenter.
Okay, just about fleas. Flies, sorry, it was supposed to be fleas. Also on Sinurus cerebralis. No, I'm from the mountain region, so. So my study was not that deep, doc. It was just a beginner. So maybe next time I'll look into it. And the question about feeding, yes, I found out that I went there when it was quite dry, and the cattle also had nothing to feed. I think everyone was starving around there. But what I from the answers they gave me is that they were feeding. They were feeding the dogs, but what amount is what I don't know. Is the part that I don't know. They could have been. Yes, they are eating and they are feeding the dogs, but the amount is the problem. I don't know. So maybe it was smaller. Could be. Yeah. But honestly, they were feeding their dogs. They weren't badly off. Only that the other welfare part, they don't know much about it. I think that something should be done. Something should be done about it.
Education. Okay.
Thank you for your question, but it's not clear to me. What you asked is there a regime for cancer therapy? What cancer? I mean, what therapy? What, for animals? What I outlined actually are the approaches to management of cancer. I outlined on radiotherapy or radiation therapy, chemotherapy as part of that. Then management of the pain using the normal drugs that we use for management of pain. Then I say that we can also use surgery to remove the cancerous mass. Sometimes we go radical, do a mastectomy, for example, in mammary tissue cancers. And also, I said that adjunctive therapy is important, supportive therapy, as part of the therapies that we have. Probably you're asking about the drugs for pain management. For chemotherapy? No. There are quite a number of actually drugs that I think one of them is afanplastin, something like that. Yeah, I can give you the list of the drugs that they use for chemotherapy. They're the same for humans and for animals. But there is a group of drugs, and several ones for that in the more recent times that are used for chemotherapy because they have to give it systemic application, IV and all that. And that's why I was mentioning the one of the side effects being the pain associated with the extravascular injection of that drug, because they can be very irritating, and at the same time they also break down into some metabolites which actually have got very serious side effects. But basically, yes, we have some protocols for management of pain, cancer using systemic drugs.
Thank you very much. That was a very nice presentation with a good mix of from a professor to an upcoming professor. Can we give them a hand clap? That was good. That was good. For those we might have not included, considered your questions, please. I know, Prof. Mogoa, I might want to see you like the other people will want to see you on that. Wild animal protection. The floor is yours if you're around. Okay. Let's hear from the Wild Animal Protection, one of our main sponsors and partners in the KVA. Welcome, Doc.
Good afternoon. I hope that you'll be able to track, and I'm also trying to learn how to use this thing. But mine will be very brief because sponsors are my partners. Partners. We are not sponsors. I will just give you a brief of one or two things. And I want to start by Wild Animal Protection, who we are and what we do. I think a lot of you know who we are and what we do. Just clarifying one or two things. That's our vision, a world where animals live free from cruelty and suffering. And I hope we are all conversant with what that means, especially if you go back to your code of ethics that says that it is your primary responsibility to ensure that animal welfare is, or the welfare of the animal is catered for. Our mission is we move the world to protect animals. And I have to say it this way. The we there is not the Kenyans like me who get bread and butter from World Animal Protection. The we there is all of us. We have a responsibility to protect animals, constitutional, legally, ethically, socially, whichever one you want to use. It is our primary responsibility to protect animals. That's our global strategy. It's called A New World for Animals. That's why the first slide was highlighted as A New World for Animals. You can download it. We have put for you the link at the bottom, or you just Google A New World for Animals. Then you'll find our global strategy from 2021 to 2030. So if you want to work with us, you want to partner with us, you want to be part of the process, please read through that. It gives you the details, where we are headed to, what is driving that change, and why we, as World Animal Protection, then engage in certain spaces. Our vision has two sides. Goal one is to ensure farmed animals live good lives by transforming the global food system. And I think that's where the vets start dropping off, because we do not appreciate that we are part of a global food system. And it's critical that you start looking at it as a food system. And briefly, a food system looks at everything from the point of production, how you process, how you slaughter, how you transport, and ultimately how it gets onto the plate, and how you manage waste. Vets have decided to stay in a small place called animal production. Even you at animal production, muko too injecting the animal when it is sick in a big thing called a global food system. We need to change that perception and start asking ourselves, what is our responsibility at the farm level? What is our responsibility when the animal is being transported? What's our responsibility when the product is being retailed? What is our responsibility in the legal aspects of managing that food system? That is becoming critical. Goal 2 is about stopping wild animals from being cruelly exploited as commodities by changing the systems that allow it. I will not belabor Goal 2 because Akina Gakuya are here, and I want to leave wildlife to the people who belong to wildlife. Wacha nikae kwa line yangu, my line is kuku. And then I have been forced to move from kuku to global food systems. So now I look at everything that comes from production systems around food production. Those two goals intersect, and I want us to be very clear, because whatever we do at the farmed animals has an impact on the wildlife. And the easiest one to look at your animal feed production. Animal feeds are we are clearing large tracts of land to grow feeds. Amazon is burning because we want to grow soya. That goes into our animal feeds production systems. When you clear that Amazon, or even in Kenya, I think Gakuya knows this. The other day there was somebody who wanted to grow avocados. Then they were discovered that they were on the trail or a pathway for elephants to move from one side to the other. That's where we've reached in terms of the interaction between the two systems. Again, vets need to be part of that process to then be part of giving solutions on what happens. Yeah. Remember that when manure at the end of the system is then being pushed out into the environment, it has an environmental impact that then has an impact on biodiversity. So we are losing biodiversity because we are clearing forest, but we're also losing diversity because we are putting pesticides from manure. We are using manure to put certain things. We've just completed a study with Calro where we've been tracking what happens to manure. If you've produced, if you've used antibiotics or pesticides, and there's pesticide residues or antibiotic residues on manure, and in this country, manure goes where? To farms. So when we say on TV that there's a problem with meat, we forget that the byproduct of production system is manure that goes to farms. So if you go and sample some of the farms, and you've done that around large pig farms, you realize that whatever problem was in the pig house is on your crops. Then when it rains, what happens? It gets into the streams. And there's a big study that was done by University of Nairobi showing that anything that is put on the crops ends up in the stream. So you're contaminating agriculture, you're contaminating your crops, and you're contaminating the animals. So that is why we then look at it from a One Health product system. And vets need to then move to take their responsible places within the One Health production systems. As I conclude, the no future for the global food system then looks at three critical things that I also want vets to understand, so that we have reasonable, informed debates on those platforms where some people call YAMO severally because of certain papers being published. The first thing is no future for factory farms. We are simply saying that research data shows that there's a challenge with intensive farming systems. Intensive farming systems, which I'll show in a few slides down, 1 or 2 slides down, is leading to pandemics, it's leading to AMR proliferation, it's leading to greenhouse houses, all those things. So the world needs to take a step back and say, by 2050, when we'll be 9 billion, how will we be producing feed or food that is sustainable? Because it's about sustainability, and that's becoming a big thing. The next thing is a food revolution. In this country, to just explain food revolution as easy as possible, watu wakifika Nairobi, they stop cooking food in their houses. You go to fast food restaurants. Sindio? In fact, the retailers have become so knowledgeable about this thing, such that most of us on Sunday, what happens is, you even eat in your supermarket. See, your supermarket now has a kitchen that produces for you because of the trends of what they are seeing. None of you after church on Sunday wants to go and cook. So what do? You go and buy your chapati and everything from a supermarket. And that's part of what we then need to manage and start ensuring that that food system works for us. We are also leaving our traditional foods and starting to eat fast foods. Yeah? And so we have a whole study which was done by World Health Organization that talks about the health impacts of intensive livestock production systems. It's leading to obesity, it's leading to things like high blood pressure, and those things are because we are changing our diets, and we need to go and look back at our traditional systems and start saying, what do we need to do differently? Last but not least, he who pays the fifer controls the music. So again, it's about looking at what is driving our production systems. When you see battery cage systems, and I worked in a certain bank, who's funding battery cage systems in this country? Is it a system that is sustainable when it is being dropped off at certain places? And then you need to ask yourself, if it's being funded, and there are big brands coming into this country that are already telling you that by 2026, they will not be accepting production or eggs coming from that production system, aren't we then shooting ourselves in the foot because we are going towards a system that high-value markets is no longer recognizing because of the welfare implications? And I think we need to wake up and smell the coffee, because otherwise we will be advising our farmers to do something different from where the global market is moving to. And those people who are moving into this country, when you see the big brands, they have animal welfare policies, they have animal welfare commitments, there are certain things that are driving their businesses. It doesn't take long for them to start getting the same policies and commitments being a requirement in this country. And I just want to ask you, take your time to phone and look at animal welfare commitments around battery cage systems. Look at the big brands in this country that have already said by 2026, latest 2030, they will not be buying products from animal welfare insensitive production systems. Those are the realities that we need to look at. As I conclude, the impacts of factory farms or intensive farming systems, and all these things are driven by data. There's science, there's a ton of evidence that you can look at. Public health impacts on environmental health, and I've just given you a good example, the process with which manure is being used. And remember, in this country, we tried to legislate in a certain bill that manure should not have been used in a certain way. And it's we, the Kenyans, that said that is not acceptable. So that's something that we need to look at. Look at the causes, that's the animal welfare bit of it. Climate change is something that we are starting to look at. FAO tells us that 30% of greenhouse gases comes from production systems. What are we doing about it, and what are we starting to look at to mitigate some of those things? There's biodiversity loss that I've already explained, and then it also undermines food security. So while we say intensification promotes food security, science is showing us that intensification is actually undermining food security, and we need to look at some of these things. And we can have a discussion around some of them. I want to conclude with 2 slides to just show you what has happened in the last 10 or so years in terms of animal welfare. And I want to use the 2 main ones that we look at. The first one, if you look at AMR, antimicrobial resistance, and it's good Alan is sitting here next to me, the focal person. FAO, World Health Organization, and OIE in 2017 developed a global framework for stewardship to combat AMR. And one of the things they recognized was increased animal welfare is a prerequisite to reduction of AMR. Not Yamo saying, it's your global UN body is telling you that there's no way we'll reduce AMR until we start looking at the... Are we together? Let me move to the next one. I've allowed that one to sing. My last slide is just the easiest one. While we vets are still sleeping, an environmental organization called United Nations, UNEP, made a resolution in 2022. It's called UNEA 5.2, which recognizes that there's a connection between animal welfare, the environment, and sustainable development. In fact, the resolution says the Director General of UNEP should work with the tripatriates, FAO, World Health Organization, and OIE, to develop a report that will be submitted in 2024 in the next UNEA meeting, showing the nexus between animal welfare and public health, animal welfare and sustainable development, animal welfare and environmental health and planetary health. So it's time for us vets to start saying, what is our role in that nexus? Because then the world is shifting and the rest of us are remaining in the traditional things that we've been looking at. Kwa mahayo machache, asanteni sana.
Asante sana, Daktari. Now I call upon Dr. Odhiambo of Norbrook. Are you around? Yes, Dr. Yamo tells me you are his brother from another mother. Let's see how the mother mothered you.
Good afternoon. My work is simple. My name is Dr. Joseph Odhiambo, Country Sales Manager of Norbrook. I'll be very brief just to introduce Norbrook, what we do and where we go. Norbrook is a pharmaceutical company owned by the family of the late Lord Bally Edmond. He passed on in 2014. Currently, the business is run by the wife and the sons, plus 1 daughter. In Kenya, I would say Africa, out of the business, Africa, they've divided North Africa and Middle East and the Southern. Africa contributes partly 5% of the global business. So seated here are the people who drive the 5% business of the company of Norbrook. We say thank you very much for what you've done. Thank you very much for how you pushed us. 2, like Yamo has said, we are having a very big challenge in tick control. Anybody seated here, the paratologist will tell us there is no new molecule which has been reinvented or discovered recently for the control of ticks. Currently, the molecules being used is either amitraz, organophosphate, or synthetic pyrethroids. Those of us who are in the industry, you'll agree with me, it's a very big challenge. The animals, you'll either go to do a deep wash or you spray at home, the ticks will be looking at you. The main reason being is the management. 90% of the people who are controlling the dips, they are either the farmers or the paraprofessionals. As the vets, we've run away from the control of ticks. The reason being, we, like Yam has said, we are not looking at the management of the ticks. I would request us to take a keen look on tick management. 40% of the business, animal health business in Kenya is acaricides. So if we are not in that space, it means we are not going anywhere and we need to improve. Lastly, at Nobruk, we have a culture and sensitivity lab where we request the practitioners or the vets to send us samples of milk which we test at our place. Standing here at Nobruk, we can tell you in Kenya which bacteria causes mastitis in the whole country. We have a partner we are working with. They are trying to analyze, because we are not a research-based organization, they are analyzing the data so that they can be able to interpret it. But the worst bit of it is that the resistance is very high. If you look at what is happening, even the molecules that we are using, it's very, very difficult where we are going to go. We had an example in when we went for our meeting. In a country like Netherlands, you are only allowed to treat mastitis once. The second one, you have to get an authorization letter from the Director of Veterinary Services for you to be able to treat mastitis. Apart from that, if it doesn't cure or the animal doesn't become well after the second treatment, the government allows you or orders you to slaughter that animal, then you'll be compensated, because they do not want to bring resistance in the country. Two, for us here, I would request that please make use of the culture and sensitivity lab at Nobruk so that you can be able to know what you are treating. You can be able to know which microorganism you are dealing with so that you can stop grazing. I know there are so many labs. That treatment or that action is free of charge. You just need to see any of us. We'll be able to give you the sample bottles. You send them at Nobruk. Within 48 hours, you'll be able to get the results. As I finish, I would just like a small example and say, at Nobruk, we are 6 veterinarians who are employed. We have 2 people who have done a diploma in animal health. Then we have 14 paraprofessionals so that you can be able to serve you. Thank you for your support. Yesterday we had a cocktail, tunasema ni asante sana, because we were being told the vets, we come and we have the science, but we forget the social side. Today I'm here, Cyrus is here, Dr. Bam is here, Dr. Bogonko is here. If you feel like you want to do something, just see us. We'll be at the bar there to take care of you. We'll make sure that you do well. In the end, if you just see us there, at the bar outside there, we'll be able to take care of you. Lastly, Professor Mande, I will say, thank you so much. We got the letter, and the company has agreed. The award will continue. Whilst we'll be giving the awards at the university, we shall be there. So we need to come and discuss this. Maybe we need to look, they're saying the amount is, yes, we can do it. We just do the letter, but they are saying there's an award so that we can be able to do. The other thing they were asking, as we'll come and discuss, is there a way we can collaborate with the university and see what we can do with Nobruk. There's a time we were given a chance by the owner of the company, but we lost it. The chance was given to the Director of Veterinary Services and the Livestock Production Director, but they lost it. So they are saying if there's anything we can come and discuss so that can be able to see how we can work to improve just the student and the science in the country. Because the question they're asking, are we just bringing the products that they have, or do we have the products here that we can need, but the university can guide us? I'll come, then you can discuss. Thank you very much.
Thank you very much, Nobruk.
As you are seated here, we are giving you a sample of a product, an amitraz, for you to go and try, because as a vet, you cannot be treating animals and you don't have an animal. Please go and try it on your animal, not somebody else's animal. Go and try it and tell us the results. We're also giving you a cape. Sorry, it's raining. We thought it would be sunny, but you're giving you a cape as you walk so that can be able to be of good help to you. Those who came yesterday for the cocktail, everybody left with a polo shirt. If you missed, please talk to us. We have one for you. Asante.
Thank you very much, our great partners and sponsors. Now we come to the end of that session that was chaired by Dr. Paul Juma of Kagrik, Goat AI Center. By we are going to stand up. We are going to stand up, people. We are going to stand up. Thank you very much for honoring that. Stretch a bit. Stretch a bit. Let the blood flow. That was a good one. And now we want to welcome the next chair of the next session, Dr. Makero, with a hand clap. Tafadhali.
Thank you, Daktari. Oh. Thank you, Daktari. Thank you, everybody. After that nice stretch, and as we cover our heads, welcome to the next session. Good afternoon, everybody. I'm Magero Joan, the Vice Chair of the Kenya Veterinary Board. If I had my previous hat, I'm sure I would have been given the previous session because me and animal welfare were almost the same. We are getting into our next session, which I think they don't have titles, eh? Our next session. So during this session, we have 3 presentations. The presenters with us. So the first presentation we want to hear about is on gender, breed and trial preferences of dairy cattle keepers in Senegal. So we are expecting Evaristo Makenje. Are you the one? Okay, karibu.
Good evening. My name is Dr. Evaristo Malenje. So before I begin, I want to recognize my supervisors at the Department of Animal Production, Dr. Rollins Bett, Professor Joseph Junga, and my supervisor at ILRI, Dr. Karen Marshall. So basically, dairy is about milk, and I cannot overemphasize the importance of milk. We know that milk is food. Many people, especially in rural settings, depend on milk to get some income. And it is sold to meet basically a lot of things, especially in rural households. Probably where I want to emphasize is because this is West Africa, it is Senegal, the production system probably is a little bit different from Africa. And in Senegal, the dairy production system is dominated by traditional pastoral production systems. By these, I simply mean that the dairy cattle that are there, unlike Kenya, where we are advanced, I had in some presentation last time, when I think Dr. Olum was presenting, and he was saying that in this country, AI started back in 1935. When we come to Senegal, they started this process of AI and setting up these things in 1924. So this is a country that we are a little bit ahead of. And their production system is dominated by local breeds. In Senegal, the main local breeds are the Zebu Maure, Zebu Gabra, and then we have these Ndama animals, Jakor, and that is what they depend on. And if you look at a picture, on my left, you will realize that the milk production, like that was a picture taken during data collection, and that is from one cow. And you will realize that my sites will be around Dakar. Dakar is the capital city of Senegal. In Senegal, an animal, let's say a dairy cow in a year, it produces around 300 kilograms or 300 liters of milk per year, compared to the global production of dairy cows, which is around 7,000 liters or kilograms per annum, which means these are still low production. The cows are still producing very little milk. And on the lower part, you will see sample of the animals that are, and remember, this is in a peri-urban area. These are just peri-urban next to Dakar, where a lot of consumption of this milk takes place. And I will again talk about the objective of this study. This study was part of a bigger study called the Senegal Dairy Genetics Project, where this project sought to advise the government on policy formulation on which breed or which production systems, as far as dairy is concerned, they are supposed to adopt. And usually before, when I think when the Honorable was here, when we were opening, I heard him saying that, let's say in Kakamega County, they are giving out some animals. And usually before you give out some animals, the way maybe they are giving, they usually go through a process to just get to know, do these farmers really need? Like I come from this county, and I can tell you from where I come from, some farmers are interested in bulls. So if you go and give them dairy animals, then the bullfighting tomorrow is usually tomorrow. And then they'll be looking at the animal and wondering, yes, you've given me a dairy animal, but what we need is the entertainment tomorrow. Then there's usually a gap. Huh? So usually for those of us who studied at the university during my time, Mr. Benson Inyangala took us through this kind of a cycle, where literally you have to go through a process before you can be able to roll out a program, especially if you are intending probably to increase milk production, where you want to identify what we call in genetics and breeding a breeding objective. Because a breeding objective simply identifies the direction of improvement where you want to go and how much you want to go, whether negative or positive. So I will be looking at the breed and trait preferences of men and women. And the reason I'm doing that, because it's important for sustainability of the breeding programs that we normally roll out. Like the way I was saying, the Honorable has given out those animals. Will they be sustainable? Is it possible that women prefer a different type of intervention compared to men? Because that will then inform when we start collecting the information. This study is focusing at 2, if you can see at position 2, where we are trying to define a breeding goal. And then after that, we shall now get into data collection, information on phenotypes, family relationships, because this is important for us to identify these factors at the very onset. And then now we shall go all the way using all those steps, step by step, until we get now to dissemination, where we have the structure of our breeding program is set. If it is crossbreeding that we have decided, we can do it, and the schemes are clear. So on methodology, this study, the data I used for this study was collected by the Senegal Dairy Genetics Project. Remember, Senegal is, they are French speaking. So all the data was collected in a local language there. They are basically Fulani and Wolof. It was collected in Fulani and Wolof. So, and then sent to a server at ILRI. So I had to get the data and get into my analysis. But basically, it collected the data for 2 years. The data I analyzed for this study was on the baseline. But then there is my main objective, which is already published, I will share with you, where it was longitudinal, because the farmers had to be followed for 2 years for the data to be generated. But for this study, the one I'm presenting, I used the baseline because that had a lot of farmers. And then within the 2 years, some farmers dropped out. And we basically used questionnaires where we had to visit the farmers, and we collected data on the breeds. We used close-ended questionnaires because we first, the farmers were first visited and asked the type of breeds that they keep. So we had a list. We were again to talk to them on what traits they consider important on their farms. And then after that, we were again to follow up and ask them, the traits that you've listed, can you rank them? We gave them a rank of 1 to 12. You will see it in the results. And then after that is when now I got into the analysis. This is just what I've talked about, probably the number of men and women that I got the data from. If you look at that, yeah, you look at my sites. This is Africa and this is Senegal. I got my data from these, what we call departments. These are regions, the Thais region and the Dabel. These are departments. In Senegal, they are equal to what we can call now like constituencies. And then we just went inside to get data from at least 2 regions within that. And you can see Dakar is here. As in my introduction, I probably passed mentioning that the reason we are doing this is because Senegal at the moment is a net importer of milk. Currently, in the world ranking, it is number 76 when it comes to importation of milk. And you realize because of the location of Dakar on the ocean here, many of the imports tend to come from either the Americas. Currently, they are getting a lot of imports from France because they cannot sustain themselves. And then the government is really looking into doing a lot of research to be able to come up with a way they can bridge the deficit. And then now, after the data, as I've told you, I ran it using the R statistical package caught in 2021, and then used the chi-square with the Monte Carlo test just to get the chi-square, especially on the responses of men and women, to see if there were any associations. So on to my results. Basically, what these results told me is that both men and women prefer crosses as compared to either local cattle or exotic cattle. As I say, the local cattle there, we have the Zebu Maur, Zebu Gobra, and then we have the Jamen, and then the Dama. At least most of you, I'm sure you have heard about it. And then for the exotic ones, it's Holstein, then we have the Montbéliard, we have the Guzerat, which is basically a Brazilian cattle crossed with the Indian, and that is why we grouped them. In my first paper, where we genotyped is where we grouped them into those, onto those 3 categories of local, cross, and exotic. And you can see from the percentages of the respondents we got, we see 64 for female and 71 for crosses. We were not very interested in whether they had a moderate preference, low, or indifferent, but we have just tabled it because we have filtered the most important where our focus was. Yeah, we also went ahead to ask them, if you are preferring, let's say, a cross or an exotic or a local, what are the advantages that are associated with that particular breed? And I have filtered through just to get, we had about 19 traits of those particular breeds from which the list, those respondents could be able to select. And we found out that if you check like for male, for the locals, most of them are just saying that it's well adopted to the local conditions, and both male and female, they had very high percentages. But interesting to us was about this section here where you are seeing crosses are almost performing the same as exotic. And given the location of our sites where we chose the respondents, which has basically a lot of feed for these crosses, and these ones, these exotic cattle, which mainly were Holstein and Montbéliard, we found that, you see, crosses are almost competing. This is just for male is 87, this is 82, 94, and 82. The crosses are almost competing at equal values with exotic. And then when we came to just seeing if there are variations, because these I did replications using the Monte Carlo test, using the 10,000 replications, you realize there is, yes, some statistically significant difference, but when we come to this, it's not very major because we did it at a confidence level of 0.05 or 95% confidence level. Then we also checked if they said that they didn't like a particular breed because it had disadvantages. We gave them again a list of disadvantages because from the ones they had suggested, and there was basically no significant difference between males and females. But then again, you realize both male and female respondents in this setup had almost the same. All of them were saying crosses have a very high feed intake as a disadvantage, just the same as exotic cattle. Again, when they come talking about poor conditions, poor adaptation to local conditions, just the same. It was, which means crosses are equally, almost at the same level competing with exotic breeds. It's never now saying maybe if I keep a Holstein, it will perform better than if I kept an indigenous breed crossed with, let's say, a Holstein or something like that. Then we checked the importance of particular traits that were selected and the importance of dairy farms where we gave them a rank of 1 to 12. And most of the respondents were targeting, they were saying if there is a genetic improvement program that they are supposed to be instituted in their area, then it should target milk yield followed by live weight or size of the animal, which was very important because it still fits on the option they had for crosses, because at the end of the day, this project had to come up or was to suggest on what breeding objective or which traits, if the government has to improve milk production in this area, what traits are the traits of focus that can be suggested to be included in the breeding objective. And to my conclusions, or our conclusions, we realized that there was multiplicity, because even the traits I had projected there, we had a list of traits, and you realize there were even some farmers who still chose skin color as their number one trait out of the rank of 12. They were saying that, for us, we prefer skin color to be. So you realize that in setups where traditional pastoral systems are still dominant, there's usually multiplicity of trait preferences. You really find a spectrum of them, but then given that many of those respondents were ranking milk and the sizes of the animals very high, and probably number 3 was disease resistance, then this should be included when formulating the breeding objective for a potential dairy genetic improvement strategy. And then basically, again, this study just emphasizes the importance of obtaining feedback before rolling out a genetic improvement strategy, whichever, be it for dairy, be it for beef, for a particular people, because for these ones we did not find very significant differences between male and women. But if probably you did it somewhere for goats or chicken or another breed, you might find there are particular differences where whenever you are rolling out, you need probably to consider for the sustainability of the new genetic improvement program. And it is just our feeling that, again, more research has to be done, because remember, on the cycle, we are just at position 2. And given that this data was collected, again, around 2012, many other studies are still going on. And we hope, at least at the end of it all, once they've been put together, we can be able to help the Senegalese people. This is part of this study for my first objective, which is already published, which I looked at now, the longitudinal study of the whole system for the 2 years. I looked at data for the 2 years. So one interesting thing with that study is that it found out that if you keep, let's say, dairy animals on your farm, because we followed these animals for 2 years, at the end of 2 years, you might only find that you are getting probably, this study showed that they were getting on average just 21 US dollars, which is equivalent to 2,100, around 2,100 on a farm. Because we factored in labor, everything that goes into the dairy production system, because that data was collected. If you ever sold anything, or if you ever bought feed on a daily basis for each single day, if you milked a cow and you gave out milk or you gave it to a calf, we included it. And That is what it showed. The slide is gone, but I like to recognize and acknowledge Ilri, who gave me a graduate fellowship to carry out this research. I would also like to thank the farmers in Senegal, specifically in the regions of Thais and Dabel, who allowed me to use their data, and the Senegal Dairy Genetics Project for giving me an opportunity, again, to just use their data, and the University of Nairobi, where I'm a student. Thank you.
Thank you very much. Now, this name is what? Evaristo. I don't think there's anybody in Kenya called by that name. So thank you very much for that captivating presentation. At least we know that some people in this world still consider the color of the animal. And I think it's very important, the color of the animal, so that we don't lose it. So our next presenter is Edward Karaoke. Are you around? Yes, and you are going to give us a presentation with a very, very long title. It says, Investigating Compliance with Cow Comfort and Mastitis Control Recommendations on Mastitis Outcomes in Smallholder Dairy Farms in Central Kenya. So, karibu sana, Daktari.
Session Chair, can I make a comment before? Please.
Yes.
Yeah, and I think I would like to make an appeal on behalf of the members. I know they are tired and the knowledge absorption rate may have gone down. May I appeal to the presenters that are remaining to, if you can skip the methodology part and give the results, we'll be very happy. Or give it in a way that members can easily get, because I'm sure the absorption rate for new knowledge has gone down.
Is that true, members? Very true. Pardon? They just go to the conclusion. After the title, conclusion, recommendations. Okay, thank you.
Thanks a lot. I'm going to do actually that. Because we are going to the end, I'll just treat it as a cream of the cake, and I'll treat it just like that. So I'm going to give a presentation on investigating compliance with cow comfort and mastitis control recommendations and the subclinical mastitis outcomes in SDFs in Central Kenya. This was part of my master's degree project, and I did it together with co-authors there from University of Prince Edward Island in Canada, and also from the University of Nairobi, CSD. Okay, that's an overview, introduction, methodology, results. So this is what I'm going to talk about, and now I talk about it. So dairy sector in Kenya, that's an overview, a quick overview. It contributes to 6 to 7% of GDP, and smallholder farmers, who I'm going to call SDFs going forward, produce a significant major share of that. And what is the gap or the challenge in the challenge that we are going to try and tackle is low adoption rates of cow comfort and mastitis control protocols, partly due to knowledge and also even resources. So a brief introduction or breakdown of mastitis classification. So it can be classified based on the source, and based on the source, it can be the source of the infection. It can be environmental, or even it can be environmental, so depending on where the environment of the cow, and also it can be contagious. So means that the source of infection is an infected udder. Can also be classified depending on severity or depending on manifestation, which in that form it can be clinical, where there are changes in the udder or even in the milk, maybe the color or the consistency, or it can be called, it can occur as subclinical, where there are no changes in the udder, but there are changes in the milk which cannot be detected, but by CMT. It's going to be from an increased somatic cell count. The objectives were: 1, to assess compliance with the recommendations; 2, to assess the impacts of the compliance with the recommendations, and also to explore antimicrobial resistance from the isolated organisms. I'm not going to dwell so much on the methodology because it's captured quite in a graphical manner. So we recruited 114 farmers, and those we grouped them into intervention and control farms. You can see intervention had more farmers. That was intentional because it was guided from a previous study where we saw that the compliance from intervention farms is usually around 64% from a previous study. So we tried to allocate farmers in that ratio. And for intervention farmers, we gave recommendations. For control farmers, we didn't give recommendations on the first visit, but on the second one, we gave them recommendations. So after observing the difference between intervention farms, so that we just don't leave them as control farms even after the study. We appreciate them for being participants of the study. So we did CMT on all quarters, and on the first and second visit, we collected samples on quarters that had CMT of 2 and 3, and from those cultures we did culture, from those samples we did culture and identification, and also sensitivity at CSD. And we did also regression models to see associations with compliance and even with improvement in CMT or in subclinical mastitis status. Some of the recommendations we gave for cow comfort were such as neck rail positioning, brisket board positioning, stall floor status, leg space, adequate roofing, and also to check whether there are sharp edges and fix them. So we gave an average of 3.9 recommendations out of a list of 11. The 3.9 was ranging from 1 to 7, and compliance rate, compliance was, the screen is gone. Compliance was on average 2.1 for the given individual recommendations, but when we scored them on a percentage, for comfort recommendations, the compliance was about 50%. For mastitis control recommendations, those included but not limited to disinfecting the teats after milking, using individual udder towels, washing hands before, milking mastitic teats and cows last, and also the hygiene of the stall. So we gave on average 3.3 recommendations that pertained mastitis control, and the compliance for individual recommendations was on average 2.8 and a percentage of 77%. You see the compliance for mastitis is higher. This probably is because the farmers know or are aware of the ill effects of mastitis because they encounter it on a daily basis. So compliance was very high compared to cow comfort, which is a factor that is, or it is a concept that is yet to be very well adopted by farmers, and especially farmers in developing countries like Kenya. So these are graphs showing a histogram showing how compliance was like for the combined comfort and mastitis control. So it was an average of 63%, and we can see that majority of the farmers, there is like a split here at 40%. So majority of them are beyond 40. Only some of them, only a less proportion is below 40. So that is going to be significant because we didn't include these farmers. We didn't include these farmers in our modeling. Reason why is because using them in the model would definitely underestimate the benefit of compliance. So it would bring, not bring out the full benefit of compliance with the recommendations given. The results, this was a logistic regression. that we tried and to see the association between all the factors driving compliance. So one of them is the type of recommendation. By type, I mean major or minor. And by major or minor, it means the amount of input that is required to finish those recommendations. And you see that this is supposed to be 13.6 after the reference supposed to be 13.6 in the minor. So minor recommendations had higher rates of compliance or higher odds of compliance compared to major ones. And it was highly significant. The number of recommendations, of course, this was a continuous variable. It means that for each additional recommendations given, there was a decline by 2% in compliance, and that also was highly significant. Another logistic regression, it looked at whether the factors that were driving a quota being worse on the second visit. How we did that, we looked at quotas 1 and 0, quotas that had CMT of 1 and 0, and we are looking, is the CMT1 becoming a 0 in the second visit, or is a 1 becoming a 0 so that it is worse, or is a 0 remaining a 0 so that we can call that an improvement still, or not worse. So we found that the principal farmer is the farmer that was involved in most of the operations of the farm, and we found that being a lady as compared to the man, being a woman or having an employee or any other person other than the man or the woman of the house, reduce the odds of having a worse quota. So it means that having a lady or another person on the farm, mastitis status was better on the second visit. And age group of the farmer, those that had farmers that were more than 50 years of age had lower odds of having a worse quota. So means farmers that were more than 50 years were doing better in terms of compliance and in terms of having better quotas. Why we thought, the reason we thought that was a driver, or we tried to look why would that be, and we thought that farmers that were more than 50 were mostly retired, and they were giving the dairy venture or the dairy enterprise a lot of attention, as compared to those who are younger or less than 50, that mostly are engaged in other activities, so they are not giving as much attention to the dairy enterprise. So compliance becomes less, or mastitis control becomes less effective. Antibiotic resistance. I want to make a reference to one of the presenters on the first day that talked about Sir Alexander Fleming, and he said that there will be a day when penicillin will no longer be effective. I didn't know he was going to say that, but as you can see, there was 100% resistance from the isolates that we had. There was still another presenter who said that I think gentamicin should be used as a reserve drug. And you see, this evidence, 100% susceptible for all the organisms that we worked with. And for a friend here who is very much misused, and I would say by the grace of God, it's still effective because there's not much resistance, but tetracycline, as most of you will understand, it has been misused quite a lot. And we often hear of tetracycline deficiency, and that is not very good. And to note also that all the isolates that we got were S. aureus, Staphylococcus aureus, so all these are results from Staph aureus. So in conclusion, farm-specific cow comfort mastitis and mastitis control and cow comfort and mastitis control management recommendations are beneficial and are efficient in reducing mastitis or in reducing the incidence of mastitis in SDFs. Again,
fewer recommendations given at a time can improve compliance. And as is one of the themes was gender, you can see that we've demonstrated there that women are doing a good work in management of dairy enterprises and in reducing the incidence of mastitis. And the ripple effect is that they are going to aid in or less usage of antibiotics. So that is a thumbs up to the ladies that participated, and it is also an informer. And also high resistance for penicillins, so that one should guide practitioners on the choice of treatment, and it should also guide us as a profession going forward. I'd like to acknowledge these partners that made the study successful. Thanks to all of them. We won't read them out because they are clear. And thanks all for listening to the presentation.
Thank you very much, Daktari, for that short presentation. And as we make it short, I hope, Dr. Gutu, you are here. And therefore, the board and the CPDs, I don't know whether that will reduce some of our CPDs today, because we have said we only want heading, introduction, then conclusion. So our next presenter is Buko Wako. Is Buko Wako here? Oh, there she is. So she's going to give us a presentation on capacitating One Health in Eastern and Southern Africa, building the future One Health workforce. So karibu Daktari.
Good evening. My name is Buke Yusuf Wako. I work with International Livestock Research Institute. I'm a veterinarian by profession, and I will be presenting on building the future One Health workforce in Eastern and Southern Africa, which is a small component of a larger project called COHISA, standing for Capacitating One Health in Eastern and Southern Africa. I know we had one of my colleagues presenting on One Health yesterday, so I won't focus so much on definitions. I'm sure all of us understand One Health. So as a project, COHISA, it recognizes the complex nature of One Health challenges, and it is working to implement a collaborative and a multidisciplinary approach that will achieve which aims to generate an inclusive research and innovation ecosystem while facilitating rapid uptake, adoption, and adoption of solutions to One Health issues. I will just to give you a context, I'm just going to do a bit of overview of the project. So this is the design of the project. It's a 4-year project implemented in 11 countries. Those are Eastern and Southern Africa, and it's being led through a consortium of 3 agencies led by ILRI. We have CIRAD, they have more footing in Southern Africa, and ISA. These are the work packages and how the project is being implemented. I will be focusing, my presentation will be mostly focusing on work package 3, but I'll just give a bit of details on the other work packages. We have work package 1, which aims to understand One Health capacity. And this is basically trying to understand the gaps, the strength, and some of the challenges of One Health status, and looking at focusing on 4 themes: One Health research, innovation, One Health education, One Health governance, and One Health implementation. And then we have work package 2, which is mostly looking at advocacy and governance. So it will try to facilitate cross-sectoral collaboration and working together of ministries and other organizations that have One Health mandate. And then we have work package 3, and this is where my presentation will mostly focus on, and this is the building the future One Health workforce. And then we have the last work package 4, and this is the delivery of One Health solutions. So this is the actual implementation of the One Health solutions, and it is being informed by the first 3 work packages. And then, so the project uses a design whereby in each country we have an in-country multiplier. This is where the project is being led by the consortium agencies, but it is being delivered by the in-country multipliers. So for example, in Kenya, we have University of Nairobi, led by Professor Salombe Bukachi and the team. And then we have these other countries I don't think I need to mention at the moment. And this is where I'm gonna focus on the work package 3, which aims to understand the educational needs, looking at One Health, where there will be a lot of studies to understand the gaps in One Health education and how to fill these gaps and integration of One Health into the already existing curriculum. Then we have benchmarking. So there will be benchmarking, and this is discussion between stakeholders. We have technical working groups. We have Inter-University Council of Eastern Africa, who are mandated and are involved in curriculum development and in Higher Education Institute. Then we have One Health capacity building material, and this is whereby by collecting data, you do understand what is already existing, because there's a lot of already existing One Health material. So basically, this is just harmonizing all these information and having a database that will assist students in selecting courses related to One Health. And then we have One Health outreach, and this is outreach where now you target the final beneficiaries, maybe the communities. You can be looking at primary and secondary school students. Dr. Paris did mention something about something like rabies, where a lot of, there's high dog bites in boys below 15 years. And this is where now there is need for outreach, teaching on One Health, and really focusing on primary and secondary school students. And these are mostly beneficiaries who are in contact with these animals. So with the aim of this, to promote and build a future One Health workforce, we did conduct a survey in all the 11 countries. So it's called One Health Higher Education Institute survey. It is currently ongoing. It's at the data analysis phase. And the objectives of this study was basically trying to understand what courses are currently being offered by Higher Education Institute in Eastern and Southern Africa, looking at courses with One Health elements. And there were additional there were additional data that was collected during the survey. And these were something like, we have the technical One Health, technical and cross-cutting competencies. Just to give context, competency is a proven ability to have and apply a skill. So an example will be, One Health competence will be having the epidemiological skills and being able to apply it in real life. Or having teamwork and collaboration skills and being able to apply it. Being able to work with different departments. So that is competency. So this is what we were also looking at. We were looking for such data. Are these competencies, are they needed? And these competencies, I will present on them, but these competencies were gotten through a literature review, and then went through evaluation through a tool called eDelphi, just to evaluate if they are necessary in Eastern and South, if they are relevant in Eastern and Southern Africa region. The other data that we did collect was enrollment and employability of graduates. Because if you have a graduate with a One Health qualification, does their chance of being employed, does it increase? Does it remain the same? Or does it even become harder for them to get employment? And then the other thing was institutional needs. If we were to initiate a One Health course, either a short course or a long course, what will be the resources needed for this, as well as initiating a course, what is the process of developing a curriculum and benchmarking what are the processes, what is the duration. So typically, how long will it take to initiate a short course or a long course at a higher education institute? Methodology, I'm just gonna give a brief. So on methodology, we got a list of the higher education institute that should participate in this survey through snowballing and One Health expert in the respective countries. So you'll have Professor Bukachi in Kenya with her team providing a list of higher education institute that they feel should participate in such a survey. And then we did conduct a virtual, all the interviews were virtually conducted. We developed a questionnaire and administered to the respondents and provided them about 1 or 2 weeks to complete it. It is a very consultative questionnaire that was requesting for both personal perspective, personal perceptions, as well as institutional information. We had the ethical approval from ILRI IREC. Currently, we are doing the data analysis, and we did the data analysis was via coding to evaluate for themes. So basically, the proportions of the respondents were used to present some of this qualitative data that I'm going to present here. I'm going to present a bit on Kenya, and then we have validation. The other step was validation of the results through AfroHoon. Or share previously. So we know they are key stakeholder in One Health education. So they were one of the stakeholders that were used to validate some of these results in terms of saturation of the responses and the institutions involved in this. This is just basically the number of institutions that were targeted for this survey, the number of interviews done, and the higher education, the submitted questionnaire. So all this information came from 27 institutions in the 11 countries. Interviews were done, so we had multiple participants from different institutions because we have different departments in a single institution that are involved in One Health. And then, so this is results for Kenya, and this is looking at technical One Health competence. And if you look at, I hope it's visible, I'm just gonna mention the highly reported competencies that the respondents and the experts that were involved in this survey felt that were really essential for One Health training. So we have One Health principles, we have epidemiology, and we have climate change and One Health that were rated as 100% essential. So if you look at this table, the horizontal axis is basically a scale of 0 to 100%, and then the vertical one are the technical competencies that are needed. And then the orange ones are the essential. We have the blue color being desirable, and the gray color being optional. So you can see the three having been reported to be the highly essential competence in One Health training. And then we have cross-cutting competencies. And if you look at the cross-cutting competencies, we have systems thinking that was highly ranked. We have data management, we have collaboration, we have communication, and we have advocacy. These were highly reported to be really essential in One Health training. And then we look at, so what does this mean? From these two data, what it means is both the technical and the cross-cutting competencies are key in building the future One Health workforce, as well as the trainers of the students to be able to deliver One Health solutions, and as well as enhance across sectoral collaboration. And so what are the next steps from these findings? So one of the steps is we use the proposed competencies to define what should be considered in benchmarking process. And this is something that has already begun through discussion between technical working group experts, the IUCEA, and consultation with stakeholders. And we are asking, at what level should One Health be taught? Is it at an undergraduate level? Is it at a master's level? Is it at PhD level? And if it is taught, what exactly is being taught? So these data informs that, it guides on that. And the team felt it was prudent to start at a master's level course, because to be an One Health expert, you have to be technical in something. You can be technical in animal health. You could be technical in human health. But you have to have a background in a technical field for you to build, for you to have, to undergo now the cross-cutting competencies. And that's why at a master's level makes more sense, because you have a foundation. You already have a technical knowledge, and you're just building more on it, and the cross-cutting competencies can really bind. You have the technical and gives you collaboration between collaborative skills with other departments. You're from vet, you get to have skills to collaborate with colleagues from medic and environment. The other conclusion is this data is something that can be used for future, in the future. And this in terms of when you're developing a program, academic program. This is a data that can be used to understand what is already existing and what needs to be developed to avoid stakeholders reinventing the wheel every time and duplicating efforts. And then we have the last step, which is implement the survey in East African countries not included in COHISA. So we have an example of Burundi and the rest. Thank you very much. That is the end of my presentation. I'd just like to...
Thank you very much for that wonderful presentation, and I can see people are very attentive. Now we can have the presenters here, the three of them. So let me get the three presenters questioning. We'll get to let them sort that out. Yeah? The three presenters, I think 3 questions would be adequate. What do you think? Questions?
Yeah. Thank you so much, the presenters. And my question goes to Dr. Yusuf. I think this is a very informative work. The report that will come from your work will be very informative on strengthening One Health platforms moving forward. However, I beg to differ because I know I was not in this, I did not respond to your questions. I was not part of the target group. But we are seeing that we started off quite strongly as a country in One Health. But it looks like we've lost the momentum. And we also realize that maybe the cross-cutting skills is what is making us not very strong in One Health. We are not able to strengthen One Health because we are not very good in advocacy and maybe communication, collaboration. And we were challenged here as vets, we need to speak and talk and present our case. That is said. But I would also want to request that please consider among your options, at what stage do we introduce One Health? It might not be the technical One Health, but the concept of One Health. The issue of rabies as a disease, the issue of anthrax as a disease, Rift Valley fever. Can we start introducing this at the primary level so that the school-going pupil in class 2 or 3 knows that rabies can affect animals, and it can also affect me. And for me to be able to prevent rabies, I need to vaccinate my dog against rabies. And if I see a case of rabies behaving or doing anything strange that is normal, not normal of a dog's behavior, I need to report to the vet authorities. So please consider that. And I know Dr. Salome Bukachi knows that quite well. Thank you.
Another question?
Thank you very much, Evaristo. I looked at the data you presented and I begged to find out what was the language of the interview, what were the relative literacy levels, and because this is the results gotten from the ladies does reflect very low on traits which are considerable to be positive. And if you go to the next slide of the data that you presented, it does not seem to be coherent with the first set of data. So I'm just interested to know whether the ladies did not understand the questions, and then the other one is, why would we call those pastoral cattle dairy?
Any other burning question?
Thank you. Thank you to the presenters. Those were very powerful presentations and very catchy. Just something that struck me, and that's from the last presenter, Wako, with regard to One Health. In Kenya, we understand it as an approach. But from the presentation, it looks like it's an issue that is standalone, and it's a problem that needs to be solved. So I need to get your perception or understanding in regard to whether is it an approach, or is it a concept, or is it something that is tangibly standing out to that effect. Why do I say that? We have different issues that have required a One Health approach. One is the zoonotic diseases. Those ones have been tackled using a One Health approach. We don't have a problem with the approach. The other one is AMR. It's an issue that has called upon us to use the One Health approach in dealing with that. The other one is food safety. It's an issue that has drawn us to use the One Health approach. And I remain to wonder, is it the approach that is the issue? And from the presentation, it looks like something that needs to be discerned. So please look at that, and if we are wrong, we need to be corrected. Because I was just Googling, and from the various definitions, it says One Health is a collaborative, multi-sectoral, and transdisciplinary approach working at local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animal, plant, and their shared environment. So I remain to wonder whether are we passing the right message in defining this as a problem, yet it's actually an approach. Thank you.
My question is again to Bo Waku. I saw a recommendation in which you are indicating that you'd like to have the One Health course. I just wanted to communicate to the audience that, and KVB is here, that One Health as a course is a required course, and it has been a requirement, Dr. Gutu. It's been a requirement for certificate, diploma, and degree and veterinary medicine programs. I think for as long as 2013, it's been a while. Yeah, so the new curricula in all the universities are required to offer a 45-hour course in One Health. So I also have, I think that's a way of communication. So there's concurrence in your recommendation, but the country and the universities have actually gone ahead to do what you're now recommending. I also would like to observe incongruence or lack of coherence with the outfit that is referred to as CO One Health. There is, of course, with One Health, no one owns it, but for it to be effective, it needs to be coherent. So that in the continent of Asia, there is a Siaohun. In Africa, we have the Afrohun, Africa Universities Network. And I think it will be an invitation, which has about 11 countries involved. And as I was saying, that Kenya, the Dean of the University Faculty of Veterinary Medicine is a hosting country, hosting the country One Health network, and hosting the Africa network, as it were, for this season. So if we have One Health initiatives, DSU, the ministry has an initiative, the universities have an initiative, your outfit has an initiative, and I'm sure that there is another one in Africa. How are we going to implement this One Health? Is there an opportunity for us to work together? Thank you.
Thank you very much. I think we are going to let the presenters answer those questions. We start with Bob.
Yes. Yes, to the gentleman, I can't remember your name, but what you asked, I think I've documented it in my first paper, that this data was collected in local Wolof language. Then because the translators, the enumerators were Senegalese, they then translated it to French. My access to this data was in French. But again, because I was getting it from the server at ILRI, again, I had to translate. And then on the education levels, again, which is in my first paper, if you happen to have a view, because basically Senegalese around Dakar are Muslims, and it showed that around 72% only had Quranic education levels. I checked post-primary, primary, and most of them, up to almost 72, just had Quranic. And I believe probably that is where, for Muslim setups of that kind, probably that is where many, maybe female gender or women will fall. But then at that level, I did not disaggregate to check out what was the education level of women and then men. On why we will call this dairy, I think it's subjective, because that is all they have. That is what they have at the moment. And if you get to read a lot of the matrix about what surrounds the data, is that these guys have started now intensifying, and companies, especially from other countries, are coming in, and intensification is taking shape. So they are using what is on ground, because these local cattle are the ones now supplying the dairy cooperatives that have been set in. And the government is really trying to begin from what they have before. They have already started initiatives of subsidized semen and stuff, looking forward to setting like what we will call our CAGRIC. So they are in that process. Thank you.
Thank you for all the questions. I will try to answer all the questions in the order that they were asked, and I'll start with the first one, which I think was more of a suggestion than a question, and that was a good one. And what I did present on was just a small section of a broader work package with many activities. And one of the activities, I know one of the main things that you mentioned is education at the lower levels, like early training. And this is something we are working on and building on another project that was conducted in Central, where they will have integration of One Health. One Health, if I may call them One Health principles, but in a more simpler way for consumption at the primary level. This is something that has been conducted in primary level in central region, where you will have a module, but we do understand the curriculum also, change of curriculum takes a really, so this will involve like teaching teachers on the basics of One Health, maybe safety measures that they can teach to students, to their pupils and students, and this will focus mostly on measures that are cross-cutting. If you look at zoonotic diseases, if you look at food safety, a lot of these measures are cross-cutting. Something like washing your hands, maybe putting on a bit of PPE. Those are cross-cutting, and those are things we are focusing on that. Maybe I have not presented on that, but maybe in future, if I do get a chance, or my colleagues get a chance, they can present on that. The other one is One Health. Is it an approach? Is it a discipline? Is it a problem? This is a discussion that will never end if we open it, and we've had the same discussions among experts who say you cannot teach like One Health. It is just an approach. It is not a discipline. It is not a problem. It's an approach to solve problems. But you can't say there is One Health issue or One Health challenge, but it is One Health approach that is used to. So the discussions have been there, and in terms of curriculum, introduction of it is not introduction of teaching One Health, but one of the gaps that was seen is practitioners or even students or experts would have the technical bit, but the challenge will be something like Rift Valley. If there is an outbreak, we do have the technical knowledge on handling Rift Valley outbreak, but you find vets, we do a good budget, we get technical staff, and we go. But no one looks at the aspect of how has it affected humans? What is the role of environment in these zoonotic disease outbreak? And basically, when we are looking at curriculum development around One Health, is promoting that cross-cutting competence that will allow us to apply One Health. How to work with another department, how to communicate these scientific findings that we do our amazing research on, and we just publish and leave it there. It doesn't get to the policymakers that in a simple way where they can make policies around zoonotic diseases, around AMR, around food safety, environmental pollution, climate change. And I know the discussion is still there, it is still open. And one of the one of the outputs of meetings with IUCEA, One Health experts, was you cannot teach One Health, you can just benchmark, and teach on One Health principles and build it with cross-cutting competencies that is lacking in the technical personnel. I don't know if I did answer your question. It's a very long discussion. Until now, we have experts who still believe it's not a discipline. You cannot teach it. And then Professor Mande, so the data that I did present, I presented the figures were just for Kenya, but the conclusions and the next steps were for all the COHISA countries. So luckily for Kenya, Kenya is very advanced in One Health, even in terms of platform, in terms of education, in terms of governance. So maybe that is something I did not indicate, but some of the steps you feel like it's a replication, it really is a reflection on other countries, not necessarily for Kenya. Because I know in Kenya we have University of Nairobi, specifically, but we do have other institutions, like Kenyatta University, that offer One Health sort of related, but not with that name. So maybe a replication of the same of what is happening in UON, if it works in these other institutions. Yeah, I hope I've answered all the questions.
Thank you very much. You can see how science can confuse humans. And we continue going round and round and round. Please give them a round of applause. Thank you very much. Now, there are posters that were presented out there, and I do believe that most of us interacted with them. However, let's just give the two people to give us the insights of what they were presenting about, then we close, okay? So we have Professor Warairu. So he's going to give us an insight on what is happening with the common parasites affecting farmed tilapia and catfish in central Kenya.
Good evening, everyone. I want to talk about training and research activities at our Faculty of Veterinary Medicine, more so in the Department of Vet Pathology. And our interest is on aquatic animal health. Most of us, the older generation, we were not trained anything on fish. And I acknowledge Alan is here. He was the first to organize a training, 3 days training on fish health way back in 2014. And I really appreciate it because that's when I started getting exposed. And of course, you know my name. And as far as training is concerned, in the new curriculum, which is currently operational, which actually, we started it in 2013, we are now teaching aquatic health in BVM 3 and 4. We have a course known as JPM 354, and the course continues to 4th year, JPM 451, and Kinamodoni will be going for an academic trip next week to learn more on opening of fish at Sagana Aquaculture Center. We also have a BSc course, which is actually fisheries and aquaculture, and this course is not doing very well. We have been requested by the Dean to restructure this course and include health management. So I'm part of the committee, I'm a committee member of developing this new course, and we are progressing well with my other colleagues. For postgraduate programs, we are doing very well. We have an MSc in vet pathology, microbiology, and parasitology with fish science option. So we encourage you members who are in the field and elsewhere, you can come and do even a PhD or MSc in fishery. And we have a very strong team in the department and elsewhere. You can see most of you have come across these members here, but we have Professor Maina, who is the nutritionist, doing very well. She actually have done a lot in fish, and we have up and coming members of staff, like for Dr. Molei did his PhD the other day on fish viruses. We have Daniel Wanja, who is a PhD student and very good in bacteriology. And also we have got collaborators from elsewhere. And we are being funded by NORAD mainly, and we had also some funding from USAID, and we collaborate especially with Directorate of Veterinary Services and others, even Egerton and Masai Mara. We have donated some of the students who have finished their programs. So far, we have actually supervised to completion about 7 students, and 2 of these are in vet labs, that is Madenge and Wairia. And for the PhDs, we have 3 students, actually members who have actually graduated, and 1 is at Egerton, and we have another student, another officer who is at Pwani University, and of course, one of our own, Dr. Molei. We have very many areas where we can do research, and we are encouraged to join us. So far, we started with baseline surveys. Oh my God. Baseline surveys, even actually identifying these parasites up to genus level, but we have not gone to species level. And we need to encourage you to come and actually now go into deeper investigations. For example, using molecular tools to identify and characterize etiological agents of various diseases. And of course, supervisors are available. The take-home message which I want to give you is we are developing short courses for county officers, even those in national government, to be trained on fish health. And the first county to benefit from this course will be from Nyandarua, and they'll be coming in May. And it is a 1-week course where we shall request members of the Department of Anatomy and Physiology to talk about fish anatomy and physiology. Then others in pathology in our department will talk about various etiological agents and diagnostic techniques. Because the issue here is we do not have diagnostic skills of actually collection of specimens, analysis of fish diseases. And that is what we are going to offer. And kindly use the facilities we have at Kabete, and of course the personnel we are developing. And just need to send to ask us to prepare a budget for a particular county where you come to Kabete for at least on-hand training on the detection of various parasites, ectoparasites and others, plus any other condition. And thank you very much. These are former MSc students. This is Wairia, who is in epidemiology, and Kazia Maina, who is in Thika County. Asanteni sana.
Thank you very much, Prof. And think
Thank you very much, my teacher and lecturer.
Thank you.
I'm just wondering how effective 1 week will be for people to get knowledge that they can implement. Would you consider hybrid so that they just come back for a refresher, so that they'll add value?
Yeah, it is possible, so long you pay. Yeah?
So long as we are able to pay, and there is, thank you very much for that enlightenment, and I think that course is going to help us attain which sustainable development goal? Which one? There's one major in aquatic. Life above water, life below. That is sustainable development goal number 14. Yeah, where you are supposed to conserve and use the life below to attain that sustainable development goal. So our last, we'll give somebody who was talking about another poster. Okay, give us your highlight.
Okay, so I'm very honored to be the last presenter, and I promise you I won't take a long time. Yeah, so nimekuwa kitinda mimba kwenye KVA this year. Yeah, so my name is Dr. Paul Samson Buyugu, and I'm a vet research officer working for the Tanzania Veterinary Laboratory Agency, but also I work for the University of Glasgow. And for today, I'm going to present part of our project, which is called Combating African Animal Trypanosomiasis, which is an integrated approach to tackling drug resistance. And so for today, I'm just going to talk about one objective of our project, and that is investigating the farmer-led use of trypanosides that was administered in Tanzania, specifically in Serengeti district. So we all know that African animal trypanosomiasis is a protozoan disease, and it poses a great challenge to livestock development, but also to food security. And the main objective of this project was to quantify the reasons for treatment failure. And it is well known that it is known that I can say that there is a notion, or there is information from the researchers that the trypanosides are not working. And in Tanzania, it has been evidenced that the trypanoside are not working. So this project was to look about on what are the reasons. Is the drug resistance the reason for treatment failure, or maybe the misuse of the drugs? So we all know that there are two main ways of controlling this disease. The predominant farmers-led, and there are those which need the government or the central coordination. So for our project, we looked on this side, and to be specific, we looked on the administration of prophylactic drugs and curative drugs. And therefore, our project, what I'm going to present, I said, is just a small part of the big project. So our project had three components to deal with. We had the field work. We also had the lab work, but also we have the modeling work. So I'm just going to talk about this part where we did an observational study, and we finalized by the controlled field trial. And therefore, this study was done in Serengeti district, and I should not talk more about that. But just to let you know on how we did, we selected 20 or 21 farms from the Serengeti, close to the Serengeti National Park. And these farms that were selected, we had the inclusion criteria, which the farm should have more than 30 cattle, but Also, there should be a high report use of trypanoside in that place, but also the farms that the cattle are always in contact with the wild animals. And therefore, what we did is, in here, you can see what we did for those 30 cattle in each farm. So we enrolled 30 cattle, we ear tagged them to identify them, and so for a 1 year long period, whenever a farmer wanted to treat any of these cattle with the trypanoside, he was calling us that I want to treat my cattle tomorrow, today, or now. So we were just going direct, and what we were doing is we were doing physical examination of the animal, and also at the time of treatment. And also we are observing everything that a farmer was doing. Of course, the farmers treat the animals on their own in that place in Serengeti district. So we are observing what they were doing. So at the day 0 when they were treating, so we were taking blood sample before the animal was injected the drug. And then we are making a follow-up for 1 week and 4 weeks if diminazine or medium was used. But we went further for 8 and 12 weeks if isometamedium was used. We know that isometamedium is protective for about 3 months. So that is how we did. But just the study area, this is Serengeti National Park. And this is some of the wildlife conservation areas like the game reserves. And the black dots are the farms that we conducted our study. So this is just the farm description, and I think it's not very much important. And just to go to the results, I'll talk about the trypanoside use. And so within that period of time, you can see that we 295 trypanoside doses were initiated, and the incidence of trypanoside administration was 0.74. And you can see now on the graph that isometamedium was high. There were more doses of isometamedium that were used, but also followed by diminazine, but followed by the cocktail, not the yesterday's cocktail. Yeah, so here, the cocktail of isometamedium and homedium, but also homedium, then another cocktail of isometamedium and diminazine. So the farmers were combining those drugs. So the other finding that we saw in this study is we looked at the treatment reasons and the trypanoside used, that why the farmers were treating the animals. Were they treating if the animal was sick or just for prophylaxis? So you can see that for diminazine, most farmers were treating sick animals. They were treating the animals that they said they were sick. But at that time, I was also examining those animals. And in most cases, many animals were not showing the clinical signs for trips, but they were using diminazine to treat sick animals. But you can see on isometamedium, of course, the large number of farmers used isometamedium as prophylaxis. But just look at the homedium, there are also some that used for prophylaxis. So another important thing here, you can see a small percent of farmers were using diminazine, which is a curative drug for prevention or for prophylaxis. So maybe the other important thing is on treatment doses. You can see we are also observing, recording the doses. So we are weighing the animal and comparing with how much the drug was injected. Was it right or not? So you can see here, very important, that many farmers in isometer medium were underdosing the drug. Many farmers in isometer medium were underdosing the drug as compared to other drugs. But also, many farmers in isomedium were overdosing the drug. But for the adequate dose, you can see that almost many were using were giving adequate dose. So, okay, so the other last thing that on our research, we also looked at the adequate treatment, that was the drug adequately given, and in this we combined several things: the route of administration, or the route of administration proper, but also was the drug competently administered, but also were the drug storage proper or not, and so you can see. But also we also looked at the trypanoside dose, that was the dose given right. So in cumulative, after combining all these factors, so we came to see that only 52% of the trypanosides were given adequately, and you can see the large proportion also, or the 48% was not given adequately. So the trypanosome species detected here, we took 188 samples for PCR testing, and what we observed, you can see that there are 3 species that we detected, and this one, T. congolens, was the most predominant, followed by T. vavax, and then T. brucei. And then the important thing here, you can see there were 8 co-infection cases where 3 animals were infected by with T. brucei and congolens, but also 5 infected by T. congolens and T. vavax. So there was also co-infection. Okay, so on the results, the final slide is on prevalence. So you can see that there was a very small prevalence percentage of sick animals. I think you can observe. For the cattle that were treated, the farmer said that these cattle were sick. You can see that all the treated cattle, only 36%, they were positive by PCR, only 36%. But also, you can see the large number were not sick, were not positive. So they were given trypanoside, but they were not sick. So you can also see on the prophylaxis that these cattle were given prophylaxis, but yet they were sick, some of the animals. So here we can say that there is a need of diagnostic tools to be enforced to the field, because 64% of animals that were get to be sick, they were not sick, yet they were given trypanoside. So in our discussion, as I talked about this one, so we need diagnostic tools at least to make sure that we save. Yes, thank you. Yeah. So we also know, I also said about this percent. So there is a need of education, because underdosing was very common, but also improper administration. So we observed some of the isometer medium being given through nose and through oral, through the mouth. So it's like drenching. So that's what I can say. So just to conclude, I said that trypanosides are very important in the control of African animal trypanosomiasis. But of course, the farmers need to be trained, to be given education on the proper use of drugs in order to make sure that we avoid the drug resistance. But also diagnostic tools should be enforced. Yes, so maybe I can stop here, but we went further for drug resistance quantification, and we have just finished it, and we have the preliminary results, and hopefully next time we can present. Okay, thank you very much. Asanteni sana.
So thank you very much. You agree with me that it was very captivating, and you can see the listeners were very attentive. And with that, there's a poster on that, and I believe you have many questions. So you are going to interact with him outside, and I think he has many more information to give on trips. So with that, I think you can clap for me. Thank you very much. And I'm honored to invite the chairman of Kenya Veterinary Association to close for us this session, the conference.
Hamjambo wote. I want to thank you all for your patience for the last three days. And I just want to announce the attendance. Physical and online attendance. On 26th, we had 240 physical attendance and 82 online attendance, a total of 322. On 27th, we had 230 physical and 105 online. Total of 335. And today we've had 215 physical and 162 online. I think the ones who left physically, they joined online. So we've not lost attendance. That's very interesting. I want to apologize for any discomfort you've had, because I know some of you even carried laptops, you've not been able to use them. It was just done here, so yeah, the poster has already generated some heat. Yeah, I think we missed the government. We missed the government in that poster. It was just made when we are sitting here, so I think. Yes. You're making me uncomfortable now, because I understand GOK is missing there. I can do nothing about it now. I can only say I'm sorry for that. In the other posters, GOK has been there. Okay? So it's just an omission. And now one says I should say a serious omission. Now, seriously. Anyway, I was saying that I'm sorry for any discomfort because of the venue, because I know most of you probably expected a setup where you have tables and chairs and you are able to write comfortably. But because we could not get a venue that can be as comfortable as we would have wished, because remember, other conferences we've been having that kind of a setup. So I'm sorry for that. For the posters, and I think also the posters are not at the poster owners might not be comfortable with where they have been put and the way they have been set. because even in our planning, we never visualized that, even when we came to see the venue. And that was an oversight on our side on how the posters should be set. So I think in the next conference, we'll have a better space for posters where the owners of the posters can be able to explain to the delegates about their findings and their researches. So that one is an apology I'm giving. An announcement that I have is that this hotel will be having a live band today. For the people who want to enjoy live band like yesterday, there'll be another live band today. So you can enjoy a different variety. Another announcement is that from our AGM yesterday, our next AGM will be in Eastern. The Eastern branch will be our host. So we start preparing our mindset. The venue will be disclosed over time. The other thing is that the book of abstracts, I hope Kipyegoni will work on it for this conference, and we have an e-copy of the same so that those who want to download can download and have a copy. Also, we will work on e-certificates for the participants of this conference, which I think should be availed within the shortest time possible. For tomorrow, we'll be having a procession band. We'll be having a procession band which will begin, they'll be here by 7 a.m. Then we'll have a procession around the town that will culminate at the Bukongo Stadium, where we'll board vehicles going to different sites. So we'll arrange, in the morning, we'll come here and register, and then you'll know which group you belong to. So when we finish the procession, you'll disperse to the site that you've been allocated. The activities that we'll have, of course, are surgeries, and I've seen Keskawa team is already around. Vaccinations, we'll vaccinate against rabies and black quarter. We'll do dewormings and treatment of clinical cases. Tomorrow, the president will be around Malava sub-county, so we might not have a guest. But to keep us entertained, I'm working on how to get Isukuti. Who knows Isukuti? Yeah, the guy is just waiting for me to clinch a deal with him, and then tomorrow, those who want to dance can dance Isukuti. It's good. It's good. It will be good. It's good. So our partners were 32 in number, and I'm apologizing for the GOK. I think it's a serious omission. Let me use the term. But those are our partners. And notable one is a doctor. You see, this is the only partner who has no logo, but Dr. Orod. And I think he should look for a logo now. I'll tell him to look for a logo. and this band, the band was called what? Barmango, yeah? I don't know the meaning, but it was a good band. So I want to thank you all for your patience, for your attendance, for all that you've done. And we've not had any incident of theft or sickness. So I think Kamega is good for people. And we'll give you the Isugut tomorrow to dance to it. Otherwise, I want to declare this conference closed, and may you enjoy your evening. Thank you.